This is a big polyp in the nose. Now, next one. So, polyp are of two types. Enteroconal polyp was the MCQ of July paper. This came in mixed polyp. Well, good morning, everyone. Am I visible? Can you hear me? Please confirm in the Telegram. Okay, sure. So, good morning, everyone, and wish you happy Navratras. Let's pray today. May we all pass the exam. May our hard work be blessed, and may we do a lot of hard work, and may we get the blessings, and we all pass the examination. And that's the biggest thing right now in our mind, your mind, our mind, as faculties also, that whosoever comes in contact with us through the platform, they should make this exam and they should start the clinical life actually in the country. So let's start this class with the prayer in our hearts that may we all pass, may I pass, may my friends also pass the examination. Okay. Now, next one. Is the audio video okay? Just write down audio video okay. AV okay. Write down. AV okay. Audio visual okay. Everyone. Audio visual is okay? Yeah. Okay. Sure. Now, let us start the second part of the notes today. Yes, thank you very much. Good morning again. Good morning, everyone. And so finally, we won the match yesterday. And I'm sure you would have really seen the highlights, I'm sure. And you will also win this match. You know what? Think like that India has made it, we'll also make it. All good? Okay. Nasal polyp. First of all, polyp. On examination, how would the question be drafted? The polyp was asked, the third question of nose was polyp. First question was corneal atresia, second bullac modalis, third nasal polyp. Okay. Now examination, it's a grayish, soft nasal mass. Okay. Grayish soft nasal mass does not bleed to touch. When you touch it, it's very soft and it does not bleed to touch. It does not bleed to touch. Can you read? Polyps have no epistaxis. If the MCQ has the nasal mass and there's epistaxis, it cannot be polyp. Let's learn from how to rule out that how we will reach the diagnosis of polyp. This time third question was of polyp. Polyps never bleed bitter. If MCQ is saying the word epistaxis also, it cannot be polyp. It can be some tumor, some other infection, something like that. But okay. Now, second circle. Too much of edema makes polyp. Too much of edema makes polyp. Too much of edema. When edema is too much, it starts hanging, it's polyp. Too much of edema makes a polyp. Put chronic inflammation, basic cause of polyp. Why polyp form? At the end of the day, basic cause of polyp is chronic inflammation. So these three circles are important. Okay. Polyps have no epistaxis. But is polyp too much of edema? Why edema comes? Chronic inflammation. The basic cause of polyp is actually chronic. Now, why inflammation comes in the body? Due to chronic infection or allergy. Some infection, some allergy. Okay. Now, inflammation brings edema, edema makes a polyp. Now, see the definition of polyp. Polyp is prolapsed pedunculated edematous mucosa of sinuses. Look at the prolapsed pedunculated edematous mucosa of sinuses. Look at me. This is mucosa of the sinus. Some inflammation is going on for last 7, 6, 7, 5, 10 years due to infection, allergy. Inflammation brings edema. Too much of edema makes a polyp. That's all. Let me tell you. This is absolutely clear. The basic meaning of polyp is too much of edema. Why edema happens due to chronic inflammation? Why chronic inflammation happens due to either infection or allergy for last couple of years. So basically, polyp is too much of edema. So definition of polyp is very clear. Prolapsed pedunculated edematous mucosa of the sinuses. Okay. Now everybody, let me show you how does the polyp. I told you it's a grayish mass like this. This is the polyp. This one is the polyp in the nose. It's a grayish mass. When you touch it, it's soft and does not bleed on epistaxis. Can you see over there? Polyp. This is the polyp. It's a very soft mass. It's a grayish mass. When you touch it, it does not bleed. This is a very soft mass. Please see, it's a grayish mass, soft mass. The surgeon is touching it. There's no bleeding from it. This is a big polyp in the nose. Now, next one. So, polyp are of two types. Enteroconal polyp was the MCQ of July paper. This came in July paper. Enteroconal polyp, also called Killian's polyp. Anybody, any other thing on the name of Killian? Any other thing on the name of Killian? Killian. Everybody, Killian. Everybody, Killian. Dehiscence, site of formation of Zenkel diverticulum. It is the weak area, no muscle area between the fibers of hyoropharyngeus and cricopharyngeus, which is part of inferior constrictor muscle. Very good. Now, anybody, which sinus is called antrum? Anybody, which sinus is called antrum of Hymore? Antrum is which sinus? Which sinus? Maxillary sinus is also called antrum of Hymore. Anybody, what is coena? What is coena? Not concha. What is coena? Coena is the posterior opening of the. What is coena? Coena is the posterior opening of the nasal cavity. Coena is the posterior opening of the nasal cavity. Okay. So it arises from maxillary sinuses. You see, it arises from maxillary sinus. Correct? Not sinuses, but sinus. One single sinus. Very good. Enterocoenal and it grows posteriorly towards coena. So this was given in the question this time. This was the MCQ of July paper. A polyp-like mass is growing backward towards the end of the nose, and it is put an arrow. Therefore, it can be seen on posterior rhinoscopy. You cannot see from the front. Why? It does not come to the front part of the nose. It grows toward the back part of the nose. Enterocoenal polyp. It starts from maxillary sinus and goes to the nose. Then it has two options: can come forward or backward. It chooses to grow backward. It पीछे grow towards coena. So it is seen on posterior rhinoscopy in the bracket PR. Posterior rhinoscopy. Put an arrow. Done with. Posterior rhinoscopy done with PR mirror. PR mirror in the bracket. It is angulated mirror. Done with PR mirror, it's angulated mirror. Anybody, yesterday, first day class, we said that another mirror for larynx, which was straight mirror. What is the name of that mirror? Another mirror we did in the larynx, which was straight mirror. This is angulated mirror. This angulated mirror, like this one, which was a straight mirror. For the larynx, we did another mirror. That was indirect laryngoscopy mirror, is a straight mirror, was posterior rhinoscopy mirror. This one mirror. This is angulated mirror. Put a picture in the group mirror to revise. PR mirror is angulated mirror. Okay, very good. So there are two mirrors in ENT OPD. PR mirror is angulated mirror, and the first day class IL mirror, indirect laryngoscopy mirror, is a straight mirror. Very good. Now, it is more common in children. Put an arrow. But can be seen in adults also. But put an arrow, but can be seen in adults also. It can be seen in adults also. Okay, it is due to chronic infection. When I say infection, put an arrow, matlab chronic sinusitis. Chronic sinusitis. Patient is suffering from chronic maxillary sinusitis for last few years. Chronic infection, which sinusitis? Chronic sinusitis. It is single and unilateral. It is single mass, unilateral mass. Single side, one side nasal block. Chief complaint, nasal blockage. In the bracket, unilateral. Now please see nasal blockage, nasal mass. If this question comes like nasal blockage, nasal mass, dull voice. Polyp in the nose, dull voice, granulalia clausa. Then hyposmia, decreased smell. Yes, these all things can be seen in tumor also, beta. Like angiofibroma. Remember? Nasal mass, nasal blockage, dull voice. Lot of things are there, beta. But polyps never have epistaxis, beta. Okay, but fine. Fine. And angiofibroma will be typically seen in which age, beta? Anybody? Angiofibroma will be which age, which gender? Which age, which gender, beta? Angiofibroma will be in which age, beta? Perfuse epistaxis, nasal mass, but which age and which gender? Male 12 to 16 years. Very good, beta. So please think like a clinician. Remember TLC. This is the way to pass the beta. Think like a clinician, not like a medical student of first year, second year, beta. That would make you take good decision for the case, beta. This is what is making people pass. People have similar knowledge, in fact, less knowledge than other people sometimes, but they think rationally, they think beyond notes, they think like a clinician, and they take appropriate call to make the most probable diagnosis. Most probable diagnosis based on the basis of that drug of choice. Don't think rare things, beta. Rare things are asked rarely, common is asked commonly. Please don't change answer from common to rare and lose the marks. There lies the secret of passing Fmge examination, even if the exam comes of the higher level, in fact, as compared to the July paper even, beta. Let's increase the challenge level to next one. By chance, they make it like August 2020 paper. In August 2020 paper, look at me, beta. Who were the people who passed the paper? In August 2020 paper, very tough paper. Much tougher than INICT paper also. Still, close to 13% people pass in that paper also, beta. Who were those people who passed the paper? I was free in the COVID time. During that time, I did a complete analysis that how come people tackled this paper also. The paper was really having long 20-line question, 10-line question, 15-line question, statement-based scenarios and all that. In between that, there were hidden questions which people were knowing. Now, one batch of students started studying in June, which landed in June. They were preparing for December. Papers got postponed and government allowed that people who are preparing for December, even they can appear in the August examination. So they also filled the form. By the time August, I think 30th August of the paper, that time came, I think 8-9 subjects were done. Now we made a WhatsApp group for them, and because I was also from home actually mostly, I told them just don't take any classes 10 days before the exam. Leave the classes, no problem. We'll see later on. In those 9-10 days, revise whatever you've done till now and do the multiple choice question at night. 13 hours of study, 5 sessions of theory revision, 3 hours of MCQ. Keep doing that. Whatever you've done, revise that. Go to the exam as a trial run for the December paper. Let's see what happens. Now, out of these 13% people who passed the paper, 1/3 were the people who landed in June only, who were preparing for December. They were the people, 1/3 of the people who passed the paper were actually in the June. They were knowing much less than the people who actually could not pass the paper. Why could they pass the paper? Look at me, how brain works. People who had been reading for last 8 months till August actually, starting from January, when they saw the paper, इतना difficult paper आया, उनको तो देख के बिल्कुल नर्वस हो, एंग्जाइटी हो गई. हमने इतना पढ़ा, फिर भी कुछ नहीं आ रहा यार, कुछ नहीं आ रहा. टेंशन के चक्कर में क्या किया उन्होंने, जो क्वेश्चन आते भी थे, वो भी गलत कर दिए. In the tension, they made a lot of silly mistake in the question which they knew. The other group, the June group, बेटा, उनको क्या लगा, कुछ भोले वाले बच्चे नहीं होते बेटा, वो हमने तो 9 सब्जेक्ट पढ़े हैं, हमने तो आधा पूरा पढ़ा है, पूरा तो पढ़ा भी नहीं है. उनको जो भी क्वेश्चन डिफिकल्ट लग रहा था वो ये सोच रहे थे पेपर ऐसा ही होता है, हमने नहीं पढ़ा हुआ इसलिए हमें नहीं आता, पर जो हमें आता है वो नंबरों में कन्वर्ट करके जाएंगे. बोला था एनटी डॉक्टर ने. मैंने बोला था जो नहीं आता, जो आता है वो नंबर में कन्वर्ट कर देना. ठीक है, उनको ये लगा कि पेपर ऐसा ही आता है, शायद पेपर होता ही ऐसा है, हमारी तैयारी में कमी है, इसलिए अभी हमें क्वेश्चन नहीं आते, जब हम दिसंबर में आएंगे तब आते होंगे. लेकिन हाँ, जो क्वेश्चन हमें आते हैं वो सोच समझ के, बिना डर के, बिना भय के, बिना नर्वस हुए, बिना एंग्जाइटी हुए वो क्वेश्चन करते चले जाएंगे. वो लोग पास हो गए बेटा. सीखने वाली बात, lot to learn from this study actually, that even if the paper goes higher than the July paper, God forbid, by chance, still there will be many questions which will make you pass the paper. Only thing is, don't do silly mistake in the type A question, which you know. And please start thinking beyond notes like a clinician, and don't worry about the question which you do not know. हमारे गांव में एक तालाब होता था, मतलब कीचड़ होता पूरा, उसमें ना कुछ टाइम बाद साल में 1-2 बार कमल उगते थे. पेपर भी ऐसा है, FMG पेपर ऐसा है. There's mud also, there are lotuses also. Mud is the unknown question. Approximately 100 question, maybe again unknown to you if paper comes difficult. That's a mud. Lotuses are the real question. Type A question, type B question. Don't get worried about the mud. You just pick the 150, 170 lotuses and put in your basket. Don't worry about the mud. But without mud, lotuses cannot happen. Without type C question, no paper can be designed. There will be high level question. There will be unknown question. Right on the wall in front of your desk today, there will be many unknown questions in the paper. But I will focus on those questions which I know and I partially know. And I will not do silly mistake in those questions. And I will think rationally beyond notes like clinician. I will not overthink and change choices. And that's how, if God blesses me, I'll pass the paper. Write this on the wall and stick it on the wall. Read every day. Now, so nasal blockage, nasal mass, dull voice, hyposmia, but no epistaxis. No epistaxis. Treatment is surgery, surgical FES. The full form FES is functional endoscopic sinus surgery. Functional endoscopic sinus surgery. Okay. Or endoscopic polypectomy. We remove the endoscope. Beta. Let me show you how we do that. This is single mass. This is antroconal polyp. Beta. This is the video of the antroconal polyp surgery. Single mass, unilateral mass, grayish mass, soft to touch, does not lead to epistaxis. Then let us do what, beta? Let us break the attachment of this polyp. This is the attachment of the polyp, pedunculated mass, peduncle. Let's break the peduncle. This is the maxillary sinus. Now it is free. Now please see. Now you just, it's a single mass, bring it out, beta. Bring it out. Okay, single mass, bring it out. And this is the antroconal polyp, single unilateral mass coming out in one piece. Beautiful antroconal mass. सुबह सुबह देख के अच्छा लगा बेटा. Just like lychee बेटा. You know lychee? Lychee की तरह होता है. Lychee बिना बीज की lychee. The lychee without seed बेटा, है ना? That is like that. Okay, fine. So अच्छा लगा so breakfast के time पे. I hope next time lychee खाने का मन नहीं करे तो मुझे दोष मत देना भाई. Okay. Now next one. Next is the other polyp बेटा. Ethmoidal polyp or nasal polyp. If the MCQ only uses the word nasal polyp, it's ethmoidal polyp. Put an arrow. They are more common. They're more common. They're more common. Allergic polyp. Allergic polyp. They're more common polyp, allergic polyp. They arise from ethmoid air cell. Anybody? How many posterior ethmoid air cells we have in number? How many posterior ethmoid air cells we have in number? One to eight with it. Remember, anterior is 2 to 8, posterior is 1 to 8. Enough? Fine. Now, they're more common in adult, comma, they're due to allergy. That was infection, this is allergy. Multiple, bilateral. That was single, unilateral. Why multiple? Every cell makes one polyp. 2 to 8 cell, na? Every cell makes one polyp, multiple. Bilateral, why? Because allergy. Allergy has to be bilateral. Beta. Nobody can have right side allergy, beta, or left side allergy. Allergy is both sides. Asthma is both sides, beta. So there is never like, I have a right lung asthma. Right lung asthma is not possible, beta. Asthma is on both sides. Right lung tuberculosis is possible. Infection can be one side, but not the allergy. Now, treatment of choices, topical corticosteroid nasal spray, for example, fluticasone. Put the spray in the nose, like this. Topical corticosteroid nasal spray, for example, fluticasone. Anybody? What is the basic cause of polyp formation? Everybody, what is the basic cause of polyp formation? What is the basic cause of polyp formation? Inflammation, inflammation, inflammation. Not edema. Edema will happen due to, the main thing is inflammation. Everybody tell me, what is the basic function of a corticosteroid? What is the basic function of corticosteroid? Anybody? Yeah, anti-inflammatory. 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 Put an arrow. This treatment of choice. Number 2, surgery. If needed surgery. Anybody, surgery will have high recurrence rate or low recurrence rate? Surgery will have high recurrence rate or low recurrence rate. Steroids are anti-inflammatory. Basic cause of polyp is inflammation. And the basic function of steroid is the anti-inflammatory. Anybody who can tell me, will the surgery will have high recurrence rate or low recurrence? High, why? Allergy will be there, na? Allergy. Very good. Think like a clinician. Beta. I want you in the ENT, not just ENT, practice the art of passing the paper also. Beta. There is a way to pass the paper. Please practice that with me. Okay, people who pass, they do not know more than other people, beta. They just play the game well. Let us play our game well in the upcoming December paper. Now, next page, beta. Samterstride is a star question. Beta. Samterstride is a very common question of NEET PG, Fmge both. Is a trial of allergy. Number 1, nasal polyp, which are ethmoidal polyp, which are allergic polyp. Number 2, asthma. Is intrinsic. There's no allergy to pollens or something like that. Intrinsic asthma, your body produces bronchoconstrictors automatically. Number 3, allergy to NSAIDs like aspirin. Samterstride is a trial of allergy. It's a very famous question. Let's revise. What are 3 allergic problems? Nasal polyp, ethmoidal polyp, which is allergic polyp. Asthma is allergy, but it is intrinsic asthma. And painkiller, NSAIDs allergy, particularly aspirin. How this question was asked in the paper. Look at me, everybody. A young adult coming to ENT OPD with the bilateral nasal polypi and has got chest auscultation, wheezing present on both sides, which drug you would never prescribe to this patient? The answer is aspirin on that. Let's revise Samtest triad. Okay. Now, everybody, allow me to put the. Let me record the polyp. Basic cause of polyp is chronic inflammation, and the inflammation is due to either chronic sinusitis or chronic allergic rhinitis. And true choanal polyp arises from maxillary sinus and grows posteriorly towards choana, so it is better seen in posterior rhinoscopy. It is mostly seen in children, but can be seen in adults, and it's a single unilateral mass, and polyp never bleed. Patient will be having nasal blockage, the dull voice will be there, smell will be less, and treatment is surgery called FES or endoscopic polypectomy. The other polyp is the ethmoidal polyp, which is more common polyp, which is allergic polyp, which is more common in adults, and it's a multiple bilateral polypi. For that, we give the topical corticosteroid spray to suppress the inflammation. Samtest triad is allergic triad. Number 1 is the ethmoidal polyp. Number 2 is the asthma, which is intrinsic. And number 3, the patient has allergy to NSAIDs, particularly aspirin. And most important point to remember is polyp will have nasal mass, which is soft, pale, but polyps never bleed. Please save this with a polyp. Yes. So now, next topic with the sinus malignancy. Most common sinus involved in the cancer is maxillary sinus, and second common is ethmoid sinus. Risk factor is not cigarette, not alcohol. It is something else. Occupational, your working environment. To nickel. Nickel is used in which industry? Better put an arrow. Steel industry, cycle industry. Steel industry, cycle industry. And wood dust is seen in carpenters. The people who work in furniture industry, carpenters. So steel industry people, cycle industry people develop squamous cell carcinoma of maxillary sinus. And carpenter, wood dust people develop adenocarcinoma of ethmoid. Therefore, it is also called woodworkers carcinoma. Woodworker carcinoma. So two sinuses which develop cancer is mostly maxillary. Second is ethmoid. And the history is very unique. The risk factor is not cigarette or alcohol, beta. It is working environment, occupational exposure to nickel in steel industry people, cycle industry people. They develop squamous cell carcinoma of the maxillary sinus, which is more common. Wood dust exposure, beta. Like in carpenters, furniture industry workers, they develop adenocarcinoma of ethmoid, and that's why it's called woodworkers carcinoma. Woodworkers carcinoma. Now, Ongren line is a star question. Your paper question, Ongren line, it is from this very important question. Medial canthus. It's an anatomical line on the skull from medial canthus to angle of mandible. It's an anatomical line on the skull. It's from the medial canthus to angle of mandible. It is used for prognosis assessment of cancer of maxillary sinus. It is used for prognosis assessment, not for the surgery, for prognosis assessment of cancer of sinus, maxillary sinus. Now, tumor above this line has poor prognosis. Tumor above this line has poor prognosis due to early orbital involvement. Tumor above this line has poor prognosis due to early orbital involvement. With your hand, please write down one time this line name, beta. Ongren line. That's the Ongren line, beta. This is a visual question, important star question, beta. This is a very important question, Ongren line. Now, let me show the skull. Once I draw it, please click the picture and put in the group. Now, You see, this is the medial canthus, the angle of mandible. Okay. And this line is called ongral line. Which line? Ongral line. Let me write down. Ongral line. OHNGREN. Ongral line. It is used for prognosis. Revise with me, beta. Revise with me. For prognosis of cancer of maxillary sinus. Any cancer above this line will enter the orbit very fast and will have poor prognosis. Okay. Now please click a picture and post in a group. Ongral line is from medial canthus to the angle of mandible. It's used for prognosis of the cancer of maxillary sinus. This is important to be saved and remembered and revised also. Okay. Now, any tumor above this line will have poor prognosis due to early orbital involvement. Please do save the important images for your revision. The treatment is total maxillectomy. Please cut the word by, total maxillectomy. Please cut this word followed by radiotherapy. Everybody, yesterday class, yes. Laryngeal cancer, T3, T4, cancer larynx, T3, T4. The treatment was total laryngectomy followed by radiotherapy. Today's maxillary sinus cancer, total maxillectomy followed by radiotherapy. Chalo. Now, next one, beta. Now, this page had 2 questions of January paper, beta. This topic also came in January. This topic also came in January 2023, beta. Both came. Let us see the ringlet's tumor. It's a ringlet tumor is actually a tumor. Ringlet's tumor, write down. It's a benign locally invasive tumor of nose. Benign, locally invasive tumor of the nose. This is a MCQ, beta. Papilloma. It's also called inverted papilloma of nose, beta. Because it's locally invasive, inverted. Inverted, it grows inward, beta. Okay. Now, it arises from lateral wall of nose. Lateral wall of nose. Please cut this line, beta. It will confuse you with angiofibroma, beta. More common in males, it will confuse you in the paper. Okay. Remember, site of origin is not septum, beta. Lateral wall of nose. My dear friends. Site of origin is lateral wall of nose, beta. Lateral wall. What is lateral wall? Please see the screen, everybody. I'm sure you know this one, the lateral wall. That's a lateral wall. From here it starts, and then it comes out as a big mass, beta. Nasal mass over there, which keep bleeding also. There's epistaxis also. And it is locally invasive also, beta. Okay, it's locally invasive. Okay. So this is the inverted papilloma of nose, also called ringlet's tumor, which is a benign but locally invasive tumor of the nose. Okay, beta, fine. Okay. Now, the tumor grows inward, so-called inverted. Please cut this dot, beta. So-called what? Inverted. Inverted. Therefore, it is locally invasive tumor. It's locally invasive. It grows inverted. Inverted, it grows inward. Inward. Now, tumor grows inward. Therefore, the locally invasive tumor. Treatment is surgery. Now, chief complaint. Number 1, nasal mass. Number 2, epistaxis. Nasal mass, epistaxis. Why it is not polyp? Why it is not polyp, beta? Why it is not polyp, bache? Polyps never bleed. Polyps never bleed. Beta. Write down examination. Anybody, what was the color of the polyp? What the color of polyp? Polyp color was what? Polyp color was pale grayish. Grayish, na? You written over there, right? You written over there here. You said it's a grayish mass. This is not grayish. Examination, write down. Pinkish red. Nasal mass. With smooth surface and bleeds to touch. Please spread one awareness. Look at the notes, how many points we're adding everywhere because paper is changing. People who are watching 2020 Telegram videos, please inform your friends. I don't have any problem. I just wanted to pass the paper, but don't do the old content with it. These things are not there at all over there, beta. Only the name would be told in that presentation a little bit. Paper is advancing about thought processes and neat PG style question and all that. Please inform your friends. Do not use the old videos, old content, old notes being circulated in Gautam Nagar, etc., on the Telegram, because that is devastating, beta. It's for faculties, the biggest kick in the whole scene is when a student sends the message, Rajiv, I have passed the exam. Those 5 words change the day actually for us, because that makes us believe that we are having a productive life. Actually, we are actually genuinely contributing to other person's life to make it better. That is the real thing. After a certain time, that is what actually start mattering the most actually. But my worry is people keep doing, and they the problem is they would tag me on Instagram, they will mail me, they will message me in the Facebook or and all, and they will write praise about those videos. They will give the screenshot of that video also. They will give they will make the reels on the Instagram and share that they had a wonderful learning. But my heart is really scared at that moment. They learned, but inadequate. That was relevant for 2020, but now the paper, after 3 years, 6 more exam happened after that, paper has advanced significantly better. My humble request, please guide your juniors who are sitting in the universities, or your colleagues, or people who are repeating the paper, still sticking on to the old notes. Please ask them to take copy from you, get it Xerox, and please study the latest note. Add on the extra points to that. If you agree with me, please comment in the chat box in Telegram that what I'm conveying to you, is it understandable for you? Because it's a matter of sometimes 2-3 questions which take you from 148 to 151, and life suddenly changes. And we feel responsible for that actually. No problem, because that is what actually we need to create an awareness among students. Because that is actually creating big problem for me, because they feel very happy. ENT ho gaya, bahut maza aaya. That is, we have to now escalate the game better. Okay, ये word है ही नहीं वहां पे सारे बेटा. Polyp never bleed. Why it is being told again and again to you? Paper is turning clinical beta. Pinkish red nasal mask. Please, each one make one person aware beta. Your junior, your senior, your colleague, your person repeating, your friend, whosoever beta. एक बंदा एक FMG गाइड करेगा, तभी हम इस गेम को ऊपर ले. Because our dream is to make sure that every FMG, when the next exam comes, every FMG who comes to India should be able to have the equal pass percentage as IMGs. Because in my lifetime, I want to see that happening. This IMG, FMG divide should be totally, merged. We have to really stop saying this word FMG, IMG and stop me, because we should treat everyone like they are also learned. This was also learned. The pass percentage of both the group, if we see them equal, it can happen. But for that, you need to guide your juniors, beta, that don't take shortcuts, beta. Don't do the, pirated stuffs and all. It's actually devastating, because 147, 148 is, you are just few questions away. Okay, fine. Now, next one, beta. Next, pinkish red nasal mask with smooth surface bleed to touch. Beta. So let's revise, beta. Ring it sooner. Now let me record the लेट मी रिकॉर्ड द रिंगेट्स ट्यूमर बेटा. चलो लेट्स सब लोग मैं बोलता हूँ रिकॉर्ड मनी मन रिवाइज करो बेटा. रिंगेट्स ट्यूमर इज इन्वर्टेड पेपिलोमा ऑफ नोज. It is a benign but locally invasive tumor arising from lateral wall of the nose. Why it is called inverted papilloma? Because it is growing inward. Therefore, it's called inverted. Therefore, it's a locally invasive tumor, but it is benign tumor. Patient has got nasal mass and epistaxis. On examination, it's a pinkish red nasal mass with smooth surface, and the mass pleads to touch. Here, I want to revise with you. Ringet's tumor is actually a tumor, inverted papilloma nose, but Pott's puffy tumor was the subperiosteal frontal bone abscess, which is a complication of frontal sinusitis. Bhuvesh, let rhinosporosis come, I'll tell you. I'm coming towards that only. Now, mucormycosis, beta. Very famous question of your paper, mucormycosis. अभी होगा बेटा, शेफाली अभी होगा. Mucormycosis, it's seen in HIV positive patient, young diabetic patient, COVID-19 patient. HIV positive patient, young diabetic patient, COVID-19 patient. Beta. Chalo. Everybody, there is no risk factor, no cause. Beta. Now everybody, now think beyond notes. Let us see how January paper asked that. Think like clinician. How January paper asked that बेटा. Same topic. मैं ईमानदारी से बोलूंगा, मैंने इतना ही पढ़ाया था. मैं झूठ नहीं बोलूंगी, मैंने सब पढ़ाया था. क्योंकि मैं बताना चाहता हूं, the paper comes based on the notes, not from the notes words actually. I taught this much only. I'm honestly accepting it. It is seen in HIV positive patient, young diabetic patient, COVID-19 patient. What was the question of January paper? Everybody got to say A, B, C, D now. Which of the following is not a risk factor for mucormycosis? Not a risk factor for mucormycosis. Number one is uncontrolled diabetic status. Number two, neutropenia. Number three is high steroid usage. Number four, chronic antibiotic therapy. Number one, uncontrolled diabetic status, neutropenia, high steroid usage, and chronic antibiotic therapy. What is the answer, beta? Absolutely correct. It's the antibiotic therapy has no role, beta, because brain said that neutropenia is immunosuppression. HIV is immunosuppression. Steroid also cause immunosuppression, beta. Now, this is the way paper will be cracked, beta. अगर डॉक्टर धवन ये बोले मेरे नोट्स पढ़ लो सब कुछ पे आता है, please don't trust that. You are much beyond that, beta. Believe me, start putting that thought into your mind, beta. कभी गलत भी होगा बेटा, सारे क्वेश्चन ठीक नहीं हो, झूठ नहीं बोलूंगा, कुछ क्वेश्चन गलत भी हो जाएंगे, सोचते होंगे, लेकिन मेजॉरिटी ठीक होंगे. लेट्स स्टार्ट प्रैक्टिसिंग क्वेश्चन जब भी टाइम मिले तब. मैं मानता हूं बहुत टाइम की प्रॉब्लम. चलो अब लिख लेते बेटा. 1 2 3 4. Neutropenia, high steroid use. You beautifully demonstrated think like clinician. This is what I want from you, beta. You beautifully demonstrated think like clinician. नहीं भागेगा निर्वाणा. Don't say that, beta. Trust yourself. निर्वाणा ये नहीं भागेगा कॉमन सेंस. अगर तुम ये मान के जाओगे कि पेपर में मुश्किल सवाल होंगे, अगर ये अभी आपको बता दोगे ना अपने आप को कि निर्वाणा एंड एवरीबडी निर्वाणा हैज रिटन दैट, एग्जाम में कॉमन सेंस भाग जाती है. मैं फिर कह रहा हूं बेटा, अगर आप इफ यू टेल योरसेल्फ राइट नाउ देयर विल बी टफ क्वेश्चन, अननोन क्वेश्चन, डेफिनेटली देयर, बट आई विल नॉट स्पॉइल माय अदर क्वेश्चन बिकॉज ऑफ दैट. यू वुड डेफिनेटली फील दैट ओके आई एम डूइंग मच बेटर. सिर्फ बात यह है कि अपने आप को पेपर का स्कीम समझाना है आपने. आप डर जाते हो, वहां पे डर के गलतियां ज्यादा होती है बेटा. It is caused by mucor fungi, mucormycosis. Mucor is angio-invasive fungus. it grows into blood vessels. Like look at it. It starts from nose here, and then it goes via blood vessels to the eye and to the brain also. To the eye and to the brain also. Okay. Now, angioinvasion causes ischemic necrosis of tissues put an arrow. Therefore, blackish appearance. Like this. Blackish appearance of patient beta. Patient. Media ने बोला black fungus, black fungus, black fungus. Fungus was white only. It was black patient, black patient, black patient. When Delhi had Delta strain and with mucormycosis, a lot of cases, media आज तक started saying black fungus. लोगों का fungus का color black है ना भाई, patient का color black था, patient black था, और लोग कह रहे black fungus. No, it's a black patient, black. Okay. Clinical picture with ये early is a red color. Tissue red color beta. Now B late black color. NEET PG asked early question also. Your paper mostly give black color beta. Okay, red color. Now, what is red color beta? Please see, let me show you. The initial color is red beta. This one. Beta. Initial clinical picture beta. Let me just write and click a picture. Mucormycosis. Mucormycosis. Red color. Black color doesn't come in the beginning beta. The red color. Okay, somebody can take a picture and please post in a group. Initial is the red color. Strangers, say my hello to your mother. वो डॉक्टर हैं बहुत बड़े, हम तो छोटे डॉक्टर हैं. जो मदर्स होती है ना बेटा, वो पूरे परिवार की डॉक्टर होती है. म्यूकरमाइकोसिस. इनिशियल कलर इज ब्लैक. वेरी गुड बेटा, है ना? वेरी. से माय रिगार्ड्स टू योर मदर यार. Red color. Write down. Write down 3 features. Number 1, redness over cheek. COVID-19 patient in the beginning developed redness over cheek plus pain. Lot of my patient also, they had maxillary sinus full of fungus. You remember, most common fungal develop most common sinus for fungal infection is maxillary sinus, and this is full of fungus. So red color came on the cheek with pain. Number 2, eye swelling. Visual disturbance. Look at second picture in your group. You know, eye swelling, visual disturbance, and loss of upper teeth. Loss of upper teeth. This was given in NEET PG paper. Beta. Look, all of you touch your upper teeth and appreciate one thing. Your upper teeth are attached to base of maxilla. Upper teeth, if maxilla is full of fungus and fungus causes ischemic necrosis, the roots of the teeth will be decayed and the patient will be losing 2-3 teeth in one day only. Okay. But late color is black, blackish nasal mass and blackish discoloration around the eye. ये शाउट आउट क्या होता है भाई? मैं ना पंजाब से हूं, मुझे इतना नहीं पता. शिवाय ने लिखा वहां से शाउट आउट भी देते हो आप तो. शाउट आउट लेट मी, मुझे नहीं पता honestly. Blackish nasal mass and blackish discoloration around the eye. Why young diabetic patient? It's just an observation. Okay, fine. Drug of choice. We know drug of choice, everybody. Oh. Drug of choice is amphotericin B. Okay. In the bracket, liposomal. Thank you, Sheetal. Thank you, everyone. Thank you, liposomal. Young diabetic patient is an observation beta. There's some, observation will be liposomal. Plus, this is number 1 and number 2 beta. Debridement is done first. Dead tissue should be debrided. D for dead, D for debridement. Now, write down the best investigation. This was NEET PG question, and best investigation, people were confused actually. CT scan, KOH smear for fungus, or biopsy, or X-ray. The best investigation is biopsy. Don't write KOH smear for fungus beta. If that's not given, then contrast MRI. Yeah. It's reversible beta. We have to remove the dead tissue, but the patient could, some patient could be saved, some patient could not be saved beta. Contrast MRI. Contrast MRI beta. Thank you, Sushmita. Contrast MRI, it shows black turbinate sign. I'll show you beta. Black turbinate sign. Black turbinate sign. Contrast always shows the soft tissue details better because fungus separate, this is separate. Black, what is the name of sign? Black turbinate sign is a new radiology question for NEET PG beta. Now, let me show you black turbinate sign and then you just click it beta. On contrast MRI, please see this is normal side. This is the mucus side. Please compare this with this beta, inferior turbinate beta. Can you see beta? Normal side turbinate is white in color. Okay, and the disease side is the black in color, black turbinate sign. Why it is in diabetic beta? Hyperglycemic state favors the fungus growth beta. Okay. Chalo. Okay, this is new radiology question. Mucormycosis, what is the name of sign? Black turbinate sign on contrast MRI. Chalo. Let me revise the mucormycosis and record an audio for that. Mucormycosis is seen in number 1, young diabetic patients, number 2, HIV positive patient, number 3, COVID-19 patients, number 4, neutropenic patients, and people on high steroid usage. Mucor is angio-invasive fungus. So via the blood vessel, it goes to brain and eye very fast. Therefore, it's a life-threatening infection. Angio-invasion will lead to ischemic necrosis. Therefore, blackish appearance of the tissues of the patient. It's not a black fungus, it's a black patient. The early features are red in color, like cheek redness, pain on the cheek, eye swelling, vision disturbance, and loss of upper teeth. But after a few days, the late feature, black color comes, like blackish nasal mass and blackish discoloration around the eye. Best investigation, number one, is biopsy. If biopsy is not given, then write contrast MRI, and contrast MRI shows the black turbinate sign. Drug of choice is amphotericin B, particularly liposomal variant of that, plus debridement also. Tell me, are you finding these audios helpful? Is this audio helpful? Audio thing is helpful for you? Do you think it makes sense? We have been doing audio of the important topics. Because for me, if you see the mucormycosis audio is 1 minute, beta. Just see mucormycosis audio is only 1 minute. Otherwise, it's sometimes it's a 20-minute topic, 10-minute topic. Beta. Yes, wonderful. That's what I wanted. Now, VMR, vasomotor rhinitis. Thank you, Gachu. Thank you. That's why I wanted to check with you, is it really helping you or not? Okay. I'm doing it for the first time. Let me tell you, live, this kind of recording on Telegram, I'm doing it for the first time, but I thought that I'll try it this time with you, your batch. Vasomotor rhinitis. Okay. Now, VMR is, write down, cause parasympathetic overactivity in nasal mucosa. Parasympathetic overactivity in nasal mucosa. Clinical presentation. On change of temperature, patient gets excessive watery rhinorrhea. I hope you know by your physiology knowledge, whenever temperature changes, in the morning you go out of the house, your room temperature was 27, heater was on. You went out, you were going to gym in the morning at 5 o'clock and on the bike, and very cold environment outside, the cold air, thandi hawa naak ko lagti hai, your nose starts having watery secretion. Too much. Why? Change of temperature in everyone, all of us, leads to stimulation of autonomic nervous system. Autonomic system has two parts, sympathetic, parasympathetic. In this patient, there is parasympathetic overactivity in nasal mucosa. Okay. So I hope you remember from physiology that parasympathetic system increases the secretion of glands. Parasympathetic system increases the secretions of glands. Okay. Fine. Wonderful. Treatment of VMR is surgery. The name of surgery is videoneurectomy. How to remember this question? This is a NEET PG question. VMR, VMR, V for V, Videon. Surgery, videoneurectomy. Videon nerve, MCQ of anatomy. Nerve of pterygoid canal. Put an arrow. This nerve gives autonomic nerve supply to nose. This nerve gives autonomic nerve supply to nose. Only one word to remember is vasomotor rhinitis. What's the name of surgery? Videoneurectomy. V for V, V for vasomotor rhinitis, V for videon nerve. And one question of anatomy is that videon nerve is also called nerve of pterygoid canal, and this nerve gives autonomic supply to the nose. We cut that nerve. Now, rhinitis medicamentosa is a pharmacology question also. Right about the cause. There are medical treatment also to suppress the secretion, but the treatment of choice is surgery. That will be symptomatic relief. Causes prolonged use of decongestant nasal drop. You must have heard the word Otrivin, Nazivion, nasal drops. Otrivin, Nazivion nasal drops. In the market, very commonly available, xylometazoline or oxymetazoline. It's a very popular drug in the market, very easily available. Otrivin, to have any blockage in the nose, cold, you put few drops. It's a wonderful drug. We also recommend it, but it should be used only for few days. But if you start using it for months, it's a problem. What happens, beta? Your system get dependent on that. Write down. It causes rebound vasodilatation in vessels of inferior turbinate. Yeah. You can use it, but for only for few days. Rebound vasodilatation of inferior turbinate. The treatment, stop these drop and start steroid spray. Steroid shrink inferior turbinate. Steroid shrink inferior turbinate. No, Vicks is only camphor, menthol and all that. Vicks is not like that. Vicks is just to give you pseudo feeling of nasal opening. Once again, beta, if somebody uses nasal drop like xylometazoline, oxymetazoline for months or weeks, what is the name of disease which can happen? Rhinitis medicamentosa, because the system got dependent on this drug. When you put the drops in the nose, you feel very nice, the nose opens, but after a few hours, there is a rebound vasodilatation in the blood vessel of inferior turbinate. So stop the drop. Number one, MCQ is start what? Steroid spray, because steroid lead to shrinkage of inferior turbinate. Next topic is olfaction. Olfaction is equal to sense of smell. Olfactory epithelium lines upper 1/3 of nasal cavity. Okay, upper 1/3. In the bracket, roof. Roof. Let's do you remember, beta? Olfactory neuron pass through which plate? Cribriform plate. Beta. Next, beta. Olfactory neuron pass through cribriform plate. You can use eucalyptus oil. That's not a problem. Beta. Cribriform plate. Anybody? Cribriform plate is a part of which bone? Beta? Cribriform plate is a part of which bone? Beta? Anybody? Cribriform plate is a part of which bone? Ethmoid bone. Very good. Beta. Ethmoid bone. That's MCQ. Beta. Anosmia is total loss of smell. Anosmia वाला smell बिल्कुल चला गया. Anosmia. Hyposmia is decreased sense of smell. दो word है बेटा. Anosmia, total loss of smell. Hyposmia, decreased sense of smell. Now causes beta. Put about causes. Put number 1, number 2. Smell नहीं आ रही बेटा. Look at me बेटा. Smell नहीं आ रही मुझे. I can't smell. How we smell? Through air बेटा. Whenever I smell anything, I smell through air. Smell नहीं आ रही. दो कारण है. या तो नाक बंद है या दिमाग बंद है. आपको स्मेल नहीं आ रही. हमने परफ्यूम लगाया, ऐसे परफ्यूम लगाया हाथ पे, you know, इत्र over here, you know, like anything, and then smell नहीं आ रही. या तो नाक बंद है या दिमाग बंद है. Either the air is not going in the nose properly or the brain is not able to sense that. Now, obstructive cause, nasal polyp. Neurological cause, head injury. In head injury, what will happen? These neurons will be damaged. The fractures can cut these neurons. Anybody will tell me This smell problem is more common in which leaf-foot fracture? Leaf-foot fracture. Please see leaf-foot 1 and 2, 1, 2, 3, 1 and 3, 2 and 3. Which fracture leaf-foot will have the more chance of listening to leaf-foot 1, 2, 3, leaf-foot? What is the correct answer? Beta? Very good. The correct answer is 2 and 3. My dear friends, you just thought like a clinician. Abhi aapne socha, you just thought like a clinician. Oh, leaf-foot 2, 3 bars pass through base of skull. So that is the answer. But we will never read it. Maybe this question come in the paper. If you can solve now, you can solve there also. But only you will solve it if you don't have the fear. Why I could not solve the PSM question? Why I could not solve the so many questions of medicine and all that? Just think about the mud and the lotus theory. Don't worry about the mud. Keep telling yourself, without mud, lotuses will never be there. So mud will be there, but I'll focus on lotuses. I will not spoil my lotuses because of the mud, actually. Please fill this thought within you. Paper will have unknown questions, but I will not be scared of them. Very good. Very good. Head injury in the bracket. Leaf-foot 2 and 3. Leaf-foot 2 and 3. COVID-19. Very important question, beta. COVID-19, beta. COVID-19, you remember COVID-19, a lot of smell problem happened at the time. And anybody out of you who had smell problem but got back to normal due to COVID? Parkinsonism, Alzheimer's disease. And a lot of people would have got some smell problem during COVID, but it recovered better. Actually, COVID did what better? COVID did not damage the main nerves actually. COVID actually causes swelling of these terminal endings actually only. Also, in some people, every ending, so total loss smell. Some people, some ending. After a few days, this swelling went away. So you felt better. Yes. Rhinitis medicamentosa will be presenting. Dr. Dhawan, I cannot breathe if I don't put these drop. Very good question, beta. How rhinitis medicamentosa patient will come to you? He said, Dr. Dhawan, I can only breathe when I put the drop. After every 2 hours, 3 hours, again I put the drop. I got dependent on this drug. Like I depend on cigarette, for example. 2-3 घंटे के बाद चुल मचती है ना बेटा अंदर कि जाके सिगरेट पी के आ जाता हूँ, है ना? वैसे ही डिपेंडेंस हो जाती है. Some people had permanent damage of these endings. Now, Kalman syndrome is a star question of it. You must have read Kalman in OBGY topic also. It is OBGY topic also. Read from there. It is anosmia plus hypogonadism. Anosmia, in the bracket, infertility. Whenever you get a question of infertility along with smell problem, it is actually the Kalman syndrome. It's a very important question for both subjects, ENT and obstetrics. So infertility question along with smell problem, the answer is Kalman syndrome. Second question is, a patient of anosmia can still sense ammonia. It's not a smell. It's an irritant. It is sensed through trigeminal nerve. It is sensed through trigeminal nerve. Fifth note. Okay. So, a nausea patient can still smell ammonia because ammonia is not a smell. It is an irritant. It is sensed through trigeminal nerve. No, sometimes recovery is slow. Some were recovered, some were recovery after COVID. Smell was slow, not immunity, beta. It's like Cartagena has no smell problem, beta. Cartagena has no smell problem. It's Calman. Okay, chal. What are main questions to be kept in mind? First of all, olfactory epithelium is towards the roof, upper 1/3. Then olfactory neuron pass through cribriform plate and ethmoid bone part. Then COVID-19 story, Kalman syndrome, then anosmia, ammonia, trigeminal nerve. Okay. COVID-19, nobody would have forgotten that. COVID-19, to like a lot of people, COVID-19 was a very different kind of experience for everyone, including me also. I remember it was March 2020. I think it was 15th March 2020. I finished my PG class in Kolkata and came back to Delhi. I got a call from the head office, PGs I was working. They called me that next class, Mumbai class has been cancelled because of this new virus spreading in the country. So I said, God bless the virus. I thought 1 week, while weekend suddenly coming off, it's like a good thing. Sometimes you get to spend time with family more actually. So suddenly one thing happened. Somebody came on the TV and some plate or chammach and all that. Bajaya pura desh band ho gaya. I said, God bless this man. Chuttiyan ho gayi. Delhi school closed. Lockdown announced. Clinics band. ENT, Optha, both were non-essential clinics. They closed both the clinics. Tab hum Delhi mein the, we were in Delhi. And we were like at home. Everyone was at home for continuous so many days. It was the first time occurring like that. First time it was occurring like that. After ages, कि इतने दिन हम इकट्ठे रह रहे. 10-12 दिन के बाद मुझे, my wife told me, see, I'm not used to see you, so much of you in the house every day. तुम पूरा दिन घर पे रहते हो और कुछ ना कुछ काम में उलझाए रहते हो मुझे, ये बनाओ वो बनाओ किचन में. तुम कुछ ढंग का काम क्यों नहीं करते? मैं बोला क्या ढंग का काम करूं? Anuradha has license of UK. She is an ophthalmology retina consultant in UK. Also, she has a license because Anuradha is very, very talented. She can really focus on anything. She can, female brain is a different brain, male brain is a monkey brain. And she has been telling me, why don't you give MRCS ENT exam also? You also take that license. Sometime we can work together. मैं बहुत दिनों से, बहुत सालों से मना, मैं बस टाइम ही नहीं है, मैं कहाँ करूं? अब उसने बोला कि अब तुम कर लो, अब तो बहुत टाइम है, बल्कि अच्छा है. एक दिन उसने फॉर्म भर दिया मेरा. मैंने बोला क्यों पैसे वेस्ट कर, 90,000 रुपए वेस्ट कर दिए. बोला कर लो यार, कर लो, खत्म करो. जब सिलेबस आया उसका, मेल आया कि 15 सितंबर को पेपर है, तो मैंने सिलेबस खोला उसका. उसमें लिखा हुआ था कि 150 क्वेश्चन पार्ट ए में, 150 पार्ट बी में. पेपर का नाम था MRCS ENT पार्ट 1. ओके. नाउ अब मुझे FMG याद आ गए. पार्ट 1 150 पार्ट 2 में. तो FMG वाला पेपर है, अपना दिमाग तो वैसे चलता है ऐसे. 150 पास होने चाहिए 232 और अबव. 232. मैं बोला ENT हो जाएगी यार. अगर सही हुआ तो 1 नंबर, माइनस नेगेटिव मार्किंग 0.25. ओके. ये पूरा स्कीम था. दूसरी PDF में उसका सिलेबस था. MRCS ENT पार्ट 1 सिलेबस ऐसे था लिखा हुआ. सिलेबस की दूसरी PDF खोले. नंबर 1 ह्यूमन एनाटॉमी, अपर लिम, लोअर लिम, एब्डोमेन, पेरिनियम, पेल्विस, थॉरेक्स एटसेट्रा एटसेट्रा, 40 नंबर. नंबर 2 बेटा सर्जरी, जनरल सर्जरी, GIT, जेनिटो यूरिनरी, थोरेसिक, न्यूरो, आई थिंक 50 मार्क्स. ऑर्थो 30 मार्क, पैथो 15 मार्क, इम्यूनो 15 मार्क, कीड़े मकोड़े हुई हो, माइक्रो वाले भी 10 नंबर, फिजियो 15 मार्क, पता नहीं क्या क्या, स्टैटिस्टिक्स, बायोस्टैट, PSM वाले भी, वो भी कर करके जोड़ लगा दिया. 300 हो गए पूरे. मैंने बोला भाई ENT किधर है? वेयर इज ENT? एक भी क्वेश्चन ENT का नहीं लिखा. स्टार लिखा हुआ है PS, प्लीज नोट, देयर इज नो ENT क्वेश्चन इन पार्ट 1. पार्ट 1 में ENT क्वेश्चन है ही नहीं. मैंने अनुराधा को बुलाया. मैं बोला ये क्या है भाई, ये क्या है? पेपर का नाम MRCS ENT पार्ट 1 और पार्ट 1 में ENT आना ही नहीं है. फिर अनुराधा ने पता किया उसने देखा कि ऑप्थेल्मोलॉजी में रॉयल कॉलेज ऑफ ऑप्थेल्मोलॉजी है, उनका पार्ट 1 भी ऑप्थेल्मोलॉजी, पार्ट 2 भी ऑप्थेल्मोलॉजी। ईएनटी को रॉयल कॉलेज है ही नहीं यूके में। ईएनटी कम्स अंडर द डोमेन ऑफ रॉयल कॉलेज ऑफ सर्जरी, देयर इज नो इंडिपेंडेंट रॉयल कॉलेज ऑफ ईएनटी। तो पहला एग्जाम बिल्कुल वही एग्जाम है जो उन लोगों को देना पड़ता है, वो एग्जाम कॉमन एग्जाम है, वो तो देना ही पड़ेगा। फिर पार्ट 2 ईएनटी आएगा। मैं बोला मैं तो नहीं दे रहा, मैं बोला मैंने देना ही नहीं भाई, ये मेरे बस का ही ना है, मैंने देना ही नहीं है ये एग्जाम। अनुराग मुझे बोलते कि दे लो यार, मैं बोला ना बोलना, तुम तो बैच में, पता है मेरा कितना बुरा हाल है इन सब्जेक्ट्स में, मैंने नहीं देना, इतने साल पहले पढ़ा था। एक दिन मैं सुबह चाय पी रहा बैल्कनी में, अनुराधा भी बैठी हुई, हम लोग बात कर रहे, कोई एफएमजी का फोन आया हुआ, क्योंकि लोग पढ़ नहीं रहे थे तब, बहुत जरा लो चल रहा था मामला, कोविड चक्कर में क्लासेस बंद हो गई, ऑफलाइन बंद हो गया, ऑनलाइन स्टार्ट हो गया मामला, बहुत ज्यादा सारा ऑनलाइन ऑनलाइन चल रहा था, लोगों ने पढ़ाई बंद कर दी। मैं एक बंदे को सुबह सुबह फोन पे, एफएमजी स्टूडेंट को बात कर रहा हूँ फोन पे, और उसको बोल रहा हूँ कि भाई होना नहीं होना ऊपर वाले के हाथ में, तू ट्राई तो कर। अनुराधा बोला कि तुम पे एप्लीकेबल नहीं है, ज्ञान बकना आसान है, वैसे मैं अपने लिए बोल रहा था कि ज्ञान देना बहुत आसान है पर उसको फॉलो करना बहुत मुश्किल होता है। फिर मैंने बैठ के उसको इंट्रोस्पेक्ट किया कि भाई करना क्या है, ये जो पढ़ाई कैसे करनी, ईएनटी तो है नहीं, किताबें आती होंगी बड़ी बड़ी सी पास्ट टेस्ट सीरीज की, एक ऐप आती पूरी पास्ट टेस्ट की, वो खरीदी, ऑर्डर करा ऑनलाइन, सब कुछ मंगवाया, सामान पढ़ना शुरू किया। लेकिन मैंने क्या, पहले 2-3 दिन थोड़ा मन नहीं कर रहा था, करते करते मुझे लगा कि नहीं, अगर पढ़ना है तो वैसे ही पढ़ना है जैसे स्टूडेंट को बोलते हैं। अब टाइम आ गया था दोबारा से इस मंकी को सुलाने का। ओके, आई नो आई केम लाइक अ मंकी, आई डाई लाइक अ मंकी, आई नेवर बी improving myself at all. I'm proud to be imperfect actually. But in between, I know how to make the monkey sleep. And I made this monkey sleep also. Left everything, started studying, made the schedule. 2 घंटे, 2 घंटे, 2 घंटे, 2 घंटे theory, 5 सेशन, और रात को 3 घंटे एमसीक्यूज पे। जो आपको बोल रहा हूँ मैंने खुद भी किया। ये जो ऑडियो रिकॉर्डिंग वाला मामला है, मैंने खुद मतलब इसी एग्जाम के लिए शुरू किया था। सब चीजें, ईएनटी तो था नहीं, सारे नोट्स बनाए, सारे छोटे लिख के, सारे सुन के, ये वो सब चीजें, क्वेश्चन किए, रात को करके रिवीजन करी, 3 रिवीजन करी, डट के पढ़ा, सब छोड़ दिया, कोई नेटफ्लिक्स नहीं, सब छोड़ छाड़ के सिर्फ पढ़ाई पे लग गया, दिन रात सिर्फ पढ़ाई। और पेपर हो गया भाई, काफी टफ पेपर, ऑनेस्टली झूठ नहीं बोल रहा, बहुत 150 क्लिनिकल सिनेरियोज आते हैं, अप्लाइड एनाटॉमी, अप्लाइड फिजियोलॉजी, एवरीथिंग अप्लाइड, नॉन ईएनटी क्वेश्चन सारे के सारे। पेपर के बाद एक बंदा मुझे रोज आके मेरा रिजल्ट पूछता था, मेरा बेटा, माई सन विल कम टू मी एवरी डे, क्या बना रिजल्ट का, रिजल्ट नहीं आया, उसको पूरी उम्मीद थी इस बार ये फेल होने वाला है, अब देखते क्या होगा, है ना। पेपर आया, रिजल्ट आया दिवाली के बाद, काफी दिन, लेकिन मैं पास हो गया भाई, पास हो गया। सुनो नंबर जो आए हैं, नंबर आए हैं 234, 234 पे पास हो गया मैं, 234 पे। अगर 2 क्वेश्चन गलत हो जाते तो नंबर होते 231.5 और मैं फेल हो जाता, यहां पे पास हो गया। ये है मैजिक, 2 क्वेश्चन का और एक्स्ट्रा ठीक हो जाना है, मैजिक। मुझे पता है, मुझे इतना तो नहीं आता था भाई, 2 क्वेश्चन एक्स्ट्रा ठीक हो गए तो मैजिक हो गया। लेकिन मैजिक ओनली कम्स विद हार्ड वर्क, कंसिस्टेंट हार्ड वर्क। इतना हार्ड वर्क करो कि नेचर इज फोर्स्ड टू ब्लेस यू। सो टुडे I have cleared MRCS ENT part 1 without having a single question of ENT recently. If I can do, you can also do. If I'm a monkey, you're also my species only, na? Why can't you make your monkey sleep, take rest for a few months, devote fully, consistently, rather than keep complaining, time नहीं है, time नहीं है, time नहीं है. Ask yourself, जब time है तब हम डट के 13 घंटे पढ़ रहे हैं? अगर आवाज आएगी हाँ, तो फिर मैजिक की तरफ बढ़ रहे हैं। फिर 1-2 क्वेश्चन एक्स्ट्रा ठीक होने से हमारी कहानी अलग डायरेक्शन में निकल जाएगी। सो ये थी कहानी कोविड के टाइम में दी हुई एमआरसीएस ईएनटी पार्ट 1 की। पार्ट 2 मैंने अभी तक भी नहीं दिया, वो ईएनटी है, देंगे बाद में, अभी जब कभी अगला कोविड आएगा तो वो भी दे देंगे। नाउ नेक्स्ट वन बेटा, नेजल सेप्टम, नेजल सेप्टम, नेजल सेप्टम it formed medial wall of nose. Yeah, we can clear part 2 in any time in 7 years. 7 years of appearing in part 1. 7 years. मेरे को यूके पसंद नहीं है। आई एम नॉट अ यूके पर्सन, मैं पंजाब से हूँ भाई, हमें कनाडा जाना होता है। पंजाबी कनाडा जाते हैं, पता ना तुम्हें, सब लोग जाते हैं हरिद्वार, पंजाबी जाते हैं कनाडा, है ना? तो यूके इज नॉट माई टाइप ऑफ कंट्री एक्चुअली ना. Middle wall of nose. Okay, now please leave it up. This is number one, number two, number three. I'm pretty young at heart. So the three major parts. This is number one, number two, and number three. 1, 2, 3. Next one. Next one. Nasal septum is made of 3 major and 4 minor components. Three major parts are septal or quadrangular cartilage. ये कौन लिख रहा है 50s? इसको ब्लॉक करो जरा. 56. अच्छा. अरे भैया इतने इतने बुढ़े नहीं है हम लोग. Septal or quadrangular cartilage. Number 2, perpendicular plate of ethmoid. Yes, I am 18. I'll always, मैंने 18 के बाद I never celebrate birthday. अब 18 ही रहना है. Number 3, vomer. Vomer. Very good. Septal or quadrangular cartilage, perpendicular to ethmoid, and number 3, vomer. Everybody look at a skull. Look at skull, everybody. This is a skull. खुश रह के पढ़ना चाहिए, बहुत अच्छी बात है. जो लोग उदास रह के पढ़ते हैं उनको बोलो ये स्कल देख लो, ये बिना बात के हंस रही है. जो लोग एकदम कुड़ के पढ़ते हैं ना, क्यों पढ़ना पड़ रहा है, पढ़ते हुए मौत पड़ रही है, क्यों पढ़ रहे हैं, बड़ा मुंह सुझाया हुआ पढ़ते हुए, क्यों कर रहे हैं ये वो उनको बोलो स्कल को देख लो भाई, ये स्कल बिना बात के हंस रही है, ये भी हंसती रहती है. हंसते हुए पढ़ना चाहिए ना, ये नहीं क्यों पढ़ना पड़ रहा है, पढ़ना तो पड़ेगा भाई. ओके, नाउ एवरीबॉडी, दिस इज योर सेप्टम. This is your perpendicular plate of ethmoid, ये वाला. Number 2, this is the septal cartilage. So this is number 1. This is number 2. Number 1 is septal cartilage. Everybody hold your nose like this. Hold it like this, beta. Nose like this. 1, 2, 3. Can you hold your nose, beta? Move it right, left, right, left. Can you move it, beta? Why? Because anterior part of the septum is cartilaginous. Why can you move your nose like this, beta? Because front part of the nose is cartilage. Cartilage. Okay. Right. Now, the 4 minor part. Spine of maxilla, spine of frontal bone, rostrum of sphenoid, and crest of palatine and maxillary bone. Spine of maxilla, spine of frontal bone, rostrum of sphenoid, and crest of palatine and maxillary bone. This you have to remember. Okay. Now, so it means that the front part, number 1, is cartilaginous part. The remaining part is bony part. Now I say, and you just revise with me. Let me now, let me say it up. Septum of nose is made of 7 parts, 3 major and 4 minor. The 3 major parts are: number 1 is septal or quadrangular cartilage. Number 2, perpendicular plate of ethmoid. Number 3, vomer. The 4 minor parts are: number 1, spine of maxilla. Number 2, spine of frontal bone. Number 3, rostrum of sphenoid. And lastly, crest of the palatine and maxillary bones. Septum design. Now, how this question has come in the paper of anatomy section. Which skull bone has no role in the formation of nasal septum? The choices were number 1, vomer, number 2, sphenoid, number 3, palatine, number 4, lacrimal. What is the answer, Peter? Which skull bone has no role in the formation of the septum? Number 1, sphenoid, number 2, frontal, number 3, the palatine, number 4, lacrimal. Yes, lacrimal has no role. Not DNS, Peter, deviated nasal septum. All of you, please draw this picture properly. Septum is deviated like that. Very good. Lacrimal has no role. DNS can lead to nasal blockage on deviated site, crust formation on patent site. What is crust? Dried mucus due to increased airflow. Dried mucus due to increased airflow. All of you, don't draw a diagram, just understand first of all. Please see, this is your septum deviation on this side. This is your inferior turbinate, inferior turbinate. My dear friend, on this side, flow is less. Nasal blockage on deviated side. On this side, flow is more than normal. Okay. This will lead to dryness of the mucus, and that lead to the crust formation in the nose. Crust. What is crust? Crust is dried mucus. Sometimes you put a finger in the nose, there are yellow crusts in your nose. Sometimes when you're free, you're moving finger in your nose, you don't have any work to do. And this is a crust in the nose. You remove that. Too much of crusting. But nature will not let that happen for a very long time. Nature will save you from that. How? Nature will lead to what? The increase in the size of inferior turbinate. This is called compensatory inferior turbinate hypertrophy. Compensatory inferior turbinate hypertrophy. So this is label the diagram. This is ITH. ITH. Inferior turbinate hypertrophy. So crust formation on the patent side. Crust is dried mucus due to increased airflow. Put an arrow. Therefore, there is compensatory inferior turbinate hypertrophy in the patent side. ITH gives, right, MCQ, ITH gives mulberry appearance of nasal mucosa. ITH gives mulberry appearance of nasal mucosa. Mulberry appearance of nasal mucosa. Okay. Mulberry shatooth, beta. People from some South India may not be saying, this is mulberry, beta. मैं लेके आया तुम्हारे लिए mulberry shatooth. You know mulberry? This kind of turbinate. Turbinate looks like a mulberry, beta. No extra mass. This is mulberry beta. Okay. Now. Okay. Hyposmia is decreased sense of smell. When flow of the air is less, the smell is less. Sinusitis. Why? DNS can block the drainage of sinuses. What is the cause of sinusitis? Drainage of sinuses is blocked. Dryness can lead to epistaxis. Okay. External deformity of the nose. Why? Please see, beta. Please see. All of you touch the center of your nose, beta. Touch the center of your nose. This point, beta. Your nose is standing on the support of septum, beta. Okay. So that is why there can be this kind of deviation, beta. Are you getting my point, beta? Fine. This deviation. External deformity. Okay. Now, next one, beta. Headache. Sometimes headache is there to DNS. Headache is called Sludder's neuralgia. Also called anterior ethmoidal neuralgia. It is due to contact between DNS and middle turbinate. Sometimes DNS is so bad, it start touching the middle turbinate. Anybody, middle turbinate is a part of which bone? Middle concha or middle turbinate is a part of which bone? Middle concha or middle turbinate is a part of which bone? Ethmoid bone. A very good ethmoid bone. And that's why the name of the nerve is ethmoidal. Name of nerve is ethmoidal neuralgia. Fine. Also called Schluter neuralgia. This contact stimulates which nerve? Anterior ethmoidal nerve. This headache is called Schluter neuralgia or anterior ethmoidal neuralgia. Let's revise one more time. DNS, deviated nasal septum can lead to nasal blockage on deviated side, crust formation on the reverse side, patent side. Therefore, there is a compensatory inferior terminal hypertrophy on the patent side. ITH gives mulberry up in the nasal mucosa. DNS can lead to hyposmia. DNS can cause the sinusitis. DNS can lead to epistaxis and external nasal deformity. And headache is called Schluter neuralgia or anterior ethmoidal neuralgia due to contact between DNS and middle turbinate. Next page. Treatment of DNS surgery called septoplasty. Septoplasty surgery. Will ITH be improving after septoplasty? Yes, it gets better. Now, this is the very famous question of NEET PG. Most common long-term complication. The keyword is long-term. Of long-term after few months is Fmge formation. Fmge मतलब चिपक जाना, मतलब adhesion. Fmge मतलब adhesion. Fmge or adhesion formation. Fmge or adhesion formation. Fmge or adhesion formation. Okay, fine. Can you see Fmge? You see this, when you do surgery, you make a raw area on the nose by chance, by mistake. Raw area on the inferior turbinate, a raw area on the septum. Two raw area want to attach to each other by fibrosis, and this fusion is called the Fmge, beta. Chipak jana, adhesion formation. Can you stop this? Yes. Treatment. Local application of mitomycin C. MCQ, beta. Two questions are there of NEET PG. Which drug can be applied to prevent it better? Mitomycin C reduces Fmge formation. Local application of mitomycin C reduces Fmge formation. Let's revise once again. Most common long-term complication of FES or septoplasty is Fmge formation or adhesion formation, and we can apply mitomycin C to reduce the Fmge formation. Now, this is NEET PG question. Septal hematoma is your MCI question. Septal hematoma, beta. Can you see hematoma? Both sides there is a blood collection over there. What happened, beta? Cause is trauma. किसी ने प्यार से तुम्हारे नाक में मुक्का मार दिया. Somebody hit your nose like this. Cause is trauma. Nicola, it is due to trauma. It is bilateral. Always bilateral. Now, how the MCQ came, beta? After trauma, nasal swelling and bilateral nasal blockage. Think like a doctor, beta. Okay. After trauma, nasal swelling and bilateral nasal blockage. After trauma, nasal swelling and bilateral nasal blockage. Both sides, beta. Can you see over there, beta? Both sides there is a hematoma, matlab like that. Okay, guys, please understand, beta. Now let me save. Beta. Please save. Now I'm going to say something in the audio. Save it. Okay, fine. Nasal trauma, if it causes the deformity of the nose, think about the nasal bone fracture. If nasal trauma leads to swelling of nose and bilateral nasal blockage, think about septal hematoma. Treatment of nasal bone fracture is immediate close reduction before edema start using Walsham forceps. If edema is given the question of nasal bone fracture, then wait for 7 days and then do the fracture reduction. For septal hematoma, the best treatment is IND, or the second best treatment is aspiration. Save this: septal hematoma and nasal bone fracture. Treatment is best is IND beta. Incision and drainage. What is treatment is same beta. Okay. Otherwise, it will convert to septal abscess. Problem hai, if you don't drain it, if you don't drain it, what will happen? There will be pus formation here. Infection will happen, and that will lead to destruction of the cartilage, and that will lead to a hole in the septum called septal perforation. Septal perforation. Septal perforation. Am I clear to find? Okay. Now. So let's revise, beta. If trauma, like your exam question was, child was cycling in the garden, child fell down, child has developed swelling around the nose, and there is a bilateral nasal obstruction. What is the treatment plan, beta? Answer was aspiration of septal swelling. Okay, right. There is no role of any graft in septoplasty, beta. We don't use any graft. We just remove the extra part of the cartilage, beta. Now, it's a very common problem, the septal hematoma. It happened, very common in the emergency, a lot of cases. Forget about that. My own friend, actually, ENT doctor only, who was working in the same operation theater as mine, वो मेरे पास आया, मैं कभी सर्जरी कर रहा था, सूचर लगा रहा था. He said, राजीव जल्दी खत्म कर, मेरा हो गया. आज मेरा उसका बर्थडे था. He said, my birthday, let us go for lunch. जब कोई लंच बोलते हैं ना, तुम सूचर फास्ट लगाना शुरू कर देते हो, बड़ा खत्म करो. And we went to the mall for lunch. मॉल्स में आजकल बहुत सफाई होती है बेटा. इतनी सफाई होती है, शीशे वाले गेट होते हैं. देयर आर ग्लास गेट्स विद टू डोर्स. वो शीशे गेट के 2 डोर थे, एक डोर खुला हुआ था, एक अभी बंद था बेटा. इतना साफ था, दिखाई नहीं बेटा. हम दोनों जा रहे, मैं खुले गेट से पास कर गया, वो बंद गेट से पास कर गया. भाई दड़ाम सिर मारा शीशे के ऊपर. तेरा राजीव, मेरे को सांस नहीं आ रहा. बिल्कुल. आई सॉ ब्यूटीफुल हेमेटोमा ऑन बोथ साइड बेटा. एंड लंच गया बाढ़ में. वी वेंट बैक टू द ऑपरेशन थिएटर, सेम ऑपरेशन थिएटर टेबल जिसमें उसने सर्जरी करी थी, ऐसे लेटा हुआ था. मैंने आई डिड एन IND, इंसिडेंट ड्रेनेज, एंड पुट द पैक, एंड आई सेड हैप्पी बर्थडे यार. You know what? That was a birthday party went wrong. Next, septal perforation. Beautiful. जब आप हेमेटोमा बनता हुआ देखते हैं बड़ा ब्यूटीफुल लगता है. Okay, septal perforation. Septal perforation causes trauma. Septal surgery. Surgery is also, you did a bad surgery, you made a hole. Cocaine is a vasoconstrictor. Every day you're snorting beta. So you're putting actually very strong vasoconstrictor in the nose every day. Like you're putting adrenaline in your nose every day, beta. It will cause ischemia, necrosis, beta. That's why cocaine addicts can have septal perforation, beta. Then TB, lupus, leprosy, beta. They cause perforation of cartilaginous part. I hope you remember, beta. The septum has got 2 types of part, beta. The number 1 was the cartilage part. Remaining everything is the bony part. So there are 2 types of perforation: cartilaginous part perforation, bony part perforation. Majority perforation are cartilaginous, beta. TB, lupus, leprosy cause perforation of the cartilaginous part, but the tertiary syphilis cause perforation of bony part, and this is an important question. Tertiary syphilis cause perforation of bony part. It's an important question. Number 6. Wegener's granulomatosis cause perforation of both parts. Yes, Shivendra. Okay. Vaginal granulomatosis cause perforation of both parts. I'm telling you, Wegener is highly likely possibility in the upcoming paper. Okay. If you remember, the leprosy, syphilis, TB, they were causing saddle nose also. Saddle nose also. So this question came like that. The perforation was given, saddle nose was given, and pathology finding was given. I would request all of you to revise in the break the pathology finding of tuberculosis, syphilis, and vaginous. If I remember correctly, the tuberculosis got caseating necrosis, caseating necrosis with the granulomas. And I think tertiary syphilis has no caseation over there. Vaginous is typically small cell vasculitis with necrotizing variety. Necrotizing small cell vasculitis. Okay, fine. Now, the chief complaint is whistling sound. Whistling sound. Treatment is surgical closure of perforation using septal buttons. We got the patient CT. We get the special button like that, septal buttons. Okay, septal buttons. Septal buttons are used, but they're very soft buttons. We can put these buttons on the nose to close the perforation. Okay, everybody, please click the picture and post in the group with her. TB, lupus, leprosy cause perforation of cartilaginous part. Tertiary syphilis cause bony part. This is a very famous question. Vaginal granulomatosis. Okay, right. Now, fine. This remember, this is important. Now, just write a line. One MCQ of NEET PG. Write down. Patient of epistaxis plus hemoptysis. Patient of epistaxis plus hemoptysis. Think of vaginal granulomatosis. Epistaxis with hemoptysis. First disease to come in mind here. Vaginal granulomatosis is a small cell vasculitis. There is lung involvement also. So in epistaxis with hemoptysis, think of vaginal granulomatosis. Forget to find. Sure. We'll take a break here. Have a 15-minute break. Relax. Have a cup of tea, coffee, sandwich, and come back. Okay, fine. your nose बेटा. Gate होते हैं, there are glass gates. बच्चे लिंक पूछ रहे हैं, लिंक नहीं पोस्ट हो रही. Can we start now? Everybody, you got the link? Sure. Now let us start the next topic now. Atrophic rhinitis, also called ozena. Whenever you see the word ozena, you think of MCQ of atrophic rhinitis. The disease is more common in females, and it is atrophy of turbinates. So it's also called ozena, more common in females, and basically it's atrophy of turbinates. Okay, if you do the MRI of this patient or CT scan of the patient, now please see this is the CT scan of the atrophic rhinitis. Otherwise, turbinate used to be very big in size. Remember, turbinate एकदम ऐसे मोटी ताजी हुआ करती थी बेटा. Turbinate ऐसे बनाते हैं ना, big turbinate ना. In this turbinates are shrunken बेटा, shrunken. Turbinate सूख के एकदम पापड़ हो गई है बेटा. देखो, turbinate are shrunken, atrophic turbinate बेटा. These are the atrophic turbinates, and is more common in female. It's also called a problem called ozena. Okay, now everybody, next one. Cause. Number one, autoimmunity. Vitamin D deficiency. Bone, because you know what is conca? Bony part of turbinate is shrunken. People said that vitamin D deficiency. Number three, estrogen, because female. You know, estrogen deficiency in menopause also lead to atrophy of the mucosa. Right? But MCQ is number four, beta. Infection by Klebsiella ozene. Infection by Klebsiella ozene. Infection by Klebsiella oxine. Whether it works or not, but infection by Klebsiella oxine. That's the MCQ. Wherever you see the word atropinitis, put an M. Wherever you see the word ozina, it's a question of atrophic rhinitis. Okay. Now, examination. Shrunken turbinate. Look at the picture, beta. Guys, nasal flow should be a medium flow. Less flow causes blockage. More flow causes dryness, crusting. Beta. Remember, nasal flow, medium flow होना चाहिए. ज़्यादा flow हो तो dryness हो जाती है. कम flow हो तो blockage feel होता है. I repeat in English. Nasal flow should be medium flow only. Less flow causes feeling of blockage. More flow causes feeling of dryness. In this patient, turbinate shrunken, a lot of space in the air, roomy nasal cavity, and more flow of the air in the nose will lead to crusting in the nose. Crusting, crust formation in the nose. That's a big problem. Crust is very big problem in this patient, and that's the crusting. Can you see the beautiful crusting over there? Yellow crust. Okay. Now, crust will lead to two problems. Number one, nasal blockage. Of course, nasal blockage. And the bad news is, ek buri khabar hai kya? The bad news is bad smell from patient. Like, can you see the yellow infected crust in the nose will lead to bad smell from, if you go close to patient, you feel bad smell from the patient actually. But खुशखबरी ये है कि patient को anosmia है. The bad news is there is a bad smell from patient. The good news is the patient has anosmia. Wow. Patient से smell आती है, वो तुम्हारी problem है. Patient को कोई smell नहीं आती बेटा. Patient emits bad smell. That is your problem, relative's problem. Patient has no smelling power, beta. Anosmia. Thank God I have anosmia. This is called merciful anosmia. Your paper question, beta. Patient, bad smell from patient, but patient has anosmia. This is called merciful anosmia. Merciful anosmia, beta. Merciful anosmia. Treatment. Alkaline nasal douching. Wash. Douche means wash. Wash the nose. We take a solution in the in the bottle, and we put the pressure with that, with the squeeze bottle there, squeeze bottle. There's holy ki pichkari hoti na, like pichkari, the squeeze bottle like that. We take some powder from the market. We dissolve 1 spoon of that powder in the water, and we make that solution and use that solution to wash the nose, called alkaline nasal douching. Fine. Now this douching contains, this powder contains what? This powder contains one MCI question, Fmge question, old question. Number one, sodium bicarbonate. Remember formula, sodium bicarbonate, the baking soda. Sodium bicarbonate. Number two, sodium biborate. I don't remember the formula. Sodium biborate. Sodium chloride. Sodium bicarbonate, sodium biborate, sodium chloride. That's the MCQ. Sodium bicarbonate is a baking soda. Sodium biborate, people from villages will be knowing. Boric acid powder we keep in the, our wheat and rice and all that. Sodium biborate, and sodium chloride is a salt. So it's a combination of that. Okay. Now, if you don't, this is treatment number one. This treatment number two, surgery. If you don't want to do this again and again, you have to wash your nose almost every day, beta, or maybe at least 2 or 3 times in a week. Surgery is Young's operation, but narrow not done. Nowadays we do modified Young. Modified Young operation is, put an arrow, it is permanent partial closure of both nostrils. This is your entry point of the nose now. This is the entry point I'm showing you. Permanent partial closure of both nostrils. You put a stitch over here to close this half, to close this half. Entry point of the nose may be reduced to half. Okay, fine. Less air will go in the nose, less dryness will happen. Okay, fine. Everybody take a picture of this when I say modified young, wait. Done in atrophic rhinitis, also called ozena. Female patient with nasal crust, bad smell, and merciful anosmia. Take a picture. Take a picture and post in the group below. Okay, fine. So it is done in atrophic rhinitis. You put a stitch in the front end of the nose, and there will be, female patient with nasal crust, bad smell, and merciful anosmia. If patient has anosmia and is unable to tell that she stinks, why does he present to the clinic? Patient has got other problem. Crusting is there. Now, crusting, nasal blockage is there. Na? Patient has got other problem. Nasal crusting is there. Crusting, there is a problem of, blockage in the nose. Family will tell you have a smell. Okay, fine. Now, can you take a better picture? Someone can take a better picture. Sure. The next one. Breathing issue will be there. Nasal blockage. It's written over there. Breathing issue will be there. It's written over there. Nasal blockage is what? Breathing issue only. Na? This nasal blockage is breathing issue. Yes. In operation, we stitch the entry of the nose. Yes. It is shown the picture that some doctor is stitching the front end of the nose. Sure. Let me make a summary. Third component powder is sodium chloride. Everybody. Atrophic rhinitis, also called ozena. It's atrophy of turbinate, more common in females. The bacteria responsible is Klebsiella ozene. Patient is female with the nasal crusting, bad smell from the nose, nasal blockage, but patient has merciful anosmia. Alkaline nasal douching powder contains sodium bicarbonate, sodium biborate, and sodium chloride. The surgeries done are young operation, modified young, and Luton-Slager. Main is modified young operation. It is permanent partial closure of both nostrils. This summary of atrophic rhinitis. Next topic is the rhinostoma or woody nose. Anybody tell me what was the other name of potato nose? What was the other name of potato nose? Potato nose, potato nose. Rhinophyma. 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 Very good. Rhinophyma. Now, this is rhinostoma with a hard, woody nose. Potato nose was rhinophyma. Rhinostoma is woody nose. It's a chronic granular infection of nose caused by Klebsiella rhinostomatis, also called fish bacillus. Klebsiella rhinostomatis. Anybody? What was the name of bacteria for atrophic rhinitis? What is the name of bacteria for atrophic rhinitis? Anybody? Name of bacteria for atrophic rhinitis? What is the answer, beta? Klebsiella ozine. Yes, Klebsiella ozine. This is Klebsiella rhinoscromatis, also called fish bacillus. It's more common in North India, Uttar Pradesh, Rajasthan. They might start the MCQ saying a resident of Uttar Pradesh or resident of Rajasthan with nose problem. You already have a hint. It's a question of rhinoscloma. It has 3 stages. The first stage is atrophic stage, like atrophic rhinitis. You got a chief complaint, nasal crust, bad smell. In the first stage, the disease is similar to atrophic rhinitis, and the patient will have same symptom like atrophic rhinitis. Number 2, granulomatous stage, likely to hard external nose, which is called woody nose. That's what. After few months, there'll be a changes on the outside shape of the nose. There'll be multiple granuloma formation like that, and that's why there's a feel of your hard nose, which is called woody nose. And last is stage of fibrosis. Fibrosis. So atrophic stage, granulomatous stage, and fibrosis. This granulomatous stage is the second stage, which is called woody nose. The first stage is exactly like atrophic rhinitis. Now, if you take a biopsy from here, let us take a biopsy from here and send to the lab for histopathology examination. If you take a biopsy shows, right now, biopsy shows, fill in the blank, biopsy shows Russell bodies and Mikulicz cell. Right now, biopsy shows Russell bodies and Mikulicz cells. These blue cells are Russell body, and the empty cells are the Mikulicz cell. The large, this is a Russell body with the blue cells, and these large vacuolate cells are Mikulicz cell. Okay, biopsy Russell body and Mikulicz cell. Right now, a drug of choice. Drug of choice is tetracycline plus streptomycin. Drug of choice is tetracycline plus streptomycin. Tetracycline plus streptomycin. Take a picture, beta. Take a picture. Okay, right. Very good. Very good. Okay, very good. Chalo. Let me summarize with it. At rhinoscroma, also called woody nose, the name of bacteria is Klebsiella rhinoscromatis or fish bacillus, patient mostly from North India, Uttar Pradesh, Rajasthan. The first stage of disease is atrophic stage, and it is similar to atrophic rhinitis with a symptom of nasal crusting, bad smell. So this MCQ can be confused with the atrophic rhinitis question. Second stage is granulomatous stage, which lead to hard external nose called woody nose. And lastly, fibrosis. Biopsy shows Russell body and Mikulicz cell, and drug of choice is tetracycline plus streptomycin. In the MCQ, if only crusting in the nose, bad smell, and nasal blockage given, then you mark atrophic rhinitis. If along with these symptoms also written is hard external nose, then the answer will change to rhinoscroma. Now, everybody write down here with a differential diagnosis. Atrophic rhinitis MCQ plus hard external nose is equal to rhinoscroma. Yes, Tony. Yes. Russell body, exactly. Plasma cell like inclusion bodies. Is it clear to everybody? Anybody can tell me yesterday class who can tell me Quincy like MCQ plus outer neck swelling close to angle of mandible is equal to Quincy like swelling, Quincy like MCQ plus outer neck swelling is equal to what? No starfish, that's not a good idea. Quincy like swelling plus outer neck swelling is equal to parapharyngeal abscess. Very good, parapharyngeal abscess. Okay, now the third one. So please remember this one. Attempt the question carefully. Okay, if hard smell nose not given, then atrophinitis. If everything is neither crusting, bad smell, neither blockage, along with that, if hard nose is also given, then mark rhinostoma. Now next star topic, but this time came in INICT also, rhinosporidiosis. It's infection of nose by Rhinosporidium sebri. Put an arrow. It is aquatic protozoa found in the ponds, being used by cows and buffaloes. Being used by cows and buffaloes. The common word is cattle. Patient is from village mostly, generally a farmer having cattle. Farmer is having cattle, मतलब cows, buffaloes, है ना, गाय भैंस है उसके पास. वो गाय भैंसों को तालाब पे नहाने लेके जाता है, जहां पे ताक गाय भैंसे नहाती है वहां पे खुद भी नहाते हैं, मिलके नहाते हैं बेटा, है ना. So infection is acquired by bathing in the ponds. Bathing in the ponds. Basically, it is in the pond. Aquatic, matlab what? You know, it is in the water. You see, beta. Rhinosporidium sebri. This is what. Rhinosporidium lagta hai, it looks like a fungus. No, it's not a fungus. It is aquatic protozoa found in the pond water. The pond water is mostly being used by the humans and also by the cows and buffaloes also. Generally, patient will be a villager, a farmer who has cattle, who goes to the pond to give the bath to the cattle or uses pond for his bathing or swimming, whatever. That history will be given over there. Okay. Now, the patient is mostly from coastal parts of Tamil Nadu. Coastal parts of Tamil Nadu. South of the country. It was given over there in the this time they never write the word Tamil Nadu beta, because they know Tamil Nadu knows question सबको रट्टा मारा होता है rhinosporidiosis beta, है ना. No, they did not write. They write specific story. So a resident who is a farmer, a cattle breeder from the coastal areas of southern part of the country. They make story like that, beta. They wanted to understand the topic, not ratta maro. Like, you remember, I am from Punjab. My school was a government school in my village. And our school had hardly English teaching like that. English started very late, but a 4th, 5th grade English started. And, you know, government schools are like very interesting schools. Everything happened there except studies over there. And only 2-3 teachers are there who are teaching everyone. So our English started very late. And then in the 8th grade, government sent the general knowledge book. 8th was board exam also. General 30-page book in English. Currency name, what flag picture, this kind of thing. I remember the capital name and all that. And there were some sentences also to fill that. Now, teacher ratta marwa, pura full ratta. I remember there was one sentence. अब मुझे पता है, तब तो मुझे ये भी समझ नहीं था. A person who represent one country into another country is called, आंसर था ambassador. टीचर ने एक यूनिक तरीका ढूंढ लिया याद करवाने का, country ambassador. मतलब if any question has got 2 times country word, its answer is ambassador. बेटा लड़कियां बोलती थी country, लड़के बोलते थे ambassador. Country ambassador, country ambassador चलता रहता था ये, है ना. स्पेलिंग शुड बी करेक्ट, है ना. country ambassador. मान लो क्वेश्चन आ जाता, खुदा ना खासा क्वेश्चन आ जाता पेपर में, a person who represents one nation to another nation is called. हो गया ना कांड बेटा. एक भी कंट्री नहीं बची तो कहां से निकलेगा एम्बेसडर. 2 कंट्री पे एम्बेसडर निकल रहा था, जब एक भी कंट्री नहीं बची तो एम्बेसडर कहां से आ जाएगा. इसलिए दैट्स व्हाई थोड़ा दिमाग लगा पढ़ना चाहिए, रट्टे नहीं मारने चाहिए. ओके फाइन. It's more common in coastal parts of Tamil Nadu, South India. Sites involved are nose is most common site, oral cavity, wherever the water touches your mucosa, conjunctiva, eye, and genital mucosa also. Genital mucosa. Now, chief complaint: nasal mass, number two, epistax. Nasal mass, epistax. Now, this can be tumor also, beta. This can be tumor also, no? Now, clinical picture right now. Mulberry or strawberry like nasal mass. Mulberry or strawberry like nasal mass. This one, this one. Mulberry or strawberry like nasal mass. Mulberry or strawberry like ऐसे इधर देखो. Mulberry or strawberry like nasal mass. ऐसे. Mulberry or strawberry like nasal mass with epistax. Right now, describe the examination. Pinkish red nasal mass with irregular studded surface. Pinkish red nasal mass with irregular studded surface. And bleeds to touch. Bleeds to touch. Try to remember ringlet's tumor or inverted papilloma. Go back, beta. Go back. And read the inverted papilloma. That was also pinkish red, but smooth surface nasal mass, beta. All of you, please check the topic of ringlet's tumor or inverted papilloma of nose, beta. Just above the mucormycosis topic, beta. Okay, please check that. Okay, so pinkish red nasal mass with irregular studded surface and bleeds to touch. Could you differentiate, beta? Could you differentiate everybody? Very good, beta, है ना? Fine. जैसे आपने लीची देखी है बेटा, लीची जो लीची होती है ना बेटा, वो पॉलिप होती है. जो लीची का कवर होता है ना बेटा, कवर इरेगुलर सा कवर होता है. लीची का कवर जो होता है वो राइनोस्पोरिडोसिस है. लीची, the inside part of lychee is like polyp, grayish, soft, and the cover of the lychee, which is irregular beta, that is actually of rhinosporidiosis. तुम भी बोलोगे ये बंदा लीची के पीछे पड़ गया है ना बेटा, पर याद करना पड़ता है ना बेटा, ना. Fine. Now, treatment is surgery. Excision of mass with electrocautery of base. Electrocautery of base. Cautery मतलब current. Followed by Dapsone. Dapsone is drug of choice. Dapsone is drug of choice. Okay. Excision of mass with electrocautery base. What is electrocautery, beta? Current. What is electrocautery? This current, beta. You know cautery, unipolar cautery, bipolar cautery. Burn the base with the cautery, and after the removing the mass, you give the Dapsone. Dapsone is the drug of choice, beta. Now there are very many rhino. Which rhino will have rhinosporosis? Beta, please see. The rhinostroma, rhinophyma, rhinolith, rhinosporosis. Only one rhino has D. D for Dapsone, beta. There are 4 rhino in nose: rhinostroma, rhinosporosis, and rhinophyma, rhinolith. But only one rhino has D. D for Dapsone. So was a jugaad. Do you like this jugaad, beta? This will help us recall in the paper, beta. है ना? मैंने ऐसे पेपर पास किया MRCS का, नीट पीजी का, अंडर ग्रेजुएट MBBS का. ओके बेटा, फाइन फाइन. ओके चलो, rhinosporosis में D for Dapsone बेटा. ओके चलो guys, please understand. मैं पहले रिकॉर्ड 3 type of mass. Please see 3 type of nasal masses. Number 1, polyp. Polyp is grayish, soft to touch, and does not bleed on touch. There is no epistaxis. Okay. Number 2 is inverted papilloma or ringlet's tumor. The nasal mass in that case is the pinkish red, firm, and then it is having smooth surface and bleeds to touch. And rhinosporosis patient again has nasal mass with epistaxis, but this nasal mass is pinkish red, firm, with irregular surface, and it also bleed to touch. And in rhinosporosis, there will be history of patient coming from coastal part of south of the country, and there will be history of bathing in the ponds also. Okay, fine. So please label this audio as nasal mass differential diagnosis. Yes, have you written the word firm, beta? Firm, pinkish red, firm nasal mass, beta, firm. Polyp is soft, beta. Pinkish red, firm nasal mass. एक word add करो, firm. ओके बच्चे, फाइन. यस, डिड यू राइट इन्वर्टेड पैपिलोमा में फॉर्म वर्ड? एक मिनट में चेक कर लेता हूँ. हाँ बेटा, पेज नंबर 84, पिंकिश रेड नेजल मास, फॉर्म वर्ड है, फॉर्म. पॉलिबस सॉफ्ट, बेटा लिखो बेटा. 84 पेज नंबर, रिंगलेट्स ट्यूमर, गो ओवर देयर, पिंकिश रेड, फॉर्म बेटा, फॉर्म. Okay. Dr. Nitesh, my chief surgeon, at the end of the nose sinuses, please put all the audios together of nose sinuses. Form मतलब soft नहीं बेटा, ना hard ना soft, बीच में होता है firm. Hard होता है अखरोट, you know, the hard, some shell of the, you know, walnut is hard, है ना? Then, you know, you have got soft thing, beta. For example, cotton is soft, like that. But in between your, for example, you have got a, you know, like that smiley ball. You know, smiley ball, जो हाथ में yellow ball पकड़ते हैं ना, that is firm. ना soft, ना hard. बीच में. No, firm is not hard, beta. Firm is between soft and hard. चलो वापस आओ. Let me record the rhinosporosis now. Everybody here with me and revise the rhinosporosis. In the meantime, keep this picture in mind that patient is coming from the, you know, history of this thing. So everybody, rhinosporosis is infection of the nose caused by Rhinosporidium sebrae. It's aquatic protozoa found in the pond water. Patient is generally a farmer, a villager, a cattle breeder. The history will be of bathing in the pond or swimming in the pond. The pond is being used by the cows and buffaloes also. Patient will be having the nasal mass and epistaxis. The nasal mass is pinkish red, firm, but irregular studded surface is the main thing, and it touches and then it bleeds actually. Treatment is surgery, remove the mass with the electrocautery of the base. After that, Dapsone is given. That's a drug of choice. This is rhinosporosis. Chalo. Now, next topic. Next topic is about the CSF rhinorrhea, very important topic. CSF rhinorrhea is leakage of CSF from nose. Okay, CSF. Most common site is cribriform plate. is part of ethmoid bone. Okay, cribriform plate part of ethmoid bone. Everybody, this is top of the skull. Top of the skull. Anybody, what is this instrument pointing at? Rhinostoma treatment as surgery followed by Dapson. Everybody, can you tell me what is this structure being pointed at? Very good, beta. Very good. Cribriform plate. This is orbit. Orbit. And between the two orbit, which bone is there, beta? Which bone is there, beta? Ethmoid bone. Okay. And this structure is pointing at what? This structure is cribriform plate. This is the visual question of NEET PG. Cribriform plate. Cribriform plate. Chalo. Yes, can you take a picture and post the group with the cribriform plate? Ethmoid bone between two orbits, and this is cribriform plate. Cribriform plate. This is an anatomy question of NEET PG visual question. Very good. And you know they're ready-made holes, so the CSF can leak very easily from them. So basically, the causes are surgery like FES, head injury, traumatic CSF leak, like, ethmoid bone fracture. Please highlight this word. Ethmoid bone fracture are the main thing to cause CSF leak. Ethmoid bone fracture will be linked with the CSF rhinorrhea. हो बस करो, एक ही फोटो डाली जाए 3-3 बार बेटा. And this is blood mix CSF trauma wala. On filter paper, it gives target sign. Or halo sign. Or double halo sign. Target sign, halo sign, double halo sign is a star question. Beta. Target sign, halo sign, double halo sign. This last में ना we will do this important images, important audios. हम last में आज कोशिश करेंगे 3 टॉपिक डाल देंगे, लैरिंग्स, फिर फेरिंग्स और नोज, सिस्टमैटिकली डालेंगे बेटा. उसके बीच में कोई अपना प्रवचन नहीं डालेगा. जब भी कोई डाल रहा होगा उसको डालने देना, एक बार पूरा का पूरा सिस्टमैटिक डल जाएगा. इमेजेस, ऑडियोज ऑफ लैरिंग्स, देन नोज एंड फेरिंग्स. तो that is a reference point for all of us. Okay. Target sign, halo sign, double halo sign on filter paper. It's seen in traumatic CSF leak. Not every CSF leak, but traumatic CSF leak. Please see, beta. This is blood coming from this CSF. It has got some blood also. Beta. Please see. CSF got some blood also over here. It is blood mix CSF. Now, if you keep a filter paper below the nose, let one drop fall on the filter paper, dry it and see it. You will see there is a red center, which is due to blood. Around that, there is a halo or double halo sign. Beta. Okay. But target sign, or please remember T for target, T for traumatic. Not every CSF leak. Beta. There can be CSF leak without any reason also, idiopathic also. Beta. Okay. Now, number 3, beta. Brain tumors. Brain tumor can also CSF leak. Number 4, spontaneous CSF leak without any cause. Spontaneous CSF leak. Spontaneous CSF leak. Okay, fine. Now, next point. Please look at this. Imagine we are seeing the patient in the OPD. Patient comes with the fluid coming from the nose, and I say it is nasal discharge. My friend, my co-surgeon, Dr. Nitesh Sharma says, no, Dr. Dhawan, it is CSF. Now, how to solve this controversy? Next point, madam. Please see. Please cut the word other. Test or point to differentiate CSF from nasal discharge. CSF is non-sticky. Handkerchief test. Okay, non-sticky beta. पानी की तरह होता है. पानी की तरह. Non-sticky like what? Look at everybody. Okay. नितेश भाई, तुम ऐसे तो नहीं करने वाले कि अपनी उंगली ऐसे नाक के नीचे रख के पेशेंट के एक बूंद गिरने की वेट कर रहे हो, जब गिरेगी तो ऐसे देखो ये चिपचिपा है कि स्टिकी और नॉट. इतना डेडिकेटेड नहीं हो जाना बेटा. डोंट बी अ गॉड, डोंट बी अ डॉग. Don't do both the extreme, beta. Both are bad. If you want to have a happy life, be moderate in whatever you do. Don't be a god, don't be a dog. Both are bad extreme. Be a monkey. Be a monkey, beta. है ना? In between रहो, सही रहोगे, मस्त रहेंगे, खुश रहेंगे, स्वस्थ रहेंगे, है ना बेटा? अगर ऐसे करोगे ना मतलब ये इस तरह this kind of practice will make you fatigued after few. कोई पेशेंट ज्यादा खुश नहीं होगा, तुम बोलेगे यार मैं इतना मेहनत काम करता हूँ. मजे मजे काम करना चाहिए, है ना? Okay, fine. So, handkerchief test. Fine. अपने रुमाल पे नहीं, पेशेंट के रुमाल पे. Okay. Now, number 2, beta. Patient cannot sniff back CSF. Patient cannot sniff back CSF. Beta. Sniff back तो पता ही होगा आपको. Sniff back है ना? Look at me, sniff back. ऐसे इधर में तो स्निफ बैक क्या होता है? चलो याद है जब भी कोल्ड होता है, व्हेन यू बैड कोल्ड ना, एंड ऑन दैट डे इज वैलेंटाइन डे आल्सो, एंड योर गर्लफ्रेंड इज सिटिंग अक्रॉस द टेबल एंड इट्स स्टारबक्स एक्चुअली. वाओ, स्टारबक्स यू आर सिटिंग एंड बहुत अच्छी बातें चल रही हैं वैलेंटाइन डे की, और आप बीच में टिश्यू यूज कर रहे हो, नाक साफ कर रहे हो, तो कोल्ड है, वायरल हो रखा है, बहुत ज्यादा कोल्ड हुआ है, फिर बहुत इमोशनल बातें शुरू होती है, और उस बात के चक्कर में आप भूल जाते हो कि नाक भी साफ करना है. फिर क्रिटिकल मौका आता है कि वो ड्रॉप टेबल पे गिरने, स्टारबक्स के टेबल पे ड्रॉप वो गिरने वाली है, उसी समय आप ऐसे करते हो और मौका संभाल लेते हो, है ना? क्या करते? पीछे गिरते, है ना? कर लेते ना, है ना? एटलीस्ट नहीं तो गिर जाता तो कितना एम्बैरेस था. वही वैलेंटाइन लड़की छोड़ के भागेगी तो इसको तो पता ही नहीं लगता उसमें, है ना? फाइन. नाउ नेक्स्ट वन बेटा, बायोकेमिकल एनालिसिस. बेटा बायोकेमिकल एनालिसिस और क्या? CSF, you cannot, CSF will fall on the table. However you may try, whatever, CSF will fall on the table, beta. Okay. Most confirmatory test is अभी भी मेरी और नितेश की लड़ाई चल रही है. नितेश अभी कह रहा है डॉक्टर धवन नहीं, मुझे लगता है CSF. I still feel it is CSF. Then that's the MCI question. Beta. Okay. Now, beta 2 transferrin estimation. Beta 2 transferrin estimation. Beta 2 transferrin estimation. CSF is sweet like glucose. मैंने टेस्ट नहीं किया था भैया. But you must be sweet like glucose, I think, Nirvana. Beta 2 transferrin estimation. Beta 2 transferrin estimation. Still we are having a doubt. So then, this is MCQ beta. If still doubt is there, then the best test for the CSF leak is the beta 2 transferrin estimation. This protein is found in the CSF, not in the nasal discharge. Beta. So this protein was positive and Nitesh was right. I was wrong. This was CSF only. So Nitesh bhai bilkul sahi the. Ekdam sahi. It was CSF because there is evidence of beta 2 transferrin protein and that's the most confirmatory test. Okay, fine. Now everybody, now look at me, beta, look at me. Now next is how to find the site of leak, beta. Now, which part of cribriform plate did damage? Now, number 1 is nasal endoscopy. Okay. Nasal endoscopy. How will you see on nasal endoscopy, beta? Because CSF is colorless like water. Let us do one thing. With the fluorescent dye intrathecal lumbar puncture. It is very difficult to see colorless liquid, beta. Water cannot be seen from where it is coming on endoscopy. But if you put through lumbar puncture a dye called fluorescent dye, this will give green color to CSF, beta. Please, can you see green color? Beautiful green color is out there, beta. Now you do endoscopy, you can say, oh, this part of the nose roof is leaking over there with the CSF. It's easy to see that, beta. Are you getting my point, beta? CSF pani ki tarah hota hai. It's colorless. It's difficult to see what water it's, but if you put holy color in the water, then you can see that color, beta. The colored water can see. So do the lumbar puncture, do the fluorescent dye injection. This will give green color to CSF. Put an arrow. This will give green color to CSF. This will give green color to CSF. Chalo. Next one, beta. CT cysternography. Write down. It's important, beta. Radiology question. It is invasive radiological investigation. Intrathecal means lumbar puncture. Intrathecal means via lumbar puncture. Invasive radiological investigation in which a contrast is injected into CSF via lumbar puncture followed by CT scan of head. It is invasive radiological investigation in which a contrast is injected into CSF via lumbar puncture for CT. You know what is CCT, contrast enhanced CT? In contrast enhanced CT, where you give the contrast, beta? In the vein, here. In the vein, you give the contrast. In this case, you do the CT head only, but before you do CT head, you do lumbar puncture and you inject the same contrast in the CSF. Beta. Okay, to find. MRI, T2, beta, T2 images, highlighted about T2. But the best radiological investigation is HRCT skull base. HRCT skull base. Ashneer Grover. Not Ashleil Grover. Okay. HRCT skull base. HRCT skull base. अब तो मुझे भी लग रहा है कि मेरे को देख के लग रहा है कि हम एक जैसे लग रहे हैं दोनों मैंने कोई ध्यान नहीं दिया ये बात पे, बट अब मैं देख रहा हूं तो ये कुछ कुछ तो है भाई. HRCT skull base. Now, what is HR? Anybody? Okay. HR, high resolution beta. Okay. Treatment beta. Treatment is conservative. Right now beta, urgent surgery. दिमाग में आएगा तुम्हारे, नहीं लगाना. Don't mark urgent surgery beta. Don't, because CSF सुनते ही आंखें ऐसे खुल जाती है हमारी. CSF हो CSF because physiology वाले CSF ऐसे पढ़ाते हैं जैसे अमृत हो बेटा. CSF will look as a very important fluid, it looks like to us. CSF is being continuously manufactured also. CSF है क्या भाई? CSF है नींबू पानी है बेटा, माउंटेन ड्यू है, स्प्राइट है, और है क्या? CSF में है भी क्या? CSF बन भी तो रहा लगा था. Don't worry about CSF. It's only चीनी, पानी और नमक. That's all बेटा, है ना? That is continuously manufactured also. Don't do urgent surgery. This is the biggest mistake we do beta. Okay, fine. Okay, fine. Treatment is conservative treatment for 7-10 days with bed rest and antibiotics. Don't worry, beta. It's a fracture of the cribriform plate. Give the nature a chance. It might heal on its own. Give the nature a chance, beta. It might heal on its own, beta. Okay. Fine. Because wait for 1 week, 10 days. If does not heal, then you do surgery, but don't mark urgent surgery. Okay, don't mark urgent surgery. Chalo. Now let's revise CSF rhinorrhea. Everybody, main point of CSF rhinorrhea. CSF rhinorrhea, the most common site is cribriform plate, which is a part of ethmoid bone. So ethmoid bone fracture are commonly associated with the CSF rhinorrhea. The cause, number one cause is surgery like FES. Second is head injury, and that's called traumatic CSF leak. T for traumatic, T for target sign or halo sign or double halo sign on filter paper, which is seen in the traumatic CSF leak. And the most confirmatory test is the beta-2 transferrin estimation. Best radiological investigation is HRCT skull base. We also do MRI, but T2 images. In this patient, do not do urgent surgery. First treatment of choice is conservative treatment with bed rest and antibiotics for 7 to 10 days. Okay, so this is CSF rhinorrhea. Now, next topic is blood supply of nose beta and epistaxis. Chalo beta dekho. Epistaxis is a very common problem in children, adult also, mainly in children. Now, please understand the blood supply. Please, this is the middle turbinate, MT1 middle turbinate. Below this, we have got external carotid artery. Above is brain side, we have got internal carotid artery. This is 80% total blood supply. This is 20% of the blood supply. Okay. Now, 3 arteries go from here, from the ECA. 2 arteries come from the ICA side. Everybody, what lies below the nose? Below the nose is what? Upper lip, hard palate, soft palate. Lip, palate, palate. Upper lip is superior labial artery. Hard palate, greater palatine artery. Soft palate, sphenopalatine artery. Palate, palate, lip. Lip, greater lip, the superior labial, greater palatine, sphenopalatine. Okay, fine. Anybody, which bone is between 2 orbit? Which bone between 2 orbit? Ethmoid bone. What is the name of artery? Anterior ethmoidal and posterior ethmoidal artery. See, it's not that difficult as books say. Books, jo hai, who are authors? Who are author are the people who make simple thing complicated. I believe in one thing. Things should be scientific, conceptual, high level, but still simple. I believe in one thing, the knowledge should be simple, scientific, conceptual, but yet manageable, revisable, understandable. Not कि इतने ज़्यादा लिख दो, इतनी कहानियां बना दो कि बंदे को मेन कहानी भूल जाए सारी की सारी. But look at the logic over there. Below the nose is lip, palate, palate. So lip plus superior labial, upper lip, greater palatine, hard palate, sphenopalatine, soft palate. And the anterior ethmoidal and posterior ethmoidal artery. Let's put this picture. Now let's fill the. Now right over 80% is from this area, 20% from this area, and between the two, draw a division. बहुत घटिया डिवीजन बनेगा. Okay, optimal turbinate is ECA. Written over here, Dr. House, ECA. ECA gives 2 branches, maxillary, facial. From maxillary, sphenopalatine artery, greater palatine artery, and from facial, superior labial. Below the nose is lip, palate, palate. The name of artery is superior labial, greater palatine, sphenopalatine. Okay, Dr. House. Above the middle turbinate is ICA. Right now, ICA is missing. ICA, that gives ophthalmic artery, and that gives 2 branches, anterior ethmoidal and posterior. This is only 20% of circulation. and it is coming from ICL. So basically, any bleeding from the upper part of the nose, you should target the ethmoidal artery. The artery of epistaxis is sphenopalatine artery. That's a very famous question. Sphenopalatine artery. Any bleeding above the level of middle tribunate, you must ligate ethmoidal artery. Any bleeding which is occurring from area above middle tribunate, you must ligate the ethmoidal artery. Now, epistaxis, beta. Bleeding from the nose, please see on the screen, beta. Very common thing, beta. This is bleeding, beta. You remember school time, beta, naksir food jana, epistaxis, beta, na? Bleeding from the nose. Most common area is little area. On septum, it lies on the antero-inferior part of septum. Look at me, beta. Right in the beginning of the nose, beta. Right. When you put your finger in the nose, which you do, I know that. And then you touch your septum from here. Septum on the septum, that's a little area. What is that little area, beta, that bleeds? Little area next page, beta. It has got Kieselbach plexus of 4 arteries. Of 4 arteries, beta. Okay. Which 4 artery, beta? MCQ. Sphenopalatine, greater palatine, superior labial, anterior ethmoidal. But important question is, posterior ethmoidal artery is not a part of Kieselbach plexus. Okay, please write it PE and cross it. The total 5 arteries. So sphenopalatine plus greater palatine plus superior labial plus anterior ethmoidal. Okay, this is the composition of Kieselbach plexus. The name of area is little area, and the plexus in that area is the Kieselbach plexus, and this area is the area which is bleeding actually. This area. Everybody, this is the area. So this is the front of the nose. Okay. Name area, little area. The name of plexus in that area is Kieselbach plexus. It is made by 4 arteries: sphenopalatine, greater palatine, superior labial, anterior ethmoidal. But posterior ethmoidal artery is not a part of this plexus. Now, causes of epistaxis, beta. Most common cause of epistaxis is fingernail trauma or nose picking. Most common cause of epistaxis is fingernail trauma or nose picking. Epistaxis is mostly disease of children, beta. है ना? फिंगरनेल ट्रॉमा क्या? स्कूल में टीचर पढ़ा रहा है, बच्चे अपनी दुनिया में मस्त है बेटा, ऐसे नाक में उंगली घुमा रहे बेटा, बैठे 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 अपनी दुनिया में मस्त हुए होते हैं. रोज उंगली मारते 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 क्या होता है, एक दिन व्हाट दे डू इज दे डैमेज अ लिटिल एरिया, and from that area bleeding starts. Then we do what? We ask the child to do like this. We press the little area, bleeding stops. There's a clot formation there. After a few days, again somebody scolds the child. किसी बच्चे को डांट दिया, बच्चे रोते हुए ऐसे नहीं करते थे ऐसे, and the clot displaced. Again bleeding started. It became a recurrent thing actually like that. Okay, fine. Now, number 2, in older people we get hypertension and the bleeding is posterior. Dr. Dhawan, blood is falling in my throat. Posterior bleed, beta. Majority epistaxis are anterior, like this. Anterior, like this anterior. This is anterior, beta. That's anterior. But in hypertension, it is posterior. Put an arrow. Severe. Why epistaxis is more common in summers? Because summers, there's a lot of dryness in the nose, beta. एंड व्हेन द किड्स जो क्रस्ट बन जाते हैं उनको बड़ा मजा आता है निकाल, देखा नहीं कैसे लगे होते हैं, ऐसे उंगली मार के निकाल के देखते रहते हैं, ठीक अच्छा निकला, पूरा निकला कि नहीं निकला. व्हेन दे रिमूव द क्रस्ट, दे रिमूव द मिकोजा आल्सो. दैट्स व्हाई. Okay. Number 3, accidental trauma. Accidental trauma. Okay. Number 4, bleeding disorders. Important. Hemophilia. Bleeding disorder like hemophilia. 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 Have you heard the word von Willebrand factor deficiency? सुना आपने ये नाम कभी? सुना सुना लग रहा है कि सुना सुना लग रहा है बेटा? वॉन विलीब्रेंड फैक्टर डेफिशिएंसी, सुना सुना लग रहा है कि सुना सुना लग रहा है? Have you heard it? Have you heard? Okay, fine. This occurs in India, beta. Don't think the names are English, European names. Disease occur in Europe or America. Disease occur in India. India, beta. भारत 140 करोड़ जनता का देश है. Every sixth human on the planet is Indian right now. बीमारियां इंडिया में होंगी, बाहर नहीं होंगी बेटा. न्यूजीलैंड में 50 लाख लोग रहते हैं. पूरे न्यूजीलैंड में 50 लाख, न्यूजीलैंड पॉपुलेशन 50 लाख बेटा. 50 लाख लोग हमारे यहाँ पे कुंभ के मेले में एक ही दिन में नहा के चले जाते हैं. यूपी में कुंभ हुआ था पीछे, एक ही दिन में 50 लाख लोग नहा के चले गए थे बेटा. ये बीमारियां हमारे देश में होती, कनाडा में नहीं होती. सेकेंड लार्जेस्ट कंट्री ऑन द एरिया वाइज बेटा. पॉपुलेशन 3 करोड़ 35 लाख. पॉपुलेशन कनाडा 3 करोड़ 35 लाख बेटा. ओनली उत्तर प्रदेश हैज गॉट 7 कनाडा इनटू इट. उत्तर प्रदेश में 7 कनाडा बसे हुए हैं. 7 कनाडा इन उत्तर प्रदेश ओनली. और कनाडा बोल रहा है हमें वीजा नहीं देगा. क्यों नहीं देगा भाई? हमें तो देगा, किसी को नहीं देगा, है ना. सो डिजीज डू नॉट अकर इन वेस्टर्न कंट्रीज, इन इंडिया, because in India people are many better. So don't go on the name better. Don't go on the name. Disease occur in India. Fine. Next one better. Anticoagulant drugs like cisplatin, aspirin, warfarin, heparin, clopidogrel, hemorrhage fever like dengue better. Okay. Fine. Hemorrhage fever like dengue. Number 7 better. Angiofibroma. Angiofibroma. Number 8 is very important, beta, right? Number 8, most important, number 8, beta. Put a star, beta. Put a star. Number 8, most important, etc. 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 There are many thousand disorders, beta. 1,000 causes. There are many causes, beta. है ना? Don't forget bleeding disorder, antiviral drugs, and the hemorrhagic fever like dengue. Fine. Chalo. Treatment, beta. First of all, pinch the nose for 2 to 3 minutes. School. When you pinch the nose, you pressing which area? Little area, that works, beta. If that doesn't work, then chemical cauterization, matlab burn that area, beta. Okay, with the silver nitrate, AgNO3, beta. Silver nitrate. Use that silver nitrate to burn that beta. Always sit up, beta. If you are bleeding in the school or anyone, you just ask the patient to sit up. Don't lie down, beta. Sit up and bend like this, beta. Bend like this. Okay. Now. स्टार बना दिया था, रख लो, काम आएगा बाद में. एक बार पक्के वो स्टार रहने दो बेटा. वहां पे स्टार जो तुम पक्के एकदम जब उसको रिवाइज कर रहे हो ना बेटा, वो स्टार को रहने दो. एकदम थके पक्के पड़े हो, वो स्टार देखे तुम्हारे मुंह पे शायद हंसी आ जाए. ओहो, है ना, शायद हंसी आ जाए. रहने दो. Then we do the anterior nasal packing on both sides. Put an arrow, beta. If this fails, silver nitrate, then only, beta. Okay. Anterior nasal packing on both sides. We take the tape gauze, folded gauze, we apply liquid paraffin on that, and then we pack the nose like this, like this. We take pack it. There's a lot of spaces there, but a whole pack will go inside, one side, then other side also. So the pressure come from both sides. One side, both side. Fine, like that. Fine. If anterior packing fails, then posterior packing, beta. Actually, anterior packing does not reach up to choana. What is choana, beta? Anybody, what is choana? What is choana? Choana is the posterior opening of nasal cavity. Very good, beta. And now please see, if the bleeding is from there, the bleeding will continue still, beta. Okay. Now let's put another pack called posterior pack, beta. That's the anterior pack, and this is the posterior pack. The pink one is posterior pack. Two packs are there. So anterior pack plus posterior pack. The MCQ is, if both packing fail to control the bleeding. Now this is important question, beta. Clinical question. If both packing fail to control bleeding. Anybody? What is artery of epistaxis? What is artery of epistaxis? Sphenopalatine. Treatment is surgery. The surgery is called ESPAL. Endoscopic sphenopalatine artery ligation. When the packing fail, it's a serious case. When the packing fail, it's a serious case. Now you'll have to ligate the arteries one by one, beta. First artery to ligate is sphenopalatine artery, beta. This was the fourth question of the July paper of Fmge, which people are saying was a very unmanageable paper. Okay, it was highly difficult paper, but still it had certain questions which were there to score 180, 185 questions were there, beta. Let me tell you, 4 questions of nose only, beta. Bulla ethmodalis is in which meatus? Middle meatus, beta. Number 2, blue baby turns pink on crying. McGovern technique, put nipple in the mouth to save the baby of choanal atresia, baby, beta. Second question. Third question, beta. A polyp pale in color and growing backward, most visible on the posterior rhinoscopy. What is the answer, beta? Antrochoanal polyp. Fourth question, beta. Which artery is the culprit if bleeding does not stop with the packing and all? The answer is sphenopalatine artery. You tell me, beta. Okay, people have got like this notion that paper is unmanageable. I understand that, beta. There were certain areas very difficult. Paper 1, मैं ये नहीं कह रहा बेटा. मैंने तो खुद Instagram live पे मैं इसीलिए 3 दिन पहले ही आ गया था, रिजल्ट के पहले 3 दिन पहले कोई फीलिंग ऐसी आ रही थी, रिजल्ट अच्छा नहीं आ रहा इस बार. I had to tell all the parents particularly that paper was tougher. Okay, but one thing is sure, that how 10% people pass the paper, was it sheer luck or more knowledge? No, knowledge was more or less same. In fact, people had more knowledge after repeating second time, third time. The only thing was, when you are repeating, you are more afraid of the outcome. In fact, जो लोग रिपीट कर रहे हैं बेटा, मैं उनको साफ साफ बता दूं, मैंने खुद रिपीट किया नीट पीजी पेपर. मेरी बात ध्यान सोच लो बेटा, जब जाओगे पेपर देने, ऐसे जाना पहली बार जा रहे हो. ये होता कि नहीं होता, करना पड़ता है. ब्रेन को ट्रेन करना पड़ता है. ट्रेन द ब्रेन, थिंक दैट. मैं ये सोच के नहीं जा रहा कि वरना प्रेशर आ जाएगा अगर इस बार भी नहीं हुआ तो. ये सोचना नहीं है बेटा. थोड़ा सा ब्रेन, let's give the right command to brain, beta. Brain accepts command if given repeatedly. Brain accept command. मैं क्यों कह रहा हूं पेज पे लिख के लगा लो बेटा, लगा लो. हम कल एक चीज करेंगे. कल I want everyone जो भी कंफर्टेबल है, अपनी फोटो, एक आपकी लर्निंग पूरी क्लास के साथ, क्या सीखा आपने क्लास में, क्या आपकी लर्निंग थी, क्या आपकी एक चीज जो आपके दिमाग को लगता है कि आप फॉलो कर सकते हो, वो लिख के वो फोटो शेयर करेंगे, है ना. I'll make a collage of that. I'll try to do that. अगर मैं कर पाया तो we'll share that. Like what is your learning? One thing which you think you can really follow, and you think will help you, share that. Then stick on to that. वो जो फोटो है अपने एक अपना स्क्रीन सेवर बना लेना, पढ़ना है उसको बेटा, मैंने क्या सीखा ईएनटी क्लास से, ऐसी क्लास क्या चीज सीखी कि जिसको पास होने में मदद मिलेगी मुझे बेटा, जिससे मेरा ये जो पूरा का पूरा जो खेल है उसमें मदद मिलेगी. That's why say brain takes commands. If you give the command repeatedly, you start training your brain. Train your brain in such a way that don't feel too much pressure of what will happen. थोड़ा एटीट्यूड बनाना है कि जो भी हो देखा जाएगा, मैं अपना बेस्ट खेल खेलने जाऊंगा, मैं डरूंगा नहीं. I will not be scared. I already know there will be unknown question, but I will not do silly mistake. I will, in the type 2 question, type B question, I will behave like a clinician, think and rationally answer the most probable diagnosis or most appropriate drug of choice, whatever it is. Now, if like these are the 4 questions, beta, देखो बेटा, 4 question out of nose only, beta. Sometimes full psychiatry, full anesthesia doesn't give 4 question, beta. You know ना psychiatry, delusion के बाद फिर delusion ही हो जाती है बेटा, है ना? You know it ना? Fine. So let us write something and read it every day. What we learned from the ENT class, which actually, if we give this command every day to our brain, what will be printed in my brain, and that will help me in the exam day. Okay. Next one, beta. Maxillary artery ligation, TC beta, or ECL ligation. If ECL ligation also fails, then ethmoidal artery ligation. Because 20% come from ICL. MCQ beta. If ECL ligation fails, there is a star question of NEET PG. If ECL ligation fails, beta, then we do which ligation? Ethmoidal artery ligation. Why? Because 80% come from ECA, but 20% still come from ICA via ethmoidal arteries. When we do the packing on the nose, we have to breathe through the mouth. We keep the pack for 48 hours. We put the posterior pack through the mouth. We have to give general anesthesia to put the posterior pack. This is MCQ. So what are the questions to be kept in mind, beta? For epistaxis, first is, remember the 80% come from the ECA, 20% come from the ICA. That's why I said that when ECA ligation is done, beta, when you do the ECA ligation, still 20% coming from ICA. That's why you're doing the ethmoidal artery ligation. Okay, beta, fine. Then artery of epistaxis is sphenopalatine artery, beta. Most common area, little area. Plexus name is Kieselbach. Which artery not a part of plexus? Posterior ethmoidal. Hypertension causes posterior epistaxis, beta. Next one is silver nitrate is used for cauterization. If both packing fail, then ESPAL. What is ESPAL? Endoscopic sphenopalatine artery ligation. And if ECA ligation fails, then we do the ethmoidal artery ligation. You're going to find, draw a diagram, beta. ECA ligation, beta. Common carotid. This is neck. This is ECA, ICA. How you differentiate ECA from ICA in the surgery, beta? This is an anatomy question. मेरे को पूछा गया था बेटा, मुझे पूछा था जब पहली बार मैंने देखा ना ECA ligation. Surgeon opened the neck. He called me, Rajiv, come here, tell me which is ECA and which is ICA. Anatomy वाले बताते हैं ना बेटा, anatomy वाले बताते हैं anteromedial, posterolateral, ऐसा कुछ नहीं होता. When the neck is open, everything is anterior, beta. Anterior. ऐसे दोनों artery move कर रही होती है बेटा. Okay. The only rule is that ECA has many branches in the neck, 8 branches, beta. ICA has no branch in the neck. ICA has no branch in the neck, beta. Not every ligation is endoscopically, beta. Only sphenopalatine artery ligation is endoscopic, rest is open, beta. So we have open the neck, Please put an arrow like this, beta. This is Okay, fine. जी बेटा, just read this carefully बेटा. नहीं नहीं, ईयर अभी शुरू कर रहे हैं बेटा, अभी नहीं. Even if I don't know 75 questions, I'm a topper. I don't have any idea about 75 questions. 75 new topic questions are there. I can still score 235 बेटा, है ना? Why? Look at me बेटा, look at me everybody, look at me everyone. Please see, people who score 235, they look like gods to us बेटा. Gods to us बेटा. 235, 10 marks are of guess in them. Minimum बेटा. ध्यान दो बेटा, ध्यान दो. 10 तो नंबर आएंगे. सोचो आपको 100 क्वेश्चन नहीं आते. 100 क्वेश्चन यू आर मार्किंग गैस ओनली बेटा, गैस ओनली, यू आर मार्किंग गैस ओनली. गाइस, आप 100 क्वेश्चन यू आर मार्किंग गैस, एटलीस्ट 10 विल बी करेक्ट. 10 क्वेश्चन यू मार्क सी 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 सी, एक ना एक सी तो सही होगा. 100 क्वेश्चन को तुक्का मारा, 10 क्वेश्चन का सी लगा दिया, एक सी तो सही होगा. मैथमेटिकल थ्योरी के हिसाब से भी एक नंबर तो आएगा ना. अगर तुम्हारा एक भी सी ठीक नहीं है, ये भी गलत है, सारे ही गलत है सी, तो तुम पक्का सी हो फिर तो. या फिर आज तुम्हारा सी कटना ही कटना है बेटा, फिर तो पक्की बात है. फिर तो कुछ आज नया होने जा रहा है बेटा. फिर तो ऐसा नहीं होता. आउट ऑफ 100 guesses, 10 are correct for everyone. Okay, please understand that. Now that people who score 235, they look like gods to us, but actually their exact knowledge is not more than 225. Some are guessworks for them also. People who score 200, जिनके 200 नंबर आते हैं, they also look like smaller gods to us. छोटे मोटे भगवान तो वो भी हैं बेटा, वो छोटे भगवान लगते हैं. 235 में बड़े भगवान लगते हैं. जिसके 200 नंबर आए हैं, उसके भी 10 तुक्के लगे हुए. 10 guesses, नंबर आर 190. जो ये छोटे भगवान हैं, इनको भी 100 क्वेश्चन नहीं आते थे, और हम मरे जा रहे हैं कि अगर पूरा पेपर आता होगा तो ही हमारी तैयारी अच्छी हो रखी है. ऐसा नहीं है भाई. Within the time constraint you have, you cannot know everything about everything. Revision is a problem, question karna problem, everything is a problem. But think about the paper. This is a manageable paper. Without negative marking, you have to score 150 out of 300. I'm not saying it's easy task, manageable task, even if the paper comes tougher than the July paper. Think about the person who is scoring 200, उसके 190 क्वेश्चन है. मैं कह रहा हूं चलो ठीक है, 190, इसके प्लस 10 आ गए तो गैस से 10 सिली मिस्टेक इसने भी करी बेटा, -10. चलो, उसके 200 क्वेश्चन बिल्कुल उसको आते थे, और उसने 200 क्वेश्चन में 10 तुक्के, बाकी 100 में 10 तुक्के मारे, तो उसके 210 होने चाहिए थे. लेकिन उसके 10 सिली मिस्टेक थी, इज इक्वल टू 200 अगेन बेटा. चलो, 200 क्वेश्चन ही न्यू, 100 क्वेश्चन ही ऑल्सो और शी डिड नॉट नो ऑल्सो बेटा. Why you are so scared that you should know every question, then only you'll pass the paper बेटा? Please understand the game of paper. The game of paper is that you should know how to play the paper. Very well knowing there'll be many questions बेटा, which you'll not be having any idea about. Guys, please find 150 question बेटा, which you are 100% sure about. Please understand बेटा, 150 में +10, -10 बेटा. By chance you do some silly mistake, or then you get 10 marks from the guess also neutralized better. 150, 170 question you have fair idea about. Don't do silly mistake too many. Don't really, change the answer too many times. This is mathematical thing better. I don't like to motivate people. In fact, I hate this word also called motivation. Tell me the practical reality of the paper. Practical reality is Even if you have idea about 180, 190 question properly, you don't do silly mistake many in the known question. In the partially known question, you try to do think beyond notes, think like clinician, think common, mark the answer after thinking, don't change the answer, stick to the answer. We are very close to 170, 175 marks. बेटा आई नहीं है बेटा, मैक्सिमम मार्क्स जो है वो आई नहीं है. बहुत सारे लोगों को लगता है कि पता नहीं कितने नंबर आते हैं, एवरेज नंबर ही 235 के आसपास है बेटा. चलो, just a mathematical thing. Now everybody, let us start the year part 1. Let us start the year part 1 now, everyone. Now, the first part of the year is about the embryology, development of pinna. The tragus of pinna develop from, this is tragus, number 1 is tragus. Tragus of pinna develop from first branchial arch, rest of pinna from second branchial arch, and this line of union, write down, this line of union is called incisura terminalis. Incisura terminalis is the junction of first arch and second arch. There's no cartilage in incisura terminalis. There's no cartilage. No cartilage there. There's no cartilage in incisura terminalis. You got tragus, different cartilage, rest of it a different cartilage. This line is incisura terminalis. There's no cartilage. Tragus is a part of pinna. My dear friend, this is tragus. This is tragus. Tragus is part of pinna only. It is separate cartilage. That's why. Why? Because development is different from first and second branchial arches. Ye kaun hai? This is me. ये मैं हूं. मैं अपने एक वीडियो से स्क्रीनशॉट लिया था ये. Okay. Now, what is the arches, beta? I'm sure you've done the embryology in your anatomy classes. You would have seen this picture of embryo. There are many arches on the head and neck of the patient. This is the first and second arch. Full ear develop from first and second arch only. Okay, to fine. Now, next one, beta. The hillocks of his beta. Everybody look at me. Look at me. Pinna developed by 20th week of pregnancy. Please see over here. Pinna developed by 20th week of pregnancy. Yeah. Pinna developed by 20th week of pregnancy. If you do the ultrasound of the baby, you see pinna over there. If it is about 20th week. But ऐसा नहीं है कि आज 20वां हफ्ता कंप्लीट हुआ प्रेगनेंसी का एंड टक करके पिन्ना बाहर निकल आया. ऐसे टक पिन्ना बाहर निकल आया. नो, नॉट लाइक दैट. Before pinna forms, 6 elevation form on the head and neck area of the embryo. Okay. These 6 elevation are called hillocks of his. They fuse to form the final shape of pinna. They fuse to form final shape of pinna. Okay, define. During embryological development of pinna, 6 elevation form on the head and neck area of the embryo from first and second arches, which eventually fuse to form pinna. These 6 elevation are called hillocks of his. Hillocks माने छोटी hills बेटा. जैसे जयपुर में नहीं होती, जयपुर में hillocks of his. चेन्नई also has small hills बेटा. Okay, hillocks of his. Okay, pinna development completes by 20th week of pregnancy is the question. 6 is the question. 20th week is the question. So before pinna develops, 6 elevation form on the head of the embryo, which are called hillocks of his. These 6 elevation fuse to form the final shape of the pinna, and pinna gets ready by 20th week of pregnancy. Now, congenital disorder, beta. Pre-auricular signs. Number one, beta. Pre-on sign, there is an opening in front of the pinna. What happened, beta? Tragus develop from which arch? First arch. Rest of pinna, second arch. This is line of union of first arch, second arch, and the union is incomplete, beta. If the union is incomplete, there will be what, beta? There will be a complete tract like that, beta. There will be opening over there, and this tract is there, beta. Okay? Patient will come with the parent. Parent will say, Dr. Dhawan, our child has a hole in front of the pinna. It's pre-auricular sinus. It is due to, if the union of first and second arch is incomplete, it will lead to a congenital disorder called pre-auricular sinus. If asymptomatic, it needs no treatment. Any pus coming, no treatment needed. But if recurrent infection is there, then surgical resection of tract is done. If patient parents say, "Nahi, Dr. Dhawan, there is always pus coming from there, pus like that." If recurrent infection is there like this, then the resection should be done. Now, number two is anoxia. There's no pinna, beta. Microtia, small pinna. Anoxia, microtia. Anoxia is absent pinna. Microtia is small pinna. पिन्ना है ही नहीं, इधर बेटा भाई पिन्ना ही नहीं है, इधर देखो पिन्ना नहीं है, बहुत बड़ी दिक्कत है। देखो तुम लोग सोचो जरा, जो लोग स्पेक्स लगाते हैं मेरी तरह, वो स्पेक्स कहाँ लगाएंगे भाई? हम अगर पिन्ना ही नहीं हुआ तो स्पेक्स कहाँ लगाएंगे भाई? है ना, स्पेक्स कहाँ लगेंगी भाई? है ना, हियरिंग एड कैसे लगाएंगे? स्पेक्स में तो कॉन्टेक्ट लेंस लगा लेंगे, चलो ठीक है कॉन्टेक्ट लेंस। सुनाई की मशीन बेटा, हियरिंग एड कैसे लगाएंगे? है ना, we'll discuss about tomorrow. You know, microtia is small pinna. Microtia is small pinna. For that we need a hearing aid. Tomorrow we'll discuss that. Right. Now, number 3, bad ear. Normal pinna has 2 curvatures called helix and antihelix. Capital C, small c. Okay, fine. Normal pinna has 2 curvatures. Beta. Please see. Can you see over here? Beta? This is the capital C. Beta. And this is small c. The capital C is called helix. Small c is called antihelix. एंटी मतलब इन फ्रंट ऑफ। अपनी सेल्फी लेके देखो बेटा, अपने कान की सेल्फी लेके पिन्ना की देखो, यू विल सी एक कैपिटल सी, एक स्मॉल सी. द कैपिटल सी इज कॉल्ड हेलिक्स एंड स्मॉल सी इज कॉल्ड एंटी हेलिक्स बेटा. अगर एंटी हेलिक्स ना हो, इफ एंटी हेलिक्स नॉट देयर, disease called bat ear beta. You know bat ear? Bat ear has only helix beta. Helix. There is no anti-helix beta. ये मैडम को तो बहुत सूट कर रहा है, बहुत अच्छी लग रही है, तो इसका तो रिश्ता हो जाएगा कहीं पे, कोई दिक्कत ना, शादी वादी में कोई दिक्कत ना आएगी इसकी तो, है ना. लेकिन हमारे बच्चों को अच्छा नहीं लगेगा, ह्यूमंस को नहीं चलेगा. आमिर खान पी के जो आप लिख रहे हो वही, ये तो बड़ा इसके कान एकदम एंटेना खुल गया बेटा, पूरे ऐसे पूरा एंटेना खुल गया, पूरा full antenna open like that. Bat ear मतलब absence of anti-helix. If anti-helix is absent, it's called bat ear. Cosmetic surgery of pinna is called otoplasty. It is done at 6 years of age. 6 years of age. MCQ. What is the ideal age of plastic surgery of pinna? 6 years. Why? As pinna attains adult size by this time. Pinna attains adult size by this time. So what is bat ear? Absence of anti-helix. Now, anatomy question. The tympanic membrane, TM, develop from all 3 layers. Beta. All 3. Ectoderm, endoderm, mesoderm. This is a question, beta. This question came in your paper, anatomy embryology. Tympanic will develop from ectoderm, endoderm, mesoderm, D, all of the above. Answer is all of the above. Okay to find. Osticle beta, malleus incus develop from first arch. S for stapes, second arch. What to find? Now, stapes, second arch. Cochlea is neural. Inner ear is neural, na? So it derived from, cut the word OT capsule from neuroectoderm. Cochlea from neural. Cochlea is neural, na? From neuroectoderm. Neuroectoderm. Cochlear development completes by 20th week. Anybody? Pinna development completes by. Pinna development completes by. Anybody? Pinna development completes by beta. Pinna development. Pinna development. No, don't. Development, whenever I say the word development, is pregnancy word beta. That's why I was actually waiting for your answer. That's why, because 6 years to size है ना बेटा. Kidney develop by. वो तो birth pregnancy की बात हो रही. Kidney grows by थोड़ी बात करते हैं. है ना? So development मतलब the word is linked to embryological development बेटा. है ना? 20th week. So अब ये गलती नहीं करनी. 6 year तो size तो हर चीज ग्रो करता रहेगा ना बेटा with age. Now, which ear structure? ये शेफाली तो रो क्यों रही है? शेफाली आंसू क्यों बहा रही है? ओके तो ठीक है, साथ में ये क्या है? गलती से पक्का सीखते हैं. गलती से सीखा हुआ देर तक याद रहता है. जब तक कि RIP ना हो जाए तब तक याद रहता है. अच्छा हाँ यार ये तो क्या हुआ. गलतियां करनी चाहिए. गलतियां नहीं करेंगे तो सुपरफिशियल लाइफ जी के चले जाएंगे प्लैनेट से. आई एम श्योर लोगों ने बहुत गलतियां करी. लड़कों ने भी करी होंगी, शायद लड़कियों ने भी करी होंगी. जो लोग बाहर गए थे एकदम चूजे थे, तो 12वीं क्लास पास करके यू वेंट आउटसाइड द कंट्री. बेटा पीपल से IMG FMG, मैं बोलता देखो सही FMG कितना हाई IQ है बेटा. IQ में पहला टेस्ट क्या होता है? हाउ यू सर्वाइव इन हार्शेस्ट सर्कमस्टांसेस. FMG is no survival better than anybody. When you left the country, you were +2 pass student. जो लड़कियां घर के बाहर अकेले नहीं जाती थी, वो देश के बाहर पहली बार अकेले चली गई. Parents not used to send the girl outside the town even alone. They were sent by flight, first flight outside the country alone. बेटा लड़के भी राजस्थान, जो लोग निकले नहीं थे अपने शहरों से बाहर, सीधा देश के बाहर. क्या बात है. हरियाणा, पंजाब, जहां से भी लोग बिल्कुल कहीं गए नहीं थे, वहां जाके अपने आप को सेटल किया. पहले एक आधा हफ्ता 2 हफ्ते लगा, गलत जगह आ गए, वापस जाना चाहिए, नहीं वापस आए क्योंकि जूते पड़ने थे घर आके. क्योंकि अगर वापस आते तो इतने पैसे बर्बाद करे तो और पड़ती घर पे आके, इसलिए नहीं आए बेटा, पता है तुम्हें भी. लेकिन वहां टिके रहे. वहां पे 1 साल हॉस्टल में काटा, अगले साल आए फ्लैट में, और फिर हुई असली लाइफ शुरू. फिर क्या मजा आता था, क्या खाने बनते थे, क्या पार्टियां होती थी, क्या चीजें थी, क्या हसीन लाइफ थी. बथेरी गलतियां करी. लैंग्वेज सीखी लोकल, है ना. कुछ लोगों ने लोकल गर्लफ्रेंड बनाई बेटा. कुछ लोग अपने छोटे छोटे अंश वहां छोड़ के भी आए, वो जानते हैं बेटा उनकी गलतियां अभी भी वहां पे हैं. आई नो दैट. गलतियां करनी चाहिए. गलतियां इंसान को और सुदृढ़ बनाती. जो योर रॉन्ग्स विल मेक यू राइट इन द फ्यूचर. इफ यू डोंट डू रॉन्ग, यू आर सुपरफिशियल इन लाइफ बेटा. लाइफ इज वन टाइम अकरेंस. यहाँ पे कोई भगवान बनने नहीं आया. वी आर नॉट गॉड्स, वी आर नॉट डॉग्स, वी आर monkeys trying to project ourselves as humans. We are not gods, we are not dogs even, we are monkeys pretending to be humans. Okay. Now, so okay, it's okay. Fine. Which ear structures are of adult size at birth? Middle ear, ossicles, cochlea. Middle ear, ossicle, cochlea. Middle ear, ossicles, cochlea. In the bracket, all बेटा. क्वेश्चन नहीं है, ये लिस्ट है. कॉक्लिया नहीं, ये लिस्ट है. ऑल ये क्वेश्चन नहीं है भाई. क्वेश्चन तो 4 चॉइस होती बेटा, है ना. फाइन. तुम लोग ऑब्सेस हो गए क्वेश्चन के साथ ना. मुझे अच्छा लग रहा है कि तुम्हें हर चीज एमसीक्यू दिखनी शुरू हो गई है बेटा. क्या बात है. आई एम रियली ग्लैड कि तुम्हें हर चीज एमसीक्यू दिख रही है बेटा. वाह. मम्मी आई अभी बेटा, लंच में क्या खाओगे? मम्मा 4 चॉइस बताओ. मम्मी अभी आई लंच ब्रेक में, बेटा क्या खाओगे खाने में? मम्मी 4 चॉइस बताओ. पहली चॉइस पटाख. हाँ अब बता आगे. सो ऑल. नेक्स्ट वन. मास्टर टिप is absent at birth beta. All of you look at see beta. You know sternocleidomastoid. This is what beta master tip here. Master tip is not there at birth beta. Not there at birth. Okay. It develop at 2 years of age. 2 years of age. Ossicles beta. बोलो बेटा. Number 1 malleus, incus, stapes. Size wise, malleus is bigger than incus, bigger than stapes. Malleus, incus, stapes. Size wise, stapes is smallest bone in the body. It was a neat UG question also. Now, let us see the 3 ossicles. Now, malleus like a hammer. Hammer beta. Let me show you the ossicles beta. This is ossicle. When I'm speaking, the sound enter through air beta. You see, this is air conduction. Can you see? Tympanic membrane and ossicle work as one unit beta. They move together as one unit. So this is the middle ear ossicle in front of you, right behind tympanic membrane. The ossicle is malleus. Second is incus. Third is stapes beta. They have got joint with each other beta. Not that joint beta. Nothing, no joint. Malleus, incus, stapes. Malleus like a hammer beta. Every hammer has a head and a handle. Now, head of malleus, number 1. Number 2, handle of malleus. So number 1 is head of malleus. Number 2, lateral process. Number 3, handle. And number 4 is umbo. Umbo is the tip of the handle. And neck is the area. So let us revise the 4 parts of the malleus. Malleus is like a hammer. Every hammer has a head and a handle. So head of malleus number 1, number 2 handle of malleus. Lateral process of malleus number 2, and number 4 umbo. But umbo tip of the handle is called umbo. Incus, body, short process, long process, and lenticular process. Incus has a body, short process, long process, and end of long process called lenticular process. Okay, to fine. Let's revise beta. Malleus has 4 parts. Number 1, head, lateral process, handle, and umbo. If malleus has a head, incus has a body. If malleus has a lateral process, incus has a short process. If malleus has a handle, incus has a long process. If malleus has a umbo, incus has a lenticular process. Okay, now please see on the screen beta. This is malleus. Go back, beta. Go back on the page number 106. Malleus. Okay. Now this is malleus. Everybody, what is this red dot, beta? Can you tell me what is A? What is A, beta? A is what, beta? Head of malleus, beta. What is B? What is, sorry, what is B, beta? What is B? B is what, beta? B is what? Handle. B is what, beta? Handle. What is D? D is umbo. D, beta? Umbo. And C is what, beta? Lateral process. Let's revise once again. This is malleus. Okay. Head of malleus, lateral process of malleus, handle of malleus, umbo. Umbo, beta. Okay. Incus as a body. This is body of incus. Short process, long process, and lenticular process. Body, short process, long process, lenticular process. This is the body, short process, long process, lenticular process. Okay. People confuse malleus with incus. Neat PG question came and people said, we don't know which is which ossicle. They gave incus, half of people marked malleus. Very easy. Malleus has a head, incus has a body. This is malleus, this is incus. Head is always rounded, globular like that. Head ऐसा होता है ना, तो मेरा head कहता है globular ऐसे. तुम में से किसी का head ऐसे है बेटा? ऐसे. किसी का head ऐसे तो नहीं है, ऐसे निकल गया, head इधर निकल गया हो, ऐसे तो नहीं है किसी का. तुम इंसान हो क्या अमीबा हो? Are you human or amoeba? So how can the head be like this, beta? Okay, body can be like this. Yes, body can be like this, beta. Okay, so this is body. Body. Anything with a globular top. Anything with a globular top will be malleus. Anything with a flat, broad top will be incus. Very simple, beta. Anything with a broad, flat top will be incus. Anything with a globular head will be malleus. Malleus. Okay. Now stapes, beta. Let's do stapes. Stapes are two parts, beta. This is called head of stapes, and this is foot plate. Head is also called superstructure. You got a note, beta? Head and the stapes has got two parts, beta. Stapes. Head, number one, head of stapes. It's a cup on a plate, beta. The cup is called head or superstructure, and the plate is called foot plate, beta. भाई मैं इंसानों की बात कर रहा हूं. Stapes acts like a piston. Stapes ऐसे मतलब ऐसे. It moves into the cochlea like. The foot plate of stapes is attached at oval window of cochlea. Oval window, because this is your oval and this one. Can you see the upper window? Stapes written, that is oval window. The lower window is the round window. Can you see, beta? Two window, beta. The upper one is stapes, beta. Upper one is the oval window. Please see, beta. The upper window in the cochlea is the oval window. Lower one is the round window. Look at the movement of stapes, beta. Stapes works like a piston. Piston, beta. Piston-like movement. Wow. That stimulates the cochlea. That moves the membrane of cochlea, and cochlea produces electrical energy, beta. What is this nerve, beta? 8 nerve. What is 8 nerve, beta? What is 8 nerve? Vestibulocochlear nerve. This is cochlea only, beta. Please see this again, beta. Stapes acts like a piston at the oval window of cochlea. It's moving like a piston. The piston-like movement of stapes, the cochlea gets stimulated. When cochlear membrane move like this, Cochlea produces electric. Cochlea convert the sound energy to electrical energy, beta. And it goes to brain via which nerve? Eighth nerve, beta. What is nerve, beta? Eighth. Vestibulocochlear nerve, beta. Vestibulocochlear nerve. Very good, beta. Preferably don't do the video recordings, beta. There are a lot of copyright issues. Okay, don't do the video. You can take the stills, but don't do the video recordings. His stapes acts like a piston. Okay, it will lead to disease. If stape is fixed, lead to disease called otosclerosis. Otosclerosis. By chance stape is jam ho gaya. Okay, otosclerosis. Otosclerosis. Now, look at the next page, beta. Malleus, incus. Look at the next page, beta. Can you see extra bone formation around the stapes? And that is otosclerosis. That is otosclerosis. Okay. Just write down here, beta. Write down, everybody. Write down here, beta. Stapes acts like a piston. Below the stapes diagram, write down, beta. Write down. Write down. Stapes is the end of middle ear. Write down here, beta. Stapes is the end of middle ear and beginning of inner ear. Beta. We are taking a break from after next page, beta. This line, beta. This line after this page. Before pinna start, we take a break. Beta. Stapes is the end of middle ear and beginning of inner ear. Stapes is the end of middle ear and beginning of inner ear. Stapes is the end of middle ear and beginning of inner ear. Beta. Stapes is the end of middle ear and beginning of inner ear. Next page, beta. TM and ossicle work as one unit. They conduct sound energy to inner ear. Arrow. Inner ear converts sound energy to electrical energy. Inner ear converts sound energy to electrical energy. Inner ear converts sound energy to electrical energy. So basically, the inner ear is converting the sound energy to electrical energy. Okay. Now, one thing, my mom was calling actually. Okay. Now, please see, middle ear also amplifies sound energy. Can you put number 1, beta, and number 2? Middle ear function, beta. Middle ear also amplifies sound energy. Look at this, very simple. Look at me. Look at this. Tympanic membrane is very big. Stape is very small, beta. As you are going forward, sound energy is focusing from a bigger area to a smaller area. Tympanic membrane is this big, beta. Stape, please see, beta. This is tympanic membrane. Okay, fine. Fine, beta. The tympanic membrane is very big, beta. Okay. Now, this amplification factor is called middle ear transformer ratio, which is 22:1. MCQ. Middle ear amplifies sound energy by 22 times. Why? Because as you're going forward, please see, as you're going forward, the structure is getting smaller and smaller. Malleus, MIS, malleus incus stapes. Stapes is smallest bone in the body. The sound energy which is hitting the tympanic membrane is ultimately focusing on the footplate of stapes, beta. And that is why sound energy gets amplified. Okay. And the main function of middle ear is impedance matching mechanism. Collectively, it is called impedance matching mechanism. Let's revise, beta. Let's revise the main points. Middle ear, tympanic membrane, and ossicle work as one unit. They conduct sound energy to the inner ear. Inner ear converts sound energy to electrical energy, which goes to brain via 8th nerve, vestibulocochlear nerve. As you go forward, structure becomes smaller. The energy getting focused from a bigger area to a smaller area. That is why middle ear amplifies sound energy also. And this amplification factor is called middle ear transformer ratio, MCQ. Middle ear transformer ratio is 22:1 beta. And the main function of the middle ear collectively is called impedance matching mechanism. You gotta find. Let's take a lunch break here. It's 1:30. We start at 2:30 again. I'll discuss impedance matching once I come back now for everyone. People must have gone for the lunch. I'll discuss that. Don't worry. Welcome back. Uh, are you there, guys? Please confirm in Telegram. Are you here? All good? Link is there for everyone? Okay. Let's revise middle ear mechanics one time. Basically, what is the function of middle ear? Number one, middle ear conduct the sound energy to inner ear because tympanic membrane and ossicle work as one unit. You see, they work as one unit and they conduct sound energy to the inner ear. Inner ear converts the sound energy to electrical energy. Please see over here, beta. As you move forward, structure is becoming smaller. Malleus, MIS, malleus incus stapes. Physics says that whenever any energy focuses from a bigger area to a smaller area, beta, it gets amplified. Now, tympanic membrane is very big, stape is very small, beta. Tympanic membrane is, this is tympanic membrane size, beta, for example. This is stapes, foot plate. This is malleus incus stapes. As you can going forward, structure becoming smaller. So whatever sound energy was hitting the tympanic membrane, that get focused on the foot plate of stapes. That's why middle ear amplifies sound energy. Okay. This factor is called the middle ear transformer ratio is 22:1, and the main function of middle ear is impedance matching mechanism. What is impedance matching? Because inner ear is full of liquid, beta. Endolymph, perilymph. Whenever sound energy has to enter into liquid medium, it will lose energy. Whatever energy loss is going to occur in the inner ear has been matched by the middle ear. So if middle ear gains 22 time energy, inner ear loses 22 time energy, beta. So why middle ear is amplifying the sound energy? Just to make up, cover up the loss which is going to occur in the inner ear. In Hindi, जो inner ear में जो energy का loss होने वाला है, middle ear ने उसको पहले से ही match करके रखा हुआ है. Impedance means रुकावट. Matching मतलब बराबर करना. Mechanism. In English, whatever energy loss has to occur, minus 22 time energy loss has to occur in the inner ear, middle ear has already counterbalanced that, matched that by amplifying the sound energy to 22 times actually. Okay, fine. All okay. Can we go to the next one now? Okay. Now apply your pinna. Also pinna. Touch your pinna. Pinna is made of yellow elastic cartilage. So there is no amplification actually. Covered by skin. All you touch your pinna is cartilage covered by skin. This one, beta. Okay. Skin is closely attached to cartilage on lateral surface. This is the lateral surface. The back side is the medial surface, beta. Skin is loose on the medial surface. Skin is loose on the medial surface. Anyway, the backside is the medial surface. Look at me, everybody. This is the lateral. The one you see is the lateral. This, all of you touch the skin on this side, beta. It is closely attached to cartilage on this side. On the back side, it is actually very loose, beta. Okay. Now, so all of you, please draw only one arrow. Okay, fine. Now, everybody, this is lobule of pinna. This is lobule of pinna. This is concha of pinna. Concha the pinna. This is helix. This is antihelix. Helix anterior. Now this is the outer part, lateral surface. Back side is medial surface. This soft part is called lobule, and this bowl of pinna is called concha. Outer curve is called helix. Inner is called antihelix. Antihelix. Okay, fine. Now, nerve supply of pinna is MCQ. The main nerve supply is greater auricular nerve. It's the main nerve supply of pinna. It also has a lobule of pinna. Lobule of pinna. Lobule is soft part of pinna. Right on. Below the lobule is parotid gland. Below the lobule is parotid gland. This is MCQ of NEET PG. Everybody touch below the lobule. Every touch below the lobule. Below the lobule is parotid gland. Now put an arrow. This nerve can be injured in parotid gland surgery. This nerve can be injured in parotid gland surgery. This nerve can be injured in parotid gland surgery. This nerve can be injured in parotid gland surgery. This nerve can be injured in parotid gland surgery. Now, all of you, please look at screen. This is lobule of pinna. Any swelling in this area below parotid, below the lobule, is parotid gland. Mumps occur in this area. Parotid is not above, in front of pinna. No. Parotid is not in front of pinna. Parotid is below the lobule of pinna. This is greater auricular nerve. Divided in two branches. Okay, to find greater auricular nerve. 1 second, beta. So it's very understandable that this nerve can be injured in parotid gland surgery. Please take a picture and post in the group with her. This nerve can be injured in parotid gland surgery. Okay. Okay. Next one. Disorder of pinna. Pinna hematoma due to trauma. Pinna hematoma due to trauma. बेटा trauma. किसी ने प्यार से तुम्हारे कान में मुक्का मार दिया. Somebody hit your pinna with the love. Okay, and you develop beautiful hematoma. This one. It's a subperichondral hemorrhage. It's below the perichondrium. Treatment is aspiration or drainage plus pressure bandage. Aspiration or drainage plus pressure bandage. Otherwise, it will lead to necrosis of cartilage, which will lead to post-traumatic pinna deformity. This is a definition, beta. Post-traumatic pinna deformity called as boxer ear. It's common in boxers, or cauliflower ear. Boxer ear or cauliflower ear. If you don't drain pinna hematoma, it will convert to boxer ear or cauliflower ear, which is post-traumatic pinna deformity. If you don't drain septal hematoma, anybody, what it will convert to? Anybody? If you don't drain septal hematoma, it will convert to what? Septal hematoma. Remember my friend's story, beta. Why we were doing it, beta? Septal perforation. Very good. If you don't drain septal hematoma of nose, it will convert to septal perforation. If you don't drain pinna hematoma, it will lead to boxer ear or cauliflower ear, which is the post-traumatic pinna deformity. It means ENT hematoma damage the cartilage. ENT hematoma damage the cartilage. Better should be drained. Okay. Keloid. Pinna can be side of keloid. It's found the helix, cause piercing. Ear piercing. Some people put a lot of things over here. You can put it, no problem. But if you have a tendency of keloid formation, you can be in a trouble. Okay, fine. I hope you read in surgery keloid versus hypertrophic scar. Very important topic. Keloid versus hypertrophic scar in surgery. Surgery, very important topic. Now, Darwin tubercle, it's anatomical variation. It is not a disease. It's a conical elevation on helix. Darwin tubercle is not a disease, but it's a conical elevation on helix. It's only anatomical variation. Okay. Darwin word came from Charles Darwin name. Charles Darwin, evolution wala baba. Okay. तो पता है ऐसे कान किसके होते हैं? बंदरों के, हमारे पूर्वजों के. Monkeys have got this kind of ear. As we evolved, this became smaller. But कुछ लोगों में अभी भी दिखता रहता है. Some people are still having evidence of monkeys within them. है ना? थोड़ा सा. Everybody has a monkey within you. Some people can show it outside also. Darwin tubercle. Okay. Now, next one, beta. External aortic canal or external aortic meatus. First of all, see the external aortic canal. After pinna, that's the external aortic canal. Here, this is skin line canal from here. At the end of the canal, you see the perimembrane. In the outer part of the canal, you see the hair follicles. And in this hair follicle root, you have got wax producing glands also. As you go inside, there is no hair follicle. Okay, fine. Now, it is 24 millimeter in length. In the bracket, outer 8 millimeter is cartilage. Outer, this is cartilage. All you touch your external. Outer part is cartilage. Inside is skull. Skull is bony. Inner 60 millimeter is bony. Bony EAC is made by tympanic part of temporal bone. Cut the word temporal bone is this bone beta. Bony EAC is made by tympanic part of temporal bone. This is temporal bone beta. This is external canal, external meatus. Okay. Now write down here beta. Ear is a journey inside skull via temporal bone. Ear is a journey inside skull via temporal bone. Ear is a journey inside the skull via temporal bone. Now, this is your temporal bone. This is your skull beta. Pinna is a cartilaginous model attached to the skull like this beta. Pinna. But the real ear lies in the skull. Pinna is only one part of ear beta. Okay. So let's remove pinna and see the real ear beta. The real ear is inside the skull via which bone beta? Temporal bone. This is the beginning of external auditory canal. Let us see beta. Now this is the mastoid part of temporal bone. Mastoid is a part of ear beta. Okay. This is the tympanic part of which bone beta? Temporal bone. Okay, now this makes the external ear and middle ear. External ear and middle ear are made by the tympanic part of temporal bone. External ear and middle ear are made by the tympanic part of temporal bone. Inner mastoid is the part of the ear beta. Okay, this is temporal bone beta. Now, take a picture. Everybody take a picture and post in the group beta. This is important. This is important. Okay. Now, take a picture beta. Take a picture. Next one, beta. Let us see the next part of temporal bone. Beta. This is also temporal bone. Where is the temporal bone? Inside the skull beta. This is temporal bone. This is temporal bone. When you say external ear, middle ear, inner ear, you are going deeper and deeper into temporal. This is temporal bone beta. External ear, middle ear, inner ear. This is temporal bone beta. Please understand. The ear is a journey inside the skull via temporal bone. Okay. Ear is a journey inside the skull via temporal bone beta. Okay. Now please see over here. Please see over here. This is your external auditory canal. Bony part. This is your tympanic membrane. Everything is within the temporal bone beta. Everything is within temporal bone beta. This is your middle ear beta. So external ear and middle ear. There are three ossicles beta: malleus, incus, stapes, also lying in the temporal bone. They are made by tympanic part of temporal bone. They are made by tympanic part of temporal bone. Then come the inner ear, beta. Cochlea utricle circuit. It is lying in the petrous part of temporal bone. Petrous part of temporal bone. Inner ear, external ear, middle ear, inner ear. Okay, take a picture. So external ear and middle ear are made by tympanic part of temporal bone. Inner ear lies in the petrous part of temporal bone. Inner ear lies in the petrous part of temporal bone. Okay, second picture is important, beta. Okay, now, next one. From the brain, this is brain, beta. Of course, this is your brain. Brain, beta, brain. From the brain, facial nerve comes and comes out of ear, beta. This is which nerve, beta? This is your seventh nerve. Which nerve, beta? Seventh nerve, facial nerve. And then comes the eighth nerve also, beta. Eighth nerve supplies the inner ear. Seventh and eighth nerve. Seventh and eighth nerve enter the ear from brain side. Seventh nerve, facial nerve, passes through the ear, and eighth nerve is going to supply the inner ear. Okay, third picture, pause third picture. Now see all three pictures. Now with the nerve, beta. Pose the picture of the nerve also. One more picture, beta. Fine. Yes, now three pictures have to be kept in. These are three mandatory pictures to be kept with you. On the basis of this, you will find ear very easy to understand, beta. Let's revise. Ear, let me record it now. Let me record below this. Don't put anything between the two now. Ear is a journey inside the skull via temporal bone. External ear and middle ear are lying within the tympanic part of temporal bone. Inner ear lies in the petrous part of temporal bone. The other side of the ear is brain. From brain, two nerves enter the ear. Facial nerve passes through the ear and comes out of the ear. Eighth nerve, vestibulocochlear nerve, enters the ear and supplies the inner ear and finishes over there. Okay. Chalo. Now this is a summary with a temporal bone. Now let's come back. Everybody. Next page, beta. Next page. EAC is lined by skin. Outer part skin has hair follicles and ceruminous gland, beta. Only outer part, ceruminous is the wax gland. Hair are only in the outer part only, beta. Outer part. Remember Lalu Yadav, beta. Lalu Prasad Yadav had only hair follicle, hair coming out of the ear. Inner part of the axonotic canal has no hair. Please see there. The outer part of the axonotic canal has got hair follicle. It is skin-lined canal. In the root of these hair follicle, we have got wax-producing glands, which are ceruminous glands. Ceruminous is the wax, and they are modified apocrine gland by histology. Beta. Okay, beta, fine. Chalo. Now, some people produce more wax, beta. They can have EAC occlusion by wax collection, beta. Too much already, beta, wax. Wax is equal to cerumen. This will lead to 30 decibel CHL. Right? 30 decibel. You should know as a question, if wax blocks your ear, how much hearing loss will you have? 30 decibel conductive hearing loss, CHL. Treatment is syringing. Put water in the ear like this. Direction of water in syringing is posterior superior. MCQ beta, posterior superior. Direction of water is posterior superior. In which direction you put the water? Posterior superior. Posterior superior. The direction of water is posterior superior beta. Okay, beta, fine. Now, everybody put water properly. Otherwise, pani तुम्हारे मुंह पे आएगा बेटा. If you don't put the water properly, look at this lady is doing wrongly beta. Syringing is being done with water. Put the water properly. Otherwise, पानी उड़ के तुम्हारे नाक में मुंह में जाएगा, आंख में जाएगा बेटा. ये गलत कर रही है. ये देखो इसके अपने नाक में गया अभी इसके, है ना water. Put it properly, posterior superior direction, and this will flush the wax out. And this is syringing. You can do suction also, but if too much of wax, you can do syringing also. Do not use cold water beta. Don't use cold water, not on the rocks, beta. Don't use on the rocks, okay? Avoid cold water. Use water at not room temperature, beta, body temperature. Avoid cold water was MCI question because it can lead to vertigo. Because of, cut this beta, because of inner ear stimulation. Cold water. या suction भी कर सकते हैं. We can do suction also, we can do syringing also, beta. Why vertigo MCQ? Why vertigo? Because of inner ear stimulation. On the rock after the exam. After the exam, on the rocks. Okay. Now, the two questions, beta. Why cold water should be avoided? Because it can lead to vertigo and because of inner ear stimulation. Yeah, pain will be there, beta. Wax can lead to pain also, na? Yes. Direction of ESC, beta. Direction of ESC, in adult, the direction is tortuous. It's inward, downward, forward. Look at me, beta. In the skull, you're going inward, a little bit downward and forward, but it's only 24 millimeter only, beta. Look at my fingertip. Look at a fingertip, beta. Look at your fingertip. Canal is only this much long, not very long, beta. In this one, inward, slightly downward, forward. Therefore, during ear examination or otoscopy, pinna is pulled. Upward, outward, backward. Upward, outward, and backwards. Upward, outward, and backwards. Therefore, during ear examination or otoscopy, pinna is pulled upward, outward, and backward. This is otoscope. Otoscope, two things, beta. One light bulb. Magnifying glass. Otoscope, two things, beta. Light bulb and magnifying glass, beta. I went to just bring the otoscope. Now this is the otoscope. See, this is otoscope. Otoscope. This is a magnifying glass we have. This is the magnifying glass, otoscope, and this is the magnifying. This is the otoscope. That's the otoscope, the magnifying glass, and this is the light bulb we have. The speculum and light bulb, okay, and this is the speculum. How we pull the pinna? Upward, outward, and backward, like this. Canal is inward, downward, forward, and the pinna is pulled. Uska ulta kar do beta. Upward, outward, and backward. Okay. Now, okay. This is otoscope. It has got magnifying glass, and it has got what? It has got the light bulb also. Now, next one. Next is Fisher of Santorini. Fisher of Santorini, beta. Santorini. Santorini, beta. Santorani nahi hai. Santorini, not Santorani. Santorini, there are some natural defects in the cartilaginous part of EAC. There are, these are not some, these are natural defects in the EAC, in the cartilaginous part. What is significance, beta? Okay. EAC infection can reach parotid gland through these fissures. ये मेरे दिल की आवाज है जो तुम्हें सुन रही है बेटा. ओके, ये मेरे दिल की आवाज है बेटा. EAC infection can reach parotid gland through these fissures. Okay. So guys, don't forget below the lobule of pinna, which gland is here? Parotid gland, beta. Okay, fine. Now next question, beta. Live insect in the EAC. तुम्हारे कान में कॉकरोच चला जाए, ये देखो इधर, कॉकरोच जिंदा है अभी बेटा, टाइगर जिंदा है. ओके, फाइन. Can you see the cockroach is still moving? Wow, dancing. Okay, cockroach is still moving, beta. Okay, it is still moving, beta. It's alive. It's alive, beta. Will you catch it live or will you kill it and remove it, beta? Will you catch it live or will you kill it and remove it, beta? Treatment is, don't try to catch it live, beta. Don't try to catch it live. Put oil in the EAC to kill it and remove it. Put oil in the EAC to kill it and remove it. Don't try to catch it live, beta. Kyo? It's arthropod. It is holding your tympanic membrane. It has got 3 pairs of limb. Remember 11th class zoology, beta? It is having 3 pairs of limb. It's holding your tympanic membrane. If you pull it out, holding its tail, it will bring your tympanic membrane also out and will give you to the lobe in tympanic membrane. It will damage. If it's not moving in the ear, it will damage more. First kill it and then remove it. How do you kill it? By putting oil. Which oil? Any oil, beta. Mustard oil is there, except kerosene oil, beta. Don't put kerosene oil. ऐसा नहीं kerosene oil डाल के तीली लगा दिया, स्वाहा, है ना? That is the problem. Only kerosene oil नहीं, beta. Okay? Any oil, mustard oil. If you're from Kerala, you can use coconut oil. If you're from Tamil Nadu, you can use groundnut oil. Whichever oil you like, beta, except kerosene oil. Beta. Don't use water. Water does not kill cockroaches, beta. You know it. Somebody asked me, why not water? Water, hostel people know it, beta. In the morning when we brush, in India hostel, I remember when I'm brushing your teeth, cockroaches try to come out of the hole of the wash basin and are crawling on the white surface of the wash basin. But ऐसे जो cockroach निकल के wash basin में ऐसे चल रहे होते हैं. What you do? You put that, tap तेज कर देते हो, है ना? You make the tap faster to drown them. Do they drown? Never they drown, beta. They don't drown, beta. They don't drown. In fact, वो लोग क्या होता है, बल्कि नहा के फ्रेश होके और तेज बाहर गए होते हैं. देखा बेटा भाई, arthropods don't die with the water, beta. They die with the oil only, beta. Okay, fine. Okay. Now, next one, beta. Sensory nerve supply of EAC is a very important topic. This is star question. Why 3 star? 3 MCQ of your paper, beta. Number 1, auriculotemporal nerve. It supplies anterior wall and roof of EAC. Okay. Number 2, beta. In the bracket, number 2. Auricular branch of vagus, it's also called as Arnold's nerve. Please cut this word, elder means. Arnold nerve. Stimulation of this nerve leads to number 1, cough. Cough, beta. No, don't use the hit spray, beta. Don't use hit spray. As he लाल वाला hit ले market जाके इस बार admin. Number 1, cough. Number 2, syncopal episode or syncope. What is syncope? Turn unconscious, beta, is equal to vasovagal episode, beta. In the bracket, write down, beta. Put an arrow. Turn unconscious. Sometimes turn unconscious, beta. Hindi में बेहोश हो जाना. Unconscious, beta. Unconscious. Okay, unconscious. Now, so this is the 3 question, beta, of your paper. Number 1, Arnold nerve. Number 1 is Arnold nerve, beta. This is an important question. Cough and syncopal or vasovagal episode. Dhyan do, beta. Vagus is the nerve which produces cough. Doctor is cleaning your ear to start coughing. Why? Which branch got stimulated? Auricular branch of vagus, also called Arnold nerve. Secondly, beta, you are doing syringing of the patient and suddenly patient turned syncopal episode, beta, unconscious. It has happened with me also. I did syringing, removed the wax. I went there on the wash basin to drop the wax. I came out, patient hai nahi wahan pe. There's no patient there on the chair. Our patient bhag gaya, kahan gaya? Patient niche zameen pe gira hua hai. Ekdam unconscious. What happened, beta? The vagus nerve got stimulated. And vagus is parasympathetic nerve. And parasympathetic nerve stimulation will lead to bradycardia and hypotension. Hypotension means what? The blood supply to brain reduces. You feel blackout, beta. ऐसे अंधेरा अंधेरा आता है, beta. अंधेरा अंधेरा चक्कर आता है, अंधेरा अंधेरा आ जाता है, blackout. And then when BP falls further, you turn unconscious completely, beta. Okay. Number 3, beta. Sensory division of facial nerve. Please cut it, beta. Also for nerve of respect. No extra thing, beta. It's like posterior superior part of EAC. Draw it, beta. A very small area, beta. Look at me, beta. Look at me, everybody. This area, beta. Everybody, this area. This posterior superior part of the EAC, beta. Posterior superior part of the EAC. Chalo. Everybody, I'm recording the summary of the main points of the external auditory canal nerve supply, beta. Sensory nerve supply of external auditory canal of ear. Number 1, auriculotemporal nerve supplies the anterior wall and roof of EAC. Number 2, auricular branch of vagus nerve, also called Arnold nerve. It supplies posterior wall and floor of the EAC. Stimulation of this nerve during cleaning or syringing of the ear will lead to number 1, cough. Number 2, syncopal episode or vasovagal episode, which means to turn unconscious. Number 3, sensory division of facial nerve. It supplies a very small area of the EAC, which is posterior superior part of the EAC. Okay. Now, diseases, beta. Number 1, diffuse otitis. Matlab complete skin infection. No need to remember anything, beta. It is also called swimmer ear. It's also called swimmer ear, beta. Swimmer ear. It is sensory nerve supply of EAC audio, beta. Okay, the 3 questions of your paper. I'm trying to record those points actually for you. बीच में कभी भी बेटा ऑडियो सुनते सुनते ईयर रिवाइज कर ले. मेन पॉइंट्स बेटा, मेन पॉइंट्स है ना. फाइन. स्विमर ईयर बेटा, दैट मेन थिंग इज बेटा. चलो नेक्स्ट बेटा, लोकलाइज्ड इज फ्रंकुलोसिस और बॉयल. जो हिंदी में बोलते हैं फोड़ा, फिंसी, फोड़ा निकल गया, बॉयल. In English, boil, beta. Please boil. What is sometimes wherever they are here, beta. Sometimes yellow pustular swelling appears over there. It is staphylococcal infection of hair follicle. Anybody hair are in the outer part or inner part of EAC? Hair are in the outer part or inner part of the EAC, beta. Hair in the outer part, inner part. Smriti. Hey, Smriti. Outer part, inner part. Oh, so the outer part of this, है ना? Okay. Very painful condition, beta. Very painful. Treatment is IG packing, beta. IG. Icthamamol, glycerine packing. Icthamamol glycerine packing. IG मतलब full form. Icthamamol glycerine packing. Only question is this possible that icthamamol glycerine packing is used for which disease? Beta, furunculosis. Oh boy, it's a very useful thing. And you will go to the OPD. Please do your internship properly. Beta, people will say after clearing exam, start NEET PG preparation. Don't FMG should not do that, beta, because your clinical exposure is very less. You don't know what medicine is. You don't know what surgery practice is, beta. You don't know orthopedics as a pure practice. How does it actually feel? Please spend one more year to actually get used to this sciences, beta, so that you decide what you want to do further in life, beta. Because I'm a little atypical person. Don't follow me. I'm giving you ideas, beta, how I would have lived my life if I'm a foreign medical graduate student, beta. But now I know, because I'm 20 years ahead of you. So I can tell you very clearly that FMGs must do the internship properly in a heavy medical college setup where you are actually working day in, day out, getting tired, fatigued, understand the clinical sciences better. Then only, you'll be getting the feel of the doctor. Filmon mein doctor और real life doctor में बहुत फर्क होता है बेटा. Okay, beta, fine. Please understand, beta. You know what? Why I left every branch and only choose ENT or psychiatry? Because I was clear after my internship, I am not meant for a very loaded kind of working environment. I always am a fun-loving person. I have to travel a lot. I'm a free bird, actually. I came like a monkey. I want to die like a monkey. I don't want to, tie to one system, actually. So I just chose these branches because this gives me flexibility of working. Appendicitis will kill you just today. Sinusitis will not kill you for 1 year, beta. You are getting my point, beta. Appendicitis right now should be available. Sinusitis, you can wait for 1 year, 2 year also. Beta. Okay, that's what. Please do your internship properly. Okay, beta, fine. Now, next one, beta, malignant otitis media. Malignant otitis media. Everybody is not meant for heavy branches, beta. ऑब्स गाइनी सबके बस की बात नहीं होती बेटा. ऑब्स गाइनी बड़ी अच्छी ब्रांच है, कईयों को बहुत अच्छी लगती है, गॉड ब्लेस देम. बट फॉर everybody, ऑब्स गाइनी may not be really a good branch because ऑब्स गाइनी means what? A huge commitment, beta. If I show my wife to you in the first month of pregnancy, I want you to conduct delivery on the EDOD, and EDOD is plus minus 7 days, beta. It means the gynecologist cannot go to Thailand, Malaysia, Singapore, Europe, Switzerland, etc. to roam around, even if they have a lot of money, beta, because their commitment to the patient is very, very high, beta. And everybody is not. Some people love to do that, actually. Some workaholic people, actually, like that. But I'm not. For example, everybody is not for emergency medicine, beta. Okay, because emergency medicine is not everybody's forte. So you have to understand. Okay. Now, malignant otitis media, it's infection of underlying bone of the EAC. Bone. The key word is bone, beta. It's infection of underlying bone of the EAC, beta. Okay. It is also called skull-based osteomyelitis. Look at the screen, beta. This is star topic. January 2023 question, beta. This is the most important topic of the external canal. अगर EAC में एक topic आपके पेपर में आया तो ये है. EAC, if you got, don't take anybody's name, beta. That's not right. Okay. Now, it's infection of underlying bone of the EAC, beta. Underlying bone of the EAC. Don't do all that. Don't nothing wrong about any faculty. Nothing, beta. Nothing. Okay. Gurus are why? They're gurus. We must respect them. They are all, Amit sir, Vineet sir. Everybody are like, they are like huge, dedicated people. Like they are teachers, they are gurus. I'm not a teacher, to be very honest with you. If you see teachers, I've got a lot of characteristics which I'm okay like that, but they are very like huge teachers. Skull-based osteomyelitis, beta. Skull-based osteomyelitis, beta. Well, look at me, beta. Skin infection will never kill you. This skin infection will never kill anyone, beta. But by chance, infection go deep to bone. My goodness, bone. It's not a simple bone, beta. It's a part of the base of skull. This is skull, now. This is part of base of skull. It's also called skull-based osteomyelitis. Skull-based osteomyelitis, beta. Okay. Now, skull base is not a simple place, beta. Look at me. Skull base has got many foramina, beta. Foramina. Many foramina are there, beta. Foramina, from where rotundum, ovale, jugular foramen, hypoglossal canal, many cranial nerve are coming out of skull base. By chance infection spread on the skull base, you will develop multiple cranial nerve paralysis. That is why it's a life-threatening condition. Okay, fine. So it's a life-threatening condition. Okay. Therefore called malignant otitis externa. Okay. Okay. It is seen in old diabetic patient. Are you getting my point, beta? Young diabetic patient nose question is mucormycosis. Old diabetic ear question is malignant otitis externa. And in January paper, both came, beta. Old diabetic nose question, black mass in the nose is mucormycosis. Old diabetic ear pain question is malignant otitis externa. Both question came, beta. Young boy with nasal mass epistaxis is angiofibroma question, beta. Wow. I have recorded one video for the YouTube. There's a YouTube video called Clinical Thursday. Clinical Thursday will do in close to exam, beta. It's a 50-minute video just to take you through with the think like clinician, beta. Think TLC, beta. Think like clinician. Okay. Now, in that, I've told you, if this is a pattern of question, what is the first diagnosis in your mind, beta? Okay, fine. Now, next, beta. It is caused by Pseudomonas, beta. Clinical picture, beta. Old diabetic patient, put an arrow with earache, ear discharge. That's all about it, beta. Let me tell you. Old diabetic patient with earache, ear discharge. I know the diagnosis is malignant otitis externa. Facial is the most commonly involved now. MCQ. Facial nerve to apne ghar ki nerve hai. Facial nerve passes through the ear. Facial nerve passes through the temporal bone of the ear. So it's first to get involved with. Facial nerve to apne ghar ki nerve hai, bhai. Facial nerve belongs to ear. Okay, fine. Okay. Plus minus 9, 10th, 11th, 12th nerve palsy due to skull base infection. I told you it is skull base osteomyelitis. Okay. Now, examination shows granulations in the EAC. You may have done an orthopedic. In any osteomyelitis, there is a red granulation tissue formation on the bone, which keeps on bleeding. That's why blood-stained ear discharge. Okay, fine. Drug of choice is third generation cephalosporin. Third generation cephalosporin. In the bracket, plus aminoglycoside. Plus aminoglycoside. Best will be the combination, but mostly they give this choice. Third generation cephalosporin, preferably with the aminoglycoside. With the aminoglycoside. Let's revise this topic. Okay, chalo. Let me record this for you. This is important topic. Let's revise malignant otitis externa, which is the infection of underlying bone of the EAC. It is caused by Pseudomonas. The patient is old diabetic patient of 60 to 70 years, presenting with earache, ear discharge, and facial palsy is mostly there because facial is the most commonly involved nerve, and other nerve involved are 9th, 10th, 11th, 12th. Drug of choice is third generation cephalosporin, preferably given with the aminoglycoside. This is the summary of malignant otitis externa. Now, otomycosis, fungal infection of EAC. The most common fungus to cause this is Aspergillus niger. Yeah, we can use it. Ria, there's no hearing problem. Na? Aminoglycoside are used very commonly, beta. Only in those patients who have hearing problem, we don't use it. Okay. Sorry, I'm removing your comment, but it's very close by, beta, that audio. Nitesh, thank you very much. Really, I appreciate what you're doing. I know it's not easy to become admin. Admin को सबसे गालियां पड़ती हैं. I know that because मैंने बहुत सारे क्लास में चीजें ऑर्गेनाइज कर रखी है, मुझे पता है. But someone has to take the lead actually, and thank you very much, Nitesh. You are my co-surgeon also, co-doctor, chief surgeon. We both are. Okay. Now, so it is also called Singapore ear because of the humidity. Singapore ear. Second common is Candida. If you remember yesterday class, most common fungus for sinusitis was Aspergillus fumigatus. Last letter S, fumigatus. S for sinusitis, beta. ER is for ear. Ear. Can everybody say thanks to the admin? कभी भी थैंक्स बोलना चाहिए. मिक्स लाइफ होनी चाहिए. बुरे भी लोग थोड़े अच्छे काम भी करने चाहिए दुनिया में आके. कोई अच्छा कर रहा होता है, हमें वो अच्छा नहीं लगता, लेकिन कभी भी थैंक्स बोलना अच्छा लगेगा तुम्हें अपने बारे में, है ना. इट इज मोर कॉमन रेनी सीजन. ओके. चीफ कमेंट, itching in the ear. Okay. Thank you very much, guys. Thank you. That's why I love FMG students. You know what? They're very warm people. मतलब शरारती होते हैं और मजा आता है. मुझे लगता है मैं मानसिक तौर पे FMG हूँ शायद. Because like more warm people, more fun-loving people, but only thing is पढ़ने के टाइम पे पढ़ाई करनी होती है बस. मेरे से एक चीज सीख लो. When you have fun, have fun. When you are it's a time to study, सिर्फ पढ़ाई करनी और कुछ नहीं करना. Examination shows wet newspaper appearance. Wet newspaper appearance. The fungus colony is this one, little black, little white, and little wet. Wet newspaper appearance. Okay, wet newspaper appearance. Fungus colony is little black, little white, and little wet. All of you look at screen. This is your automycotic colony. Can you see beautiful spores over there? Very nice hyphae like cotton wool. And when you remove the colony, it is little black, little white, and little moist also. It looks like a piece of wet newspaper. Piece of wet newspaper. अच्छा लगा बेटा? Beautiful ना? अच्छा लगा? Okay. Okay, fine. Wet newspaper appearance. Treatment, oral toilet. Toilet का मतलब वो नहीं कि स्वमूत्र चिकित्सा. No. Oral toilet. What is toilet? Cleaning. Remember yesterday class, bronchial toilet. Tracheostomy indication of bronchial toilet मतलब सफाई, clean the lungs. Oral नहीं, oral cavity नहीं. Oral मतलब ear. AURAL. Oral मतलब ear. Okay, fine. With suction or dry mopping, and then you give the antifungal ear drop. But MCQ एक ही आ सकता है क्या? एक ही क्वेश्चन आने की चांस है. Wet newspaper appearance. तो मुझे पूछ सकते हो कि राजीव अगर एक ही क्वेश्चन आना है तो क्यों पढ़ा रहा है इतना भाई? जब आना ही क्वेश्चन ये वाला है तो यही बता देना, बस बहुत है. मैं नहीं चाहता तुम लोग फंस जाओ उसमें. कंट्री एम्बेसडर वो नहीं बनना. होल एम्बेसडर नहीं बनना बेटा. कंट्री एम्बेसडर मतलब ओनली पैची इंफॉर्मेशन ना. थोड़ी बहुत कहानी दाएं बाएं मतलब बेटा. फाइन. नेक्स्ट वन बेटा. नेक्स्ट exosteosis. TE. Exosteosis. No. Diffuse is not called. There is a wrong print over there. In the previous version, I remember that. Usu kaat do. That's why I said usu kaat do. It's not Singapore ear, beta. That's why kaat do usko. Okay. Singapore ear is automycosis. Exosteosis surfer ear. SURFER. Surfer ear. It is hyperplasia of the bony EAC. It is more common in water, sea sports. Surfing sea sport, na? Okay, fine. Therefore, it is called surfer ear. Sea sports, sea water surfing. Some people are professional surfers. Every day they are in the water. Now surfing is sea sport, beta. So if you're in the water, sea water every day, the sea water goes to your ear, your bone gets irritated, your bone gets hyperplastic, extra bone banjana like this, beta. Exosteos, extra bone formation. Okay, fine. चलो. No, it's not safe, beta. ये बिल्कुल नहीं कराना चाहिए. Now, let me record the various ears, beta, for you. The various named ears are: bat ear means absence of antihelix. Boxer ear or cauliflower ear is post-traumatic pinna deformity. The swimmer ear is diffuse otitis externa. Singapore ear is other name of otomycosis, and surfer ear is other name of exosteosis. Label it, beta. Different ear. Label it, everybody. Label this named ear, beta. Named ear, beta, na? Fine. Chalo. Let us start the next one. Tympanic membrane, beta. Label this one, beta. This is different type of ear, beta. Okay. Now, tympanic membrane, next, beta. Guys, at the end of the exonotory canal, we have what, beta? Tympanic membrane. This is our exonotory canal, and this is our tympanic membrane over there. That's the membrane. Let's talk about it. Now look at this color, beta. It is pearly gray, not white. It's a little grayish in color. Now, it's also called marring. It is pearly gray in color. Marring is other name, beta. Marring is other name of tympanic membrane. Like, maringoplasty, marringotomy is mean tympanic membrane surgery, beta. It is oval in shape, not circular. Diameter is 9 to 10 millimeter, beta, not centimeter. Marring is other name of tympanic membrane. Surface area is 90 square millimeter. Very small, beta, very small. It is this small, beta. Actually, this size only, beta. Effective area is 55, not 45, beta, 55. Total area is 90. This is because the peripheral part is more mobile than the central part. Look at me, beta, look at me. I hope you remember this video, beta. That sound energy travels via air. Tympanic membrane is attached to ossicle. They work as one. Can you see? Sound energy is moving tympanic membrane. But actually what happens is the peripheral part is more mobile than the central part. Because beta, this peripheral part is this part. Beta. This is central part. It moves less, beta. But peripheral part moves more. Moves with sound energy, beta. This is because the peripheral part is more mobile than the central part. TM is lying at an angle of 55 degree with horizontal. TM is lying at an angle of 55 degree with horizontal. TM shows movement on seagulization. TM shows movement on seagulization. What is 55 horizontal, beta? Look at screen, everybody. Look at screen. This is the floor of the exonotory canal, beta. And this is tympanic membrane, beta. This is floor of exonotory canal. This black thing is floor of exonotory canal. This is tympanic membrane, beta. White thing tympanic membrane. It's not standing at 90 degree. It is bent like that. In the body, it's bent like that. 55 degree angle, beta. Not 90 degree. It's not 90. It's 55 degree with the horizontal. What is seagulization? Seagulization means putting air pressure on tympanic membrane with the help of Seagull speculum. Seagulization means putting air pressure on tympanic membrane with the help of the instrument called Seagull speculum. This is called seagulization. Good. Now, seagulization is putting air pressure on tympanic membrane with the help of the instrument called Seagull speculum. Instrument is called Seagull speculum. The instrument should be known to you. And the technique is called seagullization. This is Seagull speculum. Now, this is magnifying glass. Can you use this instrument for foreign body beta? If you have foreign body patient, you will use this instrument, yes or no? If there's a foreign body in the ear, will you use this instrument, yes or no? No, absolutely not. Right, Abhida? This instrument should not be used for foreign body removal. This instrument should not be used for foreign body removal. Okay, very good. This instrument should not be used for foreign body removal. This is visual question of NEET PG, beta. This is question of NEET PG. This instrument should not be used for what? Foreign body removal. It's a common sense, beta. Matlab, foreign body will go further deep due to pressure, na? Okay, now. Seagullization matlab putting air pressure on tympanic membrane. How much it is free to move? TM has 4 landmarks. Please cut the ABCD. 1, 2, 3, 4. The first ossicle behind tympanic membrane is malleus beta. I'm sure you know the first ossicle behind tympanic membrane is malleus beta. Please see. My dear friends, this is your malleus beta. Okay. Let us see the various part of malleus. Can you tell me what is this? Number 1, head of malleus. Number 2, lateral process. Number 3, handle. Number 4, umbo. My dear friend, the tympanic membrane is from here to here. Head of the malleus is above the level of tympanic membrane. Okay, head of the malleus is above the level of tympanic membrane. Okay, so head cannot be seen. The remaining parts can be seen. Okay, fine. When I label it, please take a picture. Please label. This is your malleus. Now this is your number 1, handle of malleus. This is number 2, the lateral process malleus. This is number 3, handle, and number 4. So the number 3 is umbo, number 4 cone of light. Let me remove the marking for you. So this is the number 1. This is number 2. This is number 3 and number 4. Okay, right now. Just let me write down the 4 landmarks of tympanic membrane. Four landmarks of tympanic membrane. Is clear, beta? Fine. So you should know the doctor better. Think like a doctor that future में otoscopy करना सीख लेंगे. You can see the, like these landmarks. It's very easily visible, beta, because you know the logic. Okay, very good. Number 1, handle of malleus. Number 2, lateral process of malleus. Number 3, umbo, and number 4, cone of light. Next one, the cone of light is produced by reflection of light from handle of malleus. Which light? Otoscope. Remember, beta, look at me, beta. Look at me. Remember, beta, all of you look at me. This otoscope has a light, beta. Can you see otoscope light, beta? When I put this light on the tympanic membrane, some light is reflected by handle of malleus and reflected downward. Now read, beta. The cone of light is formed by reflection of light from handle of malleus. Cone of light position A and B. Beta. Right here, 5 o'clock. Left here 7 o'clock. How to remember? Left ulta kar do 7. Left ko ulta kar do 7 ban jayega. Okay, right 5. Right में 5 o'clock, left में 7 o'clock. Look at this one. Imagine it is clock position, beta. Imagine clock. Forget it is tympanic membrane. घड़ी में यहाँ पे क्या टाइम बचता है बेटा? आप घड़ी देख रहे हो. You're looking at the wall clock. Which time is there at this point? 5 o'clock. है ना? And here, if you look at the clock, imagine, forget it is tympanic membrane. Look at the clock. Here you have got 7 o'clock. Right 5, left 7. घड़ी में क्या बजता है? वहां पे 5 बजते हैं. वहां पे क्या बजता है? 7 बजते हैं. घड़ी की पोजीशन, क्लॉक पोजीशन में right 5, left 7. I'm going to right 5, left 7. Very good. Very good. Anybody, is it right here or left here? Tell me. जी बेटा, right here. This is right here or left here? राइट ईयर लेफ्ट ईयर. दिस इज लेफ्ट ईयर. वेरी गुड. क्या बात है भाई, बड़े डॉक्टर बन गए, बिना देखे बाहर से बता रहे कि कौन सा ईयर है बेटा. क्या गजब गजब, वाह, वेरी गुड. इट इज 7 o'clock ना, लेफ्ट ईयर. चलो, टीएम हैज 2 parts बेटा. राइट ऑन पीटी एंड पीएफ बेटा. पास्ट टेंसा, पास्ट प्लस. टेंसा हैज 3 layers: outer skin, inner mucosa and middle fibrous layer. Outer skin, inner mucosa, and middle fibrous layer. Outer skin, inner mucosa, and middle fibrous layer. Look at screen, look at screen. Please see on the screen. Now, this is the, you see, you are the external auditory canal. You are the external auditory canal, and I am the middle ear. I am middle ear. You are external auditory canal. You are lined by skin. I am lined by mucosa. Middle ear lined by middle ear cavity, na, lined by mucosa. But external auditory canal, you are the external auditory canal, is lined by skin. This outer surface is the skin. And I'm the middle ear. Towards me, this is the mucosa, and this pages are what? Middle fibrous layer. I am the middle ear. You are the external canal. The outer side, this is the what? This is what? This skin. Outer layer is skin, and inner, this layer is mucosa, and these pages are middle fibrous layer. In flaccida, these fibrous layer is almost absent. These pages are very less in number. That's what the meaning of. Okay, now let's see your notes, beta. Now, so past tensa, past plus, outer skin, inner mucosa, and middle fibrous layer. Now, flaccida is also called sharp. Now, right number 3 arrows. Here, tensa, 3 arrow. It is major part, lower part, stronger part. It is major part, lower part, stronger part. Flaccida is also called sharpenal membrane. That's an MCI question of old style, beta. Sharpenal membrane. Now, flaccida, draw 3 arrow, beta. It is minor part, upper part, weaker part. उल्टा कर दो बेटा, उल्टा कर दो. Make it reverse, beta. It is minor part, upper part, weaker part. That was the उल्टा कर दो बेटा. That was major part, lower part, stronger part. Minor part, upper part, weaker part. That was major part, lower part, stronger part. Okay. Now, it is also called sharpenal membrane. It's also called sharpenal membrane. Yeah. One second. Now, all of you, please see the stream, brother. You see, this is the from here to here. This is by the first of all, this whole thing is what better skin. This whole thing is skin, better skin. Okay. This whole thing is what? It is skin, better skin. Okay. Now, what is tensa and flaccida? Let us draw. This is a later process of Malleus. Let us draw a line at this level. Now, this whole part from here to here is called pars tensa. This much part is called pars flaccida. Yes, can you please take a photo? Pars tensa, pars flaccida. Pars tensa is the major part, lower part, stronger part. Flaccida is the minor part, upper part, weaker part. Why flaccida is flaccid? Because its fibrous layer is almost absent. The other name of pars flaccida is sharpenal membrane. Sharpenal membrane. Very good. Now, all we draw a diagram. Oval in shape. This is right tympanic membrane. Number 1, 2, 3, 4. This is called annulus. Annulus is the edge of tympanic membrane. PF, PT. Now, main function of tube is middle ear ventilation. Next topic, beta. What is the role of Eustachian tube now? Middle ear ventilation. Main function of middle ear is of the Eustachian tube is middle ear ventilation. Everybody, please look at screen, beta. Look at screen, everybody. This is your external auditory canal. Air is going from here and putting pressure. Beta. Look at me, beta. Air is going from here. This is your Eustachian tube. From the nose, same air is going to the nasopharynx to Eustachian tube, and the same air is putting equal pressure on the other side of tympanic membrane. Both sides of tympanic membrane, pressure of air is equal. One side is sonatory canal, other side is nose and Eustachian tube. But look at screen, by chance, the Eustachian tube got blocked. There's a negative pressure in the middle ear. Negative pressure means vacuum. Usse kya hoga? What will happen in the vacuum? Please look at screen. I'm the middle ear. There's a vacuum. Middle ear negative pressure. TM will be sucked toward the middle ear. This sucked up tympanic membrane. Why sucked up? Because negative pressure will vacuum in the middle ear. This negative pressure will suck the tympanic membrane to the backside. This sucked up tympanic membrane is called a retracted tympanic membrane. Okay. Now, if ET gets blocked, it will lead to the negative pressure in the middle ear. This lead to retracted tympanic membrane. And can you see where I put an arrow? It is dull in appearance, this one. You can just see in the picture also, it's totally dull in appearance. Now, look at me, beta. Imagine I'm the middle ear. I'm the middle ear. Now, everybody, just focus on the screen for a while, beta. Chalo. So this is I'm the middle ear. There is negative pressure in the middle ear. If ET gets blocked, you still to block. Negative pressure matlab vacuum. The TM will be subbed inside. This is retracted tympanic membrane. It is dull in appearance, beta. Okay. Everybody look at me, beta. Look at me. If there's too much of retraction, it will form a pocket, and that pocket is called retraction pocket. Too much of retraction matlab retraction pocket. Okay. Now, retraction pocket is more common in pars tensa or pars flaccida, which is weaker part of tympanic membrane. Right in the chat box, which is weaker part of tympanic membrane, tensa or flaccida. Retraction pocket is more common. Pocket is more common in pars tensa or flaccida. Pars flaccida, yes. So, and what is the outer lining of tympanic membrane? Skin. Retraction pocket is lined by skin, and it is filled by what, beta? Keratin. Retraction pocket is lined by skin, filled by keratin, beta. Retraction pocket is, this is retraction pocket, beta. But the outer lining of the tympanic membrane, skin. Retraction pocket will be lined by what, beta? Skin, and that is filled by what? Keratin. What is keratin? Dead skin. Okay. Now, आपने फिल्म में सुना होगा ना, मूवी से say and few years later, है ना, मूवी में बोलते हैं few years later, ऐसे ही इधर हिंदी में बोलते हैं और कुछ साल बाद. What will happen? There will be a small perforation at the end of retraction pocket. In this small, I'm the middle ear. I am the middle ear. This yellow thing is, this orange thing is mucosa. Okay, this white thing is skin. Now, what will happen? There will be small, after a few years, there will be small perforation in the end of the retraction pocket. And through this perforation, skin start growing into the middle ear. I am the middle ear. Now, skin growing in the middle ear is a pathology called cholestoma. Middle ear, I am middle ear. In middle ear, this orange thing is mucosa, beta. Mucosa. Mucosa is allowed. Skin is not allowed, beta. But through this retraction pocket perforation, the outside skin start growing in the middle ear. This skin in the middle ear is a pathology called cholestoma. Beta. Cholestoma. Okay, what fine. Now, let us read the notes further. Now, read, beta. If retraction pocket is too much of retraction will lead to formation of retraction pockets. Too much of retraction will lead to formation of retraction pockets. Now, retraction pocket. This is retraction pocket. Label it, beta. This is the retraction pocket. RP. Retraction pocket. Oh, sorry. One second. This is retraction pocket. Okay. Now, all of you draw the retraction pocket. This is the pars tensa. This is a retraction pocket. It is lined by skin. And filled by keratin. Retraction pocket is lined by skin filled by keratin. Retraction pocket is lined by skin filled by keratin. Okay. Now, next page, next page. If there is too much of retraction, it will lead to formation of retraction pockets. Retraction pocket is most commonly seen in pars flaccida. Retraction pocket is lined by skin filled by keratin. If retraction pocket is allowed to progress few years later or kuch saal baad, there will be a small micro perforation. You can't see that. It's a microscopic perforation at the tip of the fundus of retraction pocket, end of retraction pocket. Through this perforation, skin start growing into middle ear. Presence of skin in the middle ear is pathology called cholesteatoma. Cholesteatoma is pearly white in color. Cholesteatoma is pearly white in color. Right, retraction pocket is mother of cholesteatoma. Retraction pocket is mother of cholesteatoma. Mother of cholesteatoma. Retraction pocket is mother of cholesteatoma. Okay, fine. Let me show you a picture, beta. Look at the picture. This is important picture. Please click it once I label it. This is number one, beta. Number one is the normal tympanic membrane. Number two, retracted tympanic membrane. Number three, retraction pocket. And number four, cholesteatoma. Retraction pocket is giving birth to cholesteatoma. Okay, fine. Now this is what Eustachian tube dysfunction problems. Eustachian tube dysfunction problem. Fine. So normal TM, retracted TM, retraction pocket, cholesteatoma. This is what the how disease spread further. Not in every case, beta. It's not in every case who has retracted TM, retraction pocket. In some cases you can get it. Okay, but cholesteatoma means skin in the middle ear. Beta. Now, everybody write down. Draw a line, beta, here. Now use this space, beta. Everybody use the space. Laryngitis bullosa. What is marring? Tympanic membrane. What is marring? Tympanic. Laryngitis bullosa. Draw, beta. Draw multiple vesicles on the. It is viral infection of tympanic membrane. Chief complaint is earache. Examination, this one. Vesicles on TM. Treatment. Self-limiting disease. It's a new topic possible, beta. It's not requiring any antiviral. It's a self-limiting disease. So viral infection of tympanic membrane, treatment earache, and vesicles on tympanic membrane are visible, and treatment is self-limiting disease. No need to really bother. Everybody, can you take a picture here, beta? Everybody. 1 second, beta. Right now, beta. Laryngitis bullosa, viral infection of tympanic nerve. Chalo, beta. Take a photo. Take a photo. This can be a spot diagnosis asked in NEET PG paper. It is not glue ear, beta. People think glue ear. Glue ear will have a lot of long story, beta. It's a very acute infection of the tympanic membrane. Can you see fluid-filled vesicles on the cervical tympanic membrane? That is the laryngitis bullosa, the viral infection of tympanic membrane. This is a new style question in NEET PG. Okay, now. Next one, beta. Next one, which is a very common question in exams and has been asked once in your paper also. Now, next topic, beta. Write down traumatic perforation tympanic membrane. Here only. Traumatic perforation tympanic membrane. Traumatic perforation. Look at me, beta. Traumatic perforation. Trauma. Look at me, beta. Look at me. It's a FMG question also, beta. Traumatic perforation. काफी लोग ईयरबड यूज करते हैं. Some people ask me, sir, how many time in a week we should use earbud? Answer is never. मैंने कभी ईयरबड नहीं यूज किया मेरा. I'm an ENT doctor. I know how ear knows how to clean it. Don't put earbuds in your ear to clean it. There's no need. But some people become habitual. It's okay. I can't really say no to that because it's okay. ईयरबड तो फिर भी ठीक है बेटा. कई लोग तो क्या करते हैं, माचिस की तीली से, मैच स्टिक से कान साफ कर रहे होते हैं. पता नहीं क्या करना चाहते हो, अंदर वैक्स है, पता नहीं कौन सी मोमबत्ती जगाना चाहते हो उस वैक्स से. आई डोंट नो विच कैंडल, कौन सी वैक्स से कौन सी कैंडल जगाना चाहते हैं मैच स्टिक से. बेटा वो भी छोड़ दो बेटा. वो जो होती है ना कार की चाबी, बाइक की चाबी, कार की बाइक की इधर घुमा रहे होते हैं, कार की बाइक की. हाँ भाई, क्या स्टार्ट करना चाहते हो तुम वहां पे? क्या स्टार्ट करना है तुमने कार की से वहां पे? हाँ, सबसे वर्स्ट हेयर पिन, ये जो बालों में लगाते हैं ना, लड़कियां लगाती हैं हेयर पिन्स, उससे कान इतना शार्प होता है वो तो यार हेयर पिन, उससे कान साफ कर रहे होते हैं. दूर के माई ओन मदर, मेरी अपनी मदर कान साफ कर रही होती है. मैं कभी जाता हूँ वहां पे अमृतसर ना, तो कान साफ कर रही होंगी उससे, अपनी बालों की सुई से, ऐसे हेयर पिन से. मैं बोलता हूँ मत करो, मैं ईएनटी डॉक्टर हूं, मत करो इसको. तो बोलते आई डोंट केयर, मुझे परवाह नहीं है. वो फिर करती रहती है, वो आदत बन जाती है. प्रॉब्लम इज पीपल कैन नॉट डैमेज देयर टिम्पैनिक मेम्ब्रेन ऑन देयर ओन. द रॉन्ग थिंग दे डू इज दे सिट इन द सेंटर ऑफ द रूम एंड देन दे डू इट. किसी का हाथ लगा आपकी कोनी पे, एल्बो पे, और ये अंदर चला गया एंड यू गॉट अ ब्यूटीफुल परफोरेशन लाइक दैट. हो गया ना कान बेटा, ट्रॉमेटिक परफोरेशन. You are doing earbud cleaning, some child is playing over their football and football hit the elbow and it goes through and through it. So clean it in the washroom when you are alone or face towards the wall beta, wall ki taraf beta, face towards the wall. Huh? So nobody comes from that side. But don't go too close to wall beta. If you're too close to wall, again the football comes from this side and again you got the perforation beta, hai na? So just stay away from the wall and then do it with a safe hand beta. Okay, fine. Now treatment is dropped. Treatment is wait and watch. In the bracket, conservative. No eardrops. Just keep ear dry. No eardrop, just keep the ear dry. Wait for few months, 2-3 months. Lot of perforation, not every perforation, lot of perforation will heal. Not every perforation will. After few months, we see, this is during trauma. So after you waited for few weeks, it's all healed beta. There's a chapter called wound and healing now. Healing. Okay. By chance there is no healing, then you do the surgery, but first treatment is conservative. Now in 5 MCQ, take a picture beta and post in the group beta. Let me complete it first of all. Wait. Number 5 is vocal nodule. In 5 things you mark conservative treatment, wait and watch, no active surgery. 5 MCQ paper. Laryngomalacia, the baby will be better within 1 or 2 years. Single side cord palsy, no need of any treatment. Caesareanuria, I just told you this morning only. Traumatic perforated tympanic membrane, wait and watch. Vocal nodule, don't do any surgery with her. I'm not saying don't do anything. You give antibiotic, proton pump inhibitor, voice rest, speech therapy. Basic essence is don't do any active surgery. That's the main thing. So 5M, please post it in the group below. Just note it down. 1 second, I'm coming. Note it down, I'm coming with it. Yes, in meningitis bullosa also, the treatment is conservative. But that's not asked. These are the 5 MCQs which are popular in NEET PG, FMG both. Better. That's what I'm telling you. Sure. Now let's go to the next topic. The next topic is the Eustachian tube. This is your Eustachian tube, this one. This is your Eustachian tube. And everybody can see it over there. Ear lies in which bone? What is this bone? This bone is temporal bone. Can you see a beautiful picture? Ear is the journey inside the skull via temporal bone. Now please see, Eustachian tube connects middle ear to nasopharynx. Please cut this bit. Okay. It is 36 millimeter in length. In the bracket, outer 12 millimeter is bony, inner 24 is cartilaginous. If you remember, the total length of external aortic canal, this one is 24 millimeter. Out of that, outer 8 millimeter is cartilage, inner 16 is bony. Here it is reversed. Total length is 36 millimeter and the inner 24 is cartilage. Please see it. This is outer 12 millimeter is bony and inner 24 millimeter is cartilage. This is cartilage. This is bone. At birth, it is nearly horizontal. But in adults, it has 45-degree angle with horizontal. In children, it is more or less straight. In adult, it is 45-degree angle with horizontal. That is why when you do the breastfeeding to an infant, you must elevate the head. If you keep the head horizontal, milk will enter from the mouth to the ear. Why are you sticking to? Because Eustachian tube is nearly horizontal. In adult, it is like 45-degree angle with horizontal. So breastfeeding should always be done with the head little elevated. Main function of Eustachian tube is middle ear ventilation. Nirvana will discuss IAC later on. Wait. Internal aortic canal. Middle ear ventilation. Now, tensor villi palatini. MCA question. Tensor villi palatini muscle opens the tube during swallowing. Tensor villi palatini muscle opens the tube during swallowing. That's the MCQ. Let's revise quickly. Eustachian tube is 36 millimeter in length. Outer 12 millimeter is bony. Inner 24 is cartilaginous. In children, it's horizontal. In adult, 45-degree angle with horizontal. The main function of the tube is middle ear ventilation. And which muscle opens the tube during swallowing? Answer is tensor villi palatini muscle. This is the MCQ. Now, glue ear is a star Five-star topic. It's a very commonly asked topic in your exam. Glue year is also called SOM, also called OME. Lot of name it. Serous otitis media, secretory otitis media. But the new name, that's MCQ beta, is otitis media with effusion. Now the exam is using this word beta. OME. What is OME? Otitis media with effusion. New name is otitis media with effusion. Why glue year is such a popular topic, beta? Glue year, write down. Most common cause of hearing loss in children. It is most common cause of hearing loss in children. It is collection of sterile, thick glue-like fluid in the middle. The key word is sterile. The key word is sterile. It's not pus, no pus, right? No pus. No pus. It's a chronic disease. Not in one day. The glue will collect in next few years. It is chronic disease. No pus. Basic problem is ET blockage. I hope you remember we done in pharynx also. Most common age is school age children. MCQ, every line is MCQ beta. Most common cause, school age children, put an arrow. Most common cause is adrenal hypertrophy causing ET blockage. Anybody? Adrenal will cause bilateral glue year or unilateral glue year mostly. Adenoid will cause bilateral glue year or unilateral glue year mostly. Mostly bilateral seen in children. Very important question, madam. Both are question, madam. Star question. Rare is NPC, nasopharyngeal carcinoma, causing ET blockage, mostly unilateral, seen in adults. NPC causes unilateral conductive hearing loss. It is unilateral glue. Now two MCQs, beta. One of your paper, one of NEET PG. Beta. Mouth breathing child. With hearing loss. Let's go to diagnosis. Anybody but the diagnosis? What is the diagnosis? Beta? Mouth breathing child with hearing loss. What is the diagnosis? Diagnosis is full diagnosis. Full diagnosis. Full diagnosis. Adenoid hypertrophy with the glue ear. You're right, adenoid hypertrophy. But full diagnosis, tell me. Plus glue ear. NEET PG question, MCQ2. Adult, 50 to 70 year. With the unilateral glue ear. NPC. Nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Okay, sure. next page beta, clinical picture of glue ear. Clinical picture of glue ear beta. Okay. School age child, mostly the children. NPC, the Chinese cancer, doesn't occur in India, makes to children. It's a disease of children. Okay. With complaining of number one, heaviness in the ear. MCQ, it's not painful disease. Okay. Number two, conductive hearing loss. Patient has got heaviness in the ear, but not painful because glue collection occurred in last 1 year, 2 year. It's not an acute problem. Acute problem will cause more pain. Chronic problem will lead to heaviness in the ear, not painful disease. Beta. Okay, fine. Now, number three, poor school performance. Number three, poor school performance. नहीं, मैंने ही आवाज बंद करी थी तो मैं ये बताने के लिए कि ये बच्चा कैसे फील करता है क्लास में. I made this mute to make you understand how this child feels in the class. Better, fine. Okay. So that's what the child feels, completely lost. क्या हुआ? Teacher mute mode पे चला गया, क्या हो गया भाई? Okay. Fine. Poor school performance. Okay. Number four, I did not face it. I did not face it. I did not face, remember, mouth breathing child. हाँ, तो बहुत प्रॉब्लम होता है. टीचर ने बोला मैंगो और तो मुंह खोल के बैठे वहां पे ऐसे. माउथ, आई डिड नॉट फेस. ये दीज किड्स दे डू द लिप रीडिंग ऑफ द टीचर. ऐसे मुंह खोल के बैठे थे, ऐसे टीचर दे देते थे. टीचर कहते मेरी तरफ क्या देख रहा है तू? Why are you looking at me? The kid is not looking at you, बेटा. The kid is doing lip reading actually. तुम क्या कर रहे हो बेटा? तुमने बोला मैंगो, तो क्या उसको जो एंगो उसने बना दिया टेंगो. उसको टेंगो समझ आया. टेंगो स्पेलिंग का करेक्ट कॉपी आई तुम्हारे पास, तुम टीचर हो, तुमने कॉर्टर क्रॉस कर दिया क्योंकि तुमने मैंगो बोला. उसने आइडिया से टेंगो लिख दिया, लेकिन तुम्हारे लिए तो गलत है ना. तुमने 0 लगा दिया, नंबर फेल कर दिया. ओके, फाइन. Examination बेटा. Glue like fluid behind tympanic membrane. The most important thing is air bubble trapped in the glue. This is the most important clue beta. Sign. Put sign. This is the air bubble trapped in the glue. This is visual question of the paper. Air trapped in the glue. Air bubble trapped in the glue. Now, everybody, I'll click a picture. Now, please see. Let me write down and please. Click a picture. This is the visual question of FMG paper. Yeah, the children are lost in the class. Air bubbles in the glue behind tympanic membrane. Okay, fine. Okay, fine. Now, everybody, this is important picture, beta. This is must to revise picture before the exam, beta. This is your exam question. Already MCQ has come, beta. The photo was given over there. Can you see beautiful air bubbles, beta? Treatment is what? Let's do the treatment. Treatment is surgery, beta. The surgery is called, please put a box, beta. Put a box, surgery. The surgery is called myringotomy. This one, beta. Myringotomy in antero-inferior quadrant. Which quadrant? Antero-inferior quadrant. Here, give a cut here, beta. आगे और नीचे, anterior inferior quadrant. Marin got me in anterior inferior quadrant. Plus grommet insertion, beta. This is very important word, beta. This is grommet, beta. Very small, beta, like a rice grain, beta. G for glue, G for grommet. G for glue, G for grommet, beta. Grommet. Okay. We'll give you break, don't worry. We'll give you. Topic to pad lo. G for glue, G for grommet, beta. This is very important topic, beta. Glue needs grommet. Grommet is also called as middle ear ventilation tube. Please, beta, correct it. Plus minus, beta. Plus adenodectomy. Adenoid is a cause, you have to remove it. Plus, don't do plus minus, beta. Plus adenodectomy. 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 Maringotomy is done in anterior-inferior quadrant and plus grommet insertion plus adenodectomy. Class कब तक है? Anybody can tell me what is the position of cone of light in the left ear? What is the position of cone of light in the left ear, beta? Which is that? So class B beta 7 o'clock तक. Class B 7 o'clock तक. जहाँ पे position of cone of light in the left ear है. Okay, fine. चलो. Let me show you Maringotomy, beta. We give a cut on the tympanic membrane like this, beta. Can you see, beta? Sucking the glue out. Can you see? It's a thick favicole-like glue. It's tympanic membrane. I've given a cut on tympanic membrane. Can you see a glue-like fluid being sucked out of tympanic membrane? Once you clear this whole glue, first you clear the whole glue, beta. Please see. This is the Maringotomy, beta. Maringotomy. Okay? Maringotomy. So in that cut, you suck the glue out. And after sucking the glue out, you put this, beta. You put, okay, fine. Now this is what is the grommet. Grommet insertion. Grommet. In that hole, you put the grommet. Grommet keep ventilating the middle ear, beta. It will remain there for few months. After few months, nature will remove it automatically. Nature will kick it out. Don't worry. Don't worry, beta. Till that time, don't let the water go in your ear. Till that time, be keep it. But this is the grommet, beta. Grommet. Maringotomy in anterior inferior quadrant. What is it, beta? Grommet. Glue. G for glue. G for grommet. Grommet word will only come in glue here, beta. Plus adenodectomy. Okay, fine. Now. Okay. Now, let's take a break here. And it's a 20-minute break. And then we do the last session. We'll finish at 7 o'clock, 7 p.m. Grommet, no infection will not happen if you will not let the water go in the ear. What do you find? the tympanic part of temporal bone. It's a hollow cavity in the tympanic part of temporal bone. It's a hollow cavity in the tympanic part of temporal bone. It's a hollow cavity in the tympanic part of temporal bone. It's a hollow cavity in the tympanic part of temporal bone. We discussed this earlier also. Temporal like this, if you remember. If you remember this one, we said that external ear, middle ear are lying in the tympanic part of temporal bone. Remember the picture, Okay, fine. The external ear, middle ear are lying in the tympanic part of temporal bone. Okay. Now, next one, it has three parts. Number one, M, E, H. Mesotympanum, epitympanum, hypotympanum. You see, middle ear is from here to here. This is middle ear. Now, this much part of the middle ear, which is covered by tympanic membrane, is called mesotympanum. The upper part is called epitympanum. The lower part is called hypotympanum. Epitympanum, hypotympanum. Okay. So mesotympanum is covered by tympanic membrane. It's the middle part of middle ear. It is largest part. But guys, don't forget, everything is in millimeter. It's everything is millimeter. Epitympanum is equal to attic. It is covered by bone called scutum. Scutum is NEET PG question. Right down the top. Scutum is bony wall of attic. Bony wall of attic. Scutum is a bony wall of attic. Hypotympanum is covered by bone. After grommet insertion, can you do Valsalva? No, there is no scope of doing Valsalva. You can't build the pressure. Okay. Can adenoid hypertrophy can lead to cholestoma? Yes, in some people can lead, but generally we treat it. But if you don't treat, there is a possibility, yes. Okay. Depth of middle ear is epitympanum 6, meso 2, hypo. This diagram is important, EMH, Epitympanum, mesotympanum, hypotympanum. Don't forget the word attic. Attic is the other name of epitympanum, and scutum is the bony wall of attic. My dear friend, this is the scutum. This is scutum. Sure. Now, so three part of middle epitympanum, upper part, middle part, mesotympanum, lower part, hypotympanum. Epitympanum is also called attic, and the bone which covers attic is called scutum. Scutum is the NEET PG question, outer bony wall of attic. Now, sensory supply of middle ear is by tympanic branch of glossopharyngeal nerve. Glossopharyngeal, if you remember, this ninth nerve in the bed of tonsil. This branch is equal to Jacobson's nerve. Jacobson's nerve. Please see, the nerve which supplies the throat, that supplies the ear also. That is why very famous question, referred otalgia. What is otalgia? Earache. Otalgia, referred otalgia, earache. Otalgia, earache. Now, pain from throat referred to ear. Tonsillectomy, question number 1 of your paper. Tonsillitis, question number 2 of NEET PG paper. Why tonsil throat problem cause earache? Please see, anybody remember which nerve lies in the bed of the tonsil? Which nerve lies in the bed of the tonsil? Anybody? Which nerve lies in the bed of the tonsil? Remember, glossopharyngeal nerve and styloid process. Okay, so this lead to earache via ninth nerve. Via this one, this one, Jacobson's nerve. Okay, Styalgia. Anybody? Eagle syndrome. Eagle syndrome. What is Eagle syndrome? What is Eagle syndrome? Eagle syndrome is throat pain referred to ear. Eagle syndrome is throat pain referred to ear. Throat pain referred to ear. Okay. Now supraglottic cancer, Parkinson cancer cause earache via 10th nerve. 10th nerve. Via 10th nerve. Please draw vagus nerve, gives two branches R, L, N, S, L, N, And for the ear, it gives the branch of Arnold's nerve. Arnold's nerve. Arnold's nerve. So ninth nerve and 10th nerve, they give the supply to the pharynx and larynx also, and they give one branch for the ear also. Beta. Arnold nerve. What is Arnold nerve? Anybody? What is Arnold nerve? Auricular branch of vagus nerve. Beta. What is Arnold nerve? Auricular branch of vagus nerve. Beta. Remember, Eagle syndrome. Beta. Long started process pressing the glossopharyngeal nerve lead to throat pain. Refer to ear. Beta. And these are very famous questions. Beta. Tonsillectomy, tonsillitis. Already it is asked. Beta. Supraglottic cancer. Beta. First symptom of supraglottic cancer in larynx cancer topic was throat pain. Refer to ear. Why? Larynx, RLN, SLN branch of which nerve? Beta? Vagus nerve. And ear gets a branch of vagus nerve called Arnold nerve. Arnold nerve, ear, auricular branch of vagus nerve. Okay, this is star question, beta, not to be forgotten. Am I clear, beta? Fine. Okay, chalo. Now, everyone, the main question which you should not forget is this one, beta. Tonsillectomy and tonsillitis cause earache through which nerve? Beta? Vagus, the glossopharyngeal nerve. Now, sixth wall of middle ear. What are sixth wall of middle ear, everybody? Now, this is your middle ear. Middle ear. And your mastoid is a part of the ear, beta. Okay. So guys, please see. This is your middle ear. This is roof. Roof is towards brain. This is floor. Floor towards neck. Roof towards brain, floor towards neck. This is anterior wall. Anterior wall towards mandible. This is posterior wall. Posterior wall towards mastoid. Look at a picture, beta. Roof towards brain, floor towards neck, anterior wall towards mandible, and posterior wall towards mastoid. Lateral wall, outer wall is towards tympanic membrane, and medial wall towards the inner ear. Beta. Why? External ear, middle ear, inner ear. After middle ear, which ear? Beta? Inner ear. So roof towards brain, floor towards neck, anterior wall towards mandible, posterior wall towards mastoid, lateral wall towards tympanic membrane, and medial wall towards the inner ear. Is everyone clear about that, beta? Roof towards brain, floor towards neck, anterior wall towards mandible, and posterior wall towards the mastoid. Lateral wall, outer wall is tympanic membrane, and medial wall towards the inner ear. Am I clear? Fine. Okay, sure. Let us start the sixth wall of middle ear. The number one, roof. Above it lies dura of temporal lobe of brain. Above it lies dura of which lobe? Which temporal bone? Temporal lobe. Floor. Below the floor lies jugular bulb. Below the floor lies jugular bulb. Jugular bulb. So let's understand jugular bulb. Everybody, very interesting neuroanatomy here. This is your middle ear. ME matlab middle ear. And this is M. What is M? But a mastoid. Mastoid is a part of the ear. Okay. Now, this is your dura of temporal lobe of brain. Above the roof lies dura of the brain. Okay. Now, behind the ear in the skull, we have a sinus called sigmoid sinus that comes down in the neck. It is called IJV, and this dilatation is called jugular bulb. All of you, this is the venous flow of the brain toward the heart. You must have heard a lot of sinuses, beta. Sigmoid sinus, lateral sinus, petrosal sinus, caverna sinus. What are sinuses of the brain? They are the venous drainage pathway of the brain. Ultimately, all sinuses drain into sigmoid sinus, and this is continuing down as internal jugular vein of the neck. So today you should know sigmoid sinus, jugular bulb, and IJV are one structure given three different names in three different areas. I repeat, today you must remember sigmoid sinus, jugular bulb, and IJV are nothing but three different structure in three different areas. Okay, right? They are the same structure, but given three different name in three different areas. I repeat, sigmoid sinus, jugular bulb, and IJV are same structure given three different name in three different areas. Okay, fine. Now, in this picture, one thing is very clear, beta. Above the ear is brain, behind the ear is sigmoid sinus, and below the ear is jugular bulb. Number one, beta, above the ear is brain, behind the ear is sigmoid sinus, below the ear is jugular bulb. Beta. Okay, jugular bulb. Okay, beta, fine. Now, everyone, please see the screen already. Click the picture, beta. Click the picture. Above the ear is brain, behind the ear is sigmoid sinus of the brain, which is venous sinus and jugular bulb. Today you are clear, internal jugular vein of neck is nothing but downward extension of sigmoid sinus of brain. Internal jugular vein of the neck is nothing but downward extension of sigmoid sinus of the brain. Okay, fine. Now, next one, please see. Now look at this picture, neuroanatomy picture of your anatomy books. This is ear. This is ear. This is the temporal lobe of brain. Above the ear is brain. Which part of brain? Temporal lobe. This is sigmoid sinus. This is jugular bulb. And my dear friend, this is IJV. IJV. So above the ear is brain, behind the ear is sigmoid sinus, and below the ear is jugular bulb. I think this picture will make everything clear to you. Above the ear is brain, behind there is sigmoid sinus, the dilatation of jugular bulb, and my dear friend, this is the venous drainage of the brain toward the heart. Chalo. Take a photo, beta. Take a photo, everybody. Now take a photo. रियल बिट्स। चलो मेरे को फोन कर देना, फिर दोबारा स्टार्ट करेंगे।
Garden and bathhouse. I owned it 18,000. 18,000. मतलब per person only 3,000. Equal season will tested for price, tested by fans. फोटो में बना लागी चुन्नी मेरी रंग से ललारिया
हाँ जी, वो मुझे पता, मैं माइक खुला छोड़ दूँ।
Temporal lobe of brain. What lies over here is dura of temporal lobe of brain is here, beta. Okay, look at me. Above the roof lies the dura of temporal lobe of brain. Now, please look at the other markings. Now, this marking is the anterior wall and this marking is the posterior wall. Now, let's focus now on anterior wall and posterior wall. Okay, the yellow wall which is at the floor is the medial wall. We'll do it later. Please focus fully on anterior wall and posterior wall. Now, let me talk to you about the anterior wall. Now, if you remember, anterior wall has got two openings. The lower opening is for eustachian tube opening and the upper opening is for the canal for tensor tympani muscle. Now please see the blue marker. Can you see the blue marker? The blue marker, this one, this represents the eustachian tube opening. This is a eustachian tube opening, okay. The upper one, the orange one with the fibers attached to it, this represents the canal for tensor tympani muscle. This is the canal for tensor tympani muscle. Can you see two markers, the orange marker and the blue marker on the anterior wall of middle ear? The blue marker represents the opening of eustachian tube. The upper one, the orange one, represents the canal for tensor tympani. These fibers indicate the tensor tympani muscle fibers which attach to malleus. Okay. Now let me come to the posterior wall here. Okay, posterior wall. Now you know posterior wall has a projection called pyramid. From pyramid, which muscle comes out? Stapedius muscle comes out and that attaches to stapes. Now focus on the posterior wall. And on the posterior wall, can you see this wooden thing? This wooden thing represents the pyramid. Pyramid is a projection on the posterior wall of middle ear. Can you see these orange fibers? They represent the stapedius muscle and then you have got a blue knob-like thing that represents the stapes. Again, on the posterior wall, you can see a projection here which is called pyramid and these fibers indicate stapedius muscle and the blue knob-like thing represents the stapes. Okay, so anterior wall, posterior wall. I hope you understand. From anterior wall comes the tensor tympani muscle, this one which attaches to malleus. From posterior wall there is a projection called pyramid. From pyramid comes stapedius muscle for the stapes. So anterior posterior wall is over. Now let me come to the medial wall. Now medial wall is that wall of middle ear which separates it from the inner ear. So behind the medial wall here, please see, behind the medial wall here lies inner ear. Look at screen, look at this one. Behind the medial wall lies the inner ear. Imagine, look.
larynx, RLN, SLN branch of which nerve beta? Vagus nerve. And
खुशियों के बहाने हजारों हैं, किसका कसूर कहें, पर जिम्मेदारी हमारी भी बनती है, इतना जरूर कहें। जो हो रहा है वो आंखों के आगे है, नजरें क्यों फेर ले हम, अपने इरादों से मंजर बदलने का सर पे सुरूर रहे। मेरे यारा सुन ले दिल की पुकार जरा, सच्चाइयां सारी नजदीक है तेरे, जो ढूंढे तो मिलेंगी वो तुझे आईने में।
Was it audible to you? ये कौन सा गाना, बस गाना सुन रहा है तुम लोग? आवाज आ रही है गाने की? गाने की आवाज आई तुम्हें कि नहीं आई? आई, बहुत बढ़िया। चलो तैयार हो जाओ बेटा फिर सुनने के लिए। कल क्यों अटेंड नहीं कर पाएंगे? ये कल क्यों नहीं अटेंड कर पाएंगे, मुझे बताओ जरा। कल क्या है? कल क्या? इट्स ऑडिबल? अच्छा,
जैसा है से आग लगती है वो थी।
मैं चाड़ी तू की सानू छड्डना नहीं, असी छड्डी यारी, राती पी के दारू नारे यारा पाए नी खलारे, तैनू दिल विचों कट के मैं सीना ठारिया नी तेरा सारा गुस्सा, पंज तारा ठेके उत्ते बह के तारिया मैं तेरा सारा गुस्सा, पंज तारा ठेके उत्ते बह के तारिया मैं तेरा सारा गुस्सा, पंज तारा ठेके उत्ते बह के तारिया मैं तेरा सारा गुस्सा। तेरी कल्ली कल्ली फोटो ते डिलीट मारिया नी तेरा सारा गुस्सा, पंज तारा ठेके उत्ते बह के तारिया मैं तेरा सारा गुस्सा, पंज तारा ठेके उत्ते बह के।
welcome back. At the end of the class, let's study a little bit more. We'll definitely ask something. Let's do something creative. क्या बात है. Let's end the class with a song. Definitely. Chalo. Everyone, yes. Thank you very much. Good evening once again. Let us start where we left. We said that the above the ear is the brain, and behind the ear is sigmoid sinus, and below the ear is jugular bulb. Okay. Now, I will draw a picture on the next page, beta. Chalo. Draw a picture. Let's study a little bit more and then end the class with some song. चलो ठीक है, एक काम करते हैं, आज कुछ अच्छा करते हैं. This is mastoid, middle ear. Above the ear is brain. Dura, मतलब brain. This is sigmoid sinus, jugular bulb. Definitely. So at the end of the class, we'll do something. पक्का. चलो पढ़ते हैं आराम से. क्लास में सोचो ये क्लास हो रही है, तुम क्लास के बाद इकट्ठे पढ़ रहे हैं, ये सोचो. थिंक लाइक दिस दैट यू स्टडिंग टुगेदर आफ्टर द क्लास ओवर. चलो थोड़ा दिमाग को ट्यून करते हैं. सिग्मोइड साइनस, जुगुलर बल्ब एंड आईजेबी. ओके, वेरी गुड. Above the ear is brain. Below the ear is jugular bulb, JB. And behind the ear is sigmoid sinus. Above the ear is brain. Behind the ear is, below the ear is jugular bulb. And behind the ear is sigmoid sinus. Above the ear is brain. Below the ear is jugular bulb. Behind the ear is sigmoid sinus. Chalo. Please click the picture and post in the group. People have joined maybe late. They can draw it later on. Somebody click the picture, please. Somebody click the picture, please. Yeah. We are doing 25 and 125 page. Don't worry. I'm glad that you are desperate to know that. Very good. Chalo. Please click this picture and post in the group. Yeah, we are coming to 125 page. Behind, mastoid is a part of ear. Mastoid is a part of ear. Now, so above the ear, like 125 page. Above the ear is dura of temporal lobe of brain. Below the floor lies jugular bulb. Now, number 3, anterior wall has 2 openings. A and B. Lower opening for ET. Upper opening for TT. थोड़ा rhyming कर लेते बेटा. Lower for ET, upper for TT. 2 opening. Lower opening for eustachian tube, upper opening for tensor tympani muscle. ET, TT beta. ET, TT. Okay. This muscle is attached to malleus. And this muscle is supplied by mandibular division of trigeminal nerve. This is MCI question beta. TT. Tensor tympani trigeminal. Tensor tympani muscle is supplied by mandibular division of trigeminal nerve. Why mandibular division? Anterior wall towards mandible. Remember? Anterior wall towards mandible, posterior wall towards mastoid. Number 4. Posterior wall has a projection called pyramid. Pyramid on which wall? Posterior wall. Pyramid is our history. Backside mala posterior wall. Egyptian pyramid. Egyptian pyramid is our history. Backside posterior wall. From pyramid, stapedius muscle tendon comes. From pyramids, stapedius muscle tendon comes and attached to stapes. ये इसने लेट ज्वाइन किया बेटा, इसका अभी पिछला पार्ट चल रहा है, इसलिए ये वाली फोटो आ रही है. This muscle is supplied by facial nerve. S for stapedius, S for seventh nerve. S for stapedius, S for seventh nerve. So pyramid on which wall? Posterior wall. From pyramid, which muscle comes out? Stapedius muscle. Attaches to which ossicle? Stapes. And stapedius was supplied by seventh nerve, facial nerve. S for stapedius, S for seventh nerve. Chalo, focus karo padhai pe. Everybody please see. When I label, then you click the picture. Beta. Now please see anterior wall, posterior wall. Beta. Now anterior wall has 2. One is ET. Other is TT. Can you see eustachian tube? Beta? Air will come through eustachian tube to the middle ear. Beta. Tensor tympani muscle attaches to what? M. What is M? Malleus. Malleus. Beta. Okay. Now posterior wall has a projection called pyramid. From pyramid, which muscle comes? Stapedius. Attaches to S. Beta. S for the stapes. I for incus beta. Incus has no muscle. Incus has no muscle beta. Everybody, very easy beta. Anterior wall has two opening, ET, TT. Posterior wall is a projection for pyramid. Pyramid is the posterior wall, past beta, past on posterior side. From pyramid, which muscle comes? Stapedius muscle for stapes. Write down on the notes beta. Incus has no muscle. Somebody click a picture and post in the group beta. This picture will help you revise anterior and posterior wall of the middle ear beta. So we have done the four wall, roof and floor, anterior wall, posterior wall. Now come the lateral wall, medial wall beta. Lateral wall, medial wall. Now this is lateral wall beta. Lateral wall, this one beta, lateral wall is tympanic membrane. This is the medial wall. Behind the medial wall lies the inner ear. Behind the medial wall lies the inner ear. Can you see lateral wall? Lateral wall is tympanic membrane, this one, and behind the medial wall lies the inner ear. So lateral wall is made by tympanic membrane, and number 6, medial wall. Behind this wall lies the inner ear. I'll give example, beta. Pyramid is on which wall? Posterior wall. Stapedius muscle is supplied by 7th nerve. S for stapedius, S for 7th nerve. Tensor tympani is supplied by trigeminal nerve. Which ossicle has no muscle? Incus. That's the question, beta. Okay. Medial wall, behind this wall lies the inner ear. Okay. Now, medial wall has two projections of the inner ear. Projections of the inner ear. Look at it. What do you mean by projection? Two projections of the inner ear. Always see, beta. Please see on this. Please look at me, beta. Look at me. Please look at me, beta. Now, please see. Imagine that I have got. Imagine this is the inner ear, beta. This is the medial wall of middle ear. This is the medial wall of middle ear, beta. This is the medial wall of middle ear. It's not a smooth wall. Why? Behind this lies the inner ear, beta. Behind lies the inner ear. So inner ear will create a projection on this wall, beta. Please see. Everybody, please see. Imagine this is cochlea. This is cochlea. This is the cochlea. Behind this wall is the cochlea. Beta. You see, everybody. Now, please see. This is medial wall of middle ear. I am inner ear, beta. Imagine this is the cochlea. Cochlea. Now this cochlea will do what? It will make a projection on this wall, beta. It will make a projection on this wall to show off that I'm also there, beta. To just show up projection, beta. It will show up as a projection that I'm also there, beta. You see. It will make a projection on this wall, beta. Please see, beta. Now, please see. Can you see there's a projection on this wall, beta? Can you see this projection? It's not cochlea. It's a projection made by the cochlea, beta. Now, this projection of the basal turn of cochlea is called promontory. Promontory. Cochlea is this one, beta. Cochlea is this one, but cochlea is behind this wall here. It's creating a projection on this wall, beta. Could you understand that, beta? Could you understand that? Okay. This is cochlea. This is medial, white is medial wall, is behind this wall. Can you see this projection of the cochlea? This one, beta. Okay. Could you see that, beta? Fine. Okay, fine. Fine. Now, it is my good fortune that I am able to connect with so many of foreign medical graduates. Believe me, it's a blessing for me, and I'm not saying it to please anyone. I don't have any reason to now please anyone. I can be myself. I can afford to be myself, and that's coming from the core of my heart. I'm really thankful to God that this all teaching kind of thing happened to me, and I'm really, really grateful in a way that my life, I feel little worthwhile in life in a way that we can come in contact with so many people and maybe contribute 1 millimeter to their life. It's a huge, huge blessing. It's a blessing more than anything. It's a blessing, I will say. Now let me go back to the presentation. This one. Okay. I'm coming to that, beta. I'm coming to that. The projection is called promontory, beta. Promontory. So promontory, number one. Promontory is the projection of basal turn of the cochlea. Promontory is the projection of basal turn of the cochlea. One second again. Screen, beta. Promontory is the projection of basal turn of the cochlea. Promontory is the projection of basal turn of the cochlea. Not pyramid, not pyramid. Number two, lateral semicircular canal bulge. So two things make a bulge on the medial wall of middle ear. Please see it. Behind the medial wall lies which ear, beta? Inner ear. So can you see over there? One projection is made by the basal turn of the cochlea, and this projection is called promontory. Promontory. And the other projection is made by lateral semicircular canal, and that is called lateral SCC bulge. At lateral LCC bulge. So projection number one, projection number two. Okay, everybody. So I repeat, behind this wall lies the inner ear, and the inner ear makes two projections on the medial wall of middle ear. Number one, promontory. Promontory is the projection of basal turn of the cochlea, and the number two, lateral semicircular canal bulge. Okay, fine. Thank you very much, guys, for your loving words. Thank you very much. Fine. Now, number two is the oval window and round window. Oval window and round window. Two window, oval window, round window. This is oval window. Everybody, let me label it. This is oval window. This is round window. Two window, oval window, round window. Now, oval window is covered by foot plate of stapes. Oval window is covered by foot plate of stapes. Round window is covered by a membrane called round window membrane, and that is also called secondary tympanic membrane. Also called as secondary tympanic membrane. Secondary tympanic, oval window, round window. Oval window covered by foot plate of stapes. Round window covered by round window membrane, also called as secondary tympanic membrane, is MCQ. Now, let me record an audio for you guys for summarizing this whole thing. I put a video link also. Okay, fine. Now guys, please see. Everybody, now hear me carefully. This is a summary of the middle ear, and this video, which is posted above in a Telegram, is to make you understand the cardboard model of the middle ear to make it even more easier. This is just the shoebox. Anuradha gave me the shoebox, and I made this, and with the help of Anuradha only. She only helped me to design all this and recorded that. So let's do it. That's it. Summary of sixth wall of middle ear. Above the roof of middle ear lies the dura of temporal lobe of brain. Behind the ear lies sigmoid sinus, and below the ear lies jugular bulb. On the anterior wall, there are two openings. The lower opening for ET, second tube. Upper opening for TT, tensor tympani muscle, which is attached to malleus. Tensor tympani is supplied by trigeminal nerve, TTT. Posterior wall has a projection called pyramid. From pyramid, stapedius muscle comes and attaches to stapes. Stapedius is supplied by facial nerve. As for stapedius, as for seventh nerve. Incus has more muscle. Lateral wall is tympanic membrane, and medial wall, behind the medial wall lies the inner ear. So this wall has two projections of inner ear. Number one, promontory, which is projection of the basal turn of the cochlea, and number two, lateral semicircular canal bulge. There are two windows on this wall: oval window covered by foot plate of stapes, and round window covered by round window membrane, also called as secondary tympanic membrane. Now, this is a brief summary within 1 minute. This is 1 minute, one page which seems so complicated. Oh my God, so many. One page which seems so complicated. The summary is less than 1 minute. Try this kind of quick audio summarized audio for other subjects also, wherever you can. Okay, fine. Now let's go to the next one. Middle ear cleft. It's a combination of all hollow cavities in temporal bone. All hollow cavities in temporal bone. It's a combination of all hollow cavities in temporal bone. Temporal bone is a very hollow bone. Like yesterday class, ethmoid bone is full of air cell. Temporal bone is also full of air cell. Middle ear is a hollow cavity in the temporal bone. All of you look at the screen now. My dear friends, this is your temporal bone. Okay. Now this is your M. What is M? Mastoid part of temporal bone. There are many air cells in the mastoid. But one cell is constant. That cell is called antrum, and that's the largest cell of the mastoid. Everybody has that. Yesterday class, bulla ethmoidalis. Bulla ethmoidalis was constant cell and the largest cell of the ethmoid. Bulla ethmoidalis. Like yesterday we had bulla ethmoidalis in the ethmoid bone. Today we have antrum in the mastoid. It's the constant and largest mastoid air cell. Everybody of us will have antrum. Everybody of us will have bulla ethmoidalis in the ethmoid. Same like here antrum. This is your middle ear. Middle ear and antrum are interconnected by a channel called adductus. And middle ear is connected to nasopharynx through eustachian tube. We're going to find. Now there are many mastoid air cells. Okay, fine. Everybody take a picture, beta. Take a picture. Okay, bache, fine, very good. Now, everybody, similarly, beta, please see on the screen. Anybody tell me? I'm very happy to hear, beta. This is T, tympanic part of temporal bone. What was this P, beta? Anybody? T was tympanic part of temporal bone. What was the P? Anybody? What was the P, beta? What was P? P was what? Anybody? What was P standing for? P is petrous part of temporal bone. Petrous part of the very good. Petrous part. In the petrous part, we have also got some air cell. My dear friend, this is called petrous apex. Petrous apex. At the petrous apex, we have two nerves. One is called the fifth nerve. One is the fifth nerve. Other is sixth nerve. Fifth nerve, sixth nerve. Then two nerve enter the ear from here. Anybody? Which two nerve enter the ear from here? From the brain side. Anybody? Which two nerve enter the ear from here? Anybody? You are right. Which one? Seventh nerve and eighth nerve. Can you think of continued up from the brain nerves coming out? 5, 6, 7, 8. 5, 6, 7, 8. 5 and 6 are at the petrous apex. 7 and 8 enter the ear from the brain side. 5 and 6 are at the petrous apex. 7 and 8 are actually entering the ear from that side. Okay. Petrous apex cells are also part of the middle ear cleft. Okay. Fine. Okay, fine. Now, let us see the middle ear cleft. It's a combination of all hollow spaces in the temporal bone. It has got 5 parts. Number 1, eustachian tube, middle ear, adductus, antrum, rest of ear cells. Rest of ear cells. Please see. Number 1, eustachian tube. Number 2, middle ear. Number 3, adductus. Number 4, antrum. And number 5, remaining air cells. So this is one system. Please see, all these spaces are mucosa lined and interconnected. All these spaces are mucosa lined and interconnected. Look at screen, everybody. Every cell is lined by mucosa. Every cell is lined by mucosa. Not even a single cell is bare. Yesterday, ethmoid air cell 2 to 8. What are sinuses? What are sinuses? Mucosa lined, air filled hollow cavities. Similarly, right now, what are temporal bone cell? They are also mucosa lined, air filled hollow cavity. And they are interconnected. Everything is interconnected. Everything is interconnected. Look at this thing. Look at this thing. I have shown this as one system. Okay, and please see beta, which two nerve lie at the petrous apex, fifth and sixth nerve beta. Put around circle beta, antrum. It is largest and most constant mastoid air cell. Everybody has got the mastoid air cell, antrum, it's largest cell. Anybody, it's connected to middle ear through. What is the answer beta? Antrum is connected to middle ear through. Antrum is connected to middle ear through. Additus, very good. Additus beta. Antrum into additus beta. Additus. Okay, very good. Let's revise once again. What are the 5 parts of middle ear cleft? It's one system of intercommunicating spaces. Revise in the number 1, Eustachian tube. Number 2, middle ear. Number 3, additus. Number 4, antrum. And number 5, remaining ear cells. Now, all of you, this system is interconnected mucosa line. Now, don't draw it, but just see over here. By chance, somebody got cold over here, pus in the nose. If the infection goes from Eustachian tube into middle ear, this disease is called otitis media. Otitis media. By chance, immunity is not good. Infection goes from here to all the mastoid air cells are infected. Every cell is mucosa line and interconnected also. Beta. That disease is called mastoiditis. Mastoiditis. By chance, infection goes from here to here, reaches petrous beta. That disease is called petrositis. Beta. It's a simple science, but not a rocket science. Beta. You know the system is interconnected. Okay. Now everybody, spread out disease. Nasopharynx to middle ear, otitis media. Middle ear to mastoid, mastoiditis. And middle ear to petrous apex, petrositis. Same what I told. I have written these notes myself, Peter. I have not asked anyone to type these notes for me. I have typed these notes myself. I have made these notes for myself as if I am a foreign medical graduate student. How will I summarize the ENT for myself for the proper conceptual preparation of for the exam? Beta. So middle ear, otitis media, middle ear to mastoid, mastoiditis, middle ear to petrous apex, petrositis. Beta. Okay, now disease of middle ear cleft, 5 diseases. You are adding 5 diseases. Number 1, simple disease, ASOM. Number 1, ASOM, acute suppurative otitis media. These cells are actually having no function at all, but they make your skull lighter. That's all about it. Okay, fine. Now, it is infection of middle ear mucosa by pyogenic organisms. Acute suppurative otitis media. Look at the name. Suppurative is a pus-forming organism. Otitis media is a middle ear infection. Most common organism is Streptococcus pneumoniae. I'm the best monkey. I'm the best monkey, but best is not best is a very heavy term. Beta. Never be too ideal. Never be fame is a morphine. Beta. Fame is a morphine. Stay away. Really stay away. Stay humble. Stay grounded. Stay moderate. Came like a monkey, die like a monkey, finish and go to the other planet. That's what best. These are very heavy terms. And never, more you grow in life, just stay more grounded, more humble. You are nothing, actually. Believe me, we are nothing. Nature chooses us for these kind of works, actually. It's my, not to show you off, not to tell you philosophy. I experience this. Honestly, I'm experiencing this. It's not that we do it. It is that nature makes us do it. The whole creation has a creator, whatever you call it. I don't know that. But I feel that nature chooses you for a role. Okay, so there's not a big deal. I'm the best monkey, buddy. I can tell you, in my crowd, I'm the best monkey. Step pneumonia. Infection reaches from what is missing. From nasopharynx to middle ear via Eustachian tube. Simple सी बात. Dr. Dhawan, I had cold for last 2-3 days. This morning my ear is paining. So chief complaint, earache. Okay, earache. Examination beta. A red tympanic. Dr. Dhawan, I had cold for 3 days. This morning my ear started paining. I examined the ear of the patient with otoscope. Beta, look at me, otoscope. What I see over there, a red tympanic membrane. With dilated capillaries, beta. Now, please, beta. Can petrositis occur without menstruation? Yes, beta. Petrositis can be independent disease also. Beta. Yes, absolutely. Thank you very much, guys. Thanks a lot. Let's draw beta like this. Every draw. The infection lead to inflammation, lead to vasodilatation, capillary dilation. Anybody who can tell me what the normal color of tympanic membrane? What is the normal color of tympanic membrane? This is red color. What is the normal color of tympanic membrane? Pearly gray. Very good. It's not normal. And this is called cartwheel sign. Very good. Pearly gray. This is called cartwheel sign. This one. The capillaries are dilated. They look like spokes of the wheel actually. It's called cartwheel sign. Pearly gray is the correct, but this one is not pearly gray. Infection lead to redness, congestion. Yes. Now the treatment is medical management. No question possible. MCQ is this one, beta. ASOM patient with red bulging tympanic membrane. The keyword is bulging. TM is bulging. Means if you did not do anything, what will happen, beta? There will be perforation, beta. If you did not do anything, there is a bulging TM. There will be perforation, beta, and the pus will come out. Pus will come out from here. It's a serious problem, beta. And rather than that, what you do, you give a cut on the tympanic membrane. What is the name of this surgery? The name of surgery is what, but anybody? Myringotomy. What is myring? Tympanic membrane. What is otomy? To give a cut. Myringotomy in this case is done in which quadrant? Posterior-inferior quadrant. Right on. Treatment is surgery. Myringotomy in posterior-inferior quadrant. Myringotomy in which quadrant? Posterior-inferior quadrant. Okay, very good, beta. Myringotomy in which quadrant? Posterior-inferior quadrant. Can we draw a small diagram here, beta? Anybody? Myringotomy for glue ear was done in which quadrant? Myringotomy for glue ear was done in which quadrant, beta? Okay, yes, beta. So P for pus, P for posterior-inferior. In glue ear, it was anterior-inferior. Glue, grommet. There's no role of grommet here. Grommet will only be required for glue ear. How to remember? G for grommet, G for glue ear. Every myringotomy does not need grommet. Only glue myringotomy needs grommet, beta. Here, no need of grommet. So in glue ear, anterior-inferior myringotomy. In ASOM, posterior-inferior. How to remember, beta? P for pus, P for posterior-inferior. Okay. And if no management is done in a patient of ASOM with red bulging TM, it will lead to perforation of tympanic membrane. Everybody show like that, beta? Perforation of tympanic membrane. If no management is done in a patient of ASOM with red bulging TM, there will be perforation. Beta. If patient does not come to your hospital, there will be perforation. Beta. Now, if this person would have taken treatment, look at the next page, beta. This is ASOM with perforation. Show the pus here, beta. Now, if this person would have taken treatment, would have come to hospital, would have taken antibiotic, keep the ear dry, everything done, believe me, this would have healed beautifully like that. Wow. Nature is a very good healer, beta. You know, you got cut, it got healed. Similarly, it got healed. But if you ignore it for 3 months, no treatment you take for 3 months, and it becomes a permanent perforation. So you have two options, beta. The problems happen, beta. Problems do happen in our everybody's life. Like last time my exam could not pass, etc., etc. You have two options, beta. Either to not do anything about it, keep complaining, and we was wrong, this was wrong, time was less at all. If you do like that, this become a permanent perforation, beta. Permanent perforation. It's a big problem now to handle. This will need surgery. But if the problem came in your life, you still said, I will fight it out. You took antibiotics, showed to doctor, follow up, keep the ear dry, did everything possible to keep the ear dry. This will be healed without any problem. But if you ignore it, it will be 3 months. 3 months you ignore it, it becomes permanent perforation. मेरे को सर्जन को दुख बाहर आया लगता है, सब हील होता है एक्सेप्ट हार्ट. कोई पुरानी दर्द बाहर आई आज लगता है भैया. ASM with perforation, safe CSO. No treatment for 3 months. Okay. If no treatment is taken for next 3 months, it will lead to permanent perforation. The disease is called safe CSO. I hope clear, beta. ASOM can have perforation. If you don't do myringotony, if you ignore that perforation for 3 months, it becomes permanent perforation, and that disease is called safe CSOM. What is C, beta? Chronic. Chronic. Why we call it safe? Because there is no life-threatening problem, beta. Even if the perforation happens, it will not never kill you. You might have hearing problem, ear discharge, but it will not kill you, beta. There's another disease coming in the 5th topic, that is unsafe, beta. This is safe. Okay. Very common is in India, safe CSOM. कहने का मतलब क्या है? हर safe CSOM के पीछे एक ASM का हाथ होता है. Behind every safe CSOM, there is one ASOM, beta. Okay. No. Number 2 disease, beta. Safe CSOM. It is also called tubotympanic CSOM. Okay, it is the permanent central perforation in pars tensa of tympanic membrane. Anybody? Pars tensa is lower part or upper part? We'll discuss, but answer will be separate topic, Devansh. Okay. Then answer will be separate 5th topic. Let us start safe, beta. Let's start safe. We're starting safe, full topic. Now, it is permanent central perforation in pars tensa of tympanic membrane. Lower part, very good. Can you see, beta? This is a perforation there. Now, chief complaint, beta. Next period. Number 1, ear discharge. Discharge is not foul smelling. Main thing is not foul smelling, beta. Highlight. Not foul smelling ear discharge. Number 2, beta. Number 2 is the conductive hearing loss. CHL. Okay. Because why? Draw over this is perforation. There will be conductive hearing loss. Now, ossicle erosion. In long-standing cases, there can be ossicle erosion also. Look at me, beta. Look at me. Ossicle are very small bone, beta. That's why it's very small bone. Ekdam chawal ke dane, rice grain, beta. You know rice grain? Very small rice grain. Like I can hold 3 ossicle in my hand like this, beta. Like this. Okay. Fine, like this, beta. Essay. We can hold it like that. Okay. In long-standing cases, there can be ossicular erosion also. Chronic suppurative otitis media. Rahul, this is chronic infection. Beta. Otitis media means infection of middle ear. It's a chronic infection. There is infection. Beta. Water is going in the ear. That same ear, water goes to middle ear. The chronic infection of middle ear. First ostial node is incus. Anybody, which muscle attaches to incus? Write the name of muscle, beta. There is no muscle, beta. Why incus? Incus has no muscle attached to it, so it has least blood supply. Very good, beta. Look at me, beta. Every muscle brings blood supply for the bone. Incus has least blood supply. Incus has least blood supply, beta. Anybody from Trivandrum batch here, beta? Trivandrum batch. Trivandrum. Anybody from Trivandrum batch? Trivandrum offline batch. Anybody from Trivandrum offline batch here? Trivandrum offline batch. Anybody? Okay. Now, ossicle erosion will increase conductive hearing loss. Okay. Ossicle erosion will increase the conductive hearing loss. Treatment is surgery. Surgery. Now please see it. This is malleus, incus, stapes. The first ossicle to erode is the incus. Can you see incus is eaten up from there? As time will pass, no pain, beta. No pain. Write down there no pain. Write down there is no pain. Please see, as time will pass, full incus will go, beta. If don't take treatment, within few years, even malleus can go, beta. Okay, fine. So the first ossicle to go is incus. After that, malleus will go. So better you take early treatment. Otherwise, it will not kill you, beta. It saves CSM, but hearing problem can increase in future, beta. The treatment is surgery, right now. Treatment is surgery. Number one, laryngoplasty. Guys, write down here, there is no pain. Yes, you have no pain, no pain. It is repair of tympanic membrane perforation using a graft. Most common graft is temporalis fascia graft. You must be knowing there's a muscle here called temporalis muscle, and that you take a fascia of that muscle and use it as a graft. Surgery is required for CSM, not for ASM. ASM only if there is a bulging TM. You know, remember? If it is bulging TM, then we go for the myringotomy surgery. Otherwise, surgery is not needed. For safe CSM, surgery is mandatory. Why? It's a permanent perforation, and the basic surgery is myringoplasty. It's a very simple surgery. Please see, beta. Please see. You take the graft from where? From the temporalis fascia. That a temporalis muscle. From here, you take a small piece of fascia and use that as a graft and seal the perforation. This is before surgery. This is after surgery. Look at the definition, beta. Myringoplasty is repair of tympanic membrane perforation using a graft, and this most common used graft is temporalis fascia graft. Next page, beta. No, we see under microscope, beta. This, okay. It's a microscopic ear surgery, beta. Surgery of the ear is under microscope. Okay. Number one, this is incision. Wild's post-oral incision. Wild post-oral incision, this one. Post-oral behind the pinna. Okay. Number two, we use a retractor. Which retractor? NEET PG question. Mollison self-retaining mastoid retractor. This one, Mollison self-retaining mastoid retractor. This was a visual question of NEET PG. First, you give a cut, then you open the area by putting a retractor there, and there will be Mollison self-retaining mastoid retractor. Please wait, wait. Once I label it, then you post it in the picture. Please revise it. For ear surgery. Guys, can you click a picture? This is main retractor used in ear surgeries, Mollison self-retaining master retractor. Mollison self-retaining master retractor. Mollison self-retaining master retractor. Anybody tell me, it's a microscopic ear surgery. What is the focal length of microscope for ear surgery? What is the focal length of microscope for ear surgery? Yes, 200 millimeter. Yeah. Remember ENT 234 for ear 200 millimeter. Yes, very good, very good, very good. Right now in the bracket 200 millimeter. We get the assessment done before surgery also with the audiometry, but main we get to know during surgery under microscope. Very small ossicle bit, like rice grain. Very good. Second surgery is type 3 tympanoplasty. Matlab, it's done in situation when disease has eaten away the malleus and incus, M minus, I minus, S plus situation. Draw perforation. Perforation plus M minus, I minus, S plus. M minus, I minus, S plus. Now please see what about M minus, I minus? Disease has eaten away the malleus and incus. All eye on the screen, beta. I told you, if you don't take treatment, full incus will go. If you don't take treatment, full malleus will also go. Okay. Now, only thing left is what, beta? Is the stay piece, and there's a perforation. Now, this is M minus, I minus, S plus situation. Are you getting my point, beta? No malleus, no incus, only stay piece there, beta. Now, please understand. Look at me, beta. Look at me, everybody. There is a perforation here, beta. There's a perforation here. Okay. That's the perforation we have. Okay. Now I want to put the graft. I want to put the graft like this. And can you see beautifully healed perforation, beta? There's a perforation. There's a perforation. And I'm putting the graft beautifully healed, beta. But look at me, beta. Look at me. This is stay piece, beta. Stay piece. I will have to touch the graft with the stay piece, beta. I'll have to touch the graft with the stay piece so that sound transmission continuity is maintained better. If stay piece is away from it, how will sound energy reach the stay piece better? Okay, fine. So in this case, okay, in this case, the TM graft is placed in contact with stay piece. I'm not saying hearing will become perfect. No, hearing will improve. It will not become 100% correct better. Okay. Now this surgery is called columellar tympanoplasty, and that's the question. Type 3 tympanoplasty is called columellar tympanoplasty. Okay, we're fine. So what we do, we touch the graft of the tympanic membrane with the stay piece directly so that the sound conduction continuity is maintained. I'm not saying hearing will become perfect. Hearing will become better. Okay. So columellar tympanoplasty in the bracket, I don't type 3. No, it will not lead to stable. Otosclerosis is a different disease, Ria. This is MCQ beta. Columellar tympanoplasty is type 3 beta. Type 1, type 2, type 3, type 4. Now, the third disease is mastoiditis. I told you, titus media, if from middle ear to mastoiditis. Can you see beautiful mastoid hair cell? These are mucosa-lined hollow cavities, and all are interconnected. Okay, it's infection of mastoid hair cell. ये including word कहाँ से आया मुझे नहीं पता भाई. ये मैंने खुद टाइप किया है. मे भी हो सकता है टाइप करते करते ये JD का इफेक्ट हो. More than 120 ml. Maybe I'm not sure about it. Maybe मैंने खुद टाइप किया मुझे पता होना चाहिए, but कई बार नहीं ध्यान रहता बेटा, है ना? Fine. So it's infection of, please cut the word, the including. Okay. It's a complication of ASOM and CSOM. Now please see, beta, please see. This is the pus coming from here. Beta. The same pus has gone from adytus to antrum, and all the air cells have got it. One student asked me in the class, sir, what is this JD? मैंने बोला कभी हवेली पे आना क्लास पेपर के बाद तो बताऊंगा, ऐसे नहीं है ना. It's a complicated ASM, CSM. Okay. Now, so the all cell got infected, and mucosa line interconnected, and the cells start making pus. Chief complaint, pain behind pinna. Pain behind pinna. Number 2, profuse ear discharge. Profuse ear discharge. Why profuse? Too much of pus is coming. Why? All the mastoid cells are making pus now. Every cell has become pus factory. Earlier, only middle ear was making pus. Pehle sirf middle ear pus bana raha tha. Middle ear also millimeter only. Now all the cells are making pus. Too much of pus coming. No headache. No spiky fever. No headache. No spiky fever. On examination, number 1, mastoid surface found to be. Dr. Dhawan, I have pain behind my pinna. Dr. Dhawan will say behind the you have to do the inspection. When I see the ear like the behind the pinna, the mastoid surface is smooth, red and shining. This is called ironing of mastoid surface. It is first sign of mastoiditis. This one. Okay. And this is non-pitting edema. It is non-pitting edema, beta. Yeah, there's a perforation. Definitely, beta. It's a complication of ASOM and CSOM. Definitely. That is there, beta. This is first person. If you see over here, please see. If you see over here, there's a perforation, beta. Okay, that is there. Now, pus is coming from there. Okay. Now that infection has gone to the mastoid, mastoiditis. Okay. Now, number 2, mastoid tenderness positive. What is tenderness? Pain on touching. What is tenderness? Pain on touching. Pain is a symptom. Dr. Dhawan, I have pain here. If I touch, patient has pain, that is tenderness is a sign. Pain is a symptom of the patient. Tenderness, doctor checks. When he touches, there is pain, tenderness. Number 3, reservoir sign and lighthouse sign. I told you, the patient complains of profuse ear discharge. Why? Because too much of pus is coming from the, mastoid to middle ear. On cleaning, the discharge fills immediately again. This is called reservoir sign. As if there is a reservoir of pus in the mastoid. Reservoir sign. Okay. Pus is continuously flowing from mastoid to middle ear. I'm telling you, there's a factory of pus in the mastoid that is continuously making pus and sending it to the middle ear, and this pus is flowing like a river. This is called lighthouse sign. Pus flows like river. Plus flows like river, beta. Pus flows like river. Let me show you, beta. This is the tympanic membrane. The black thing is the perforation in the tympanic membrane. The fluid is the pus over there. The pus is flowing like a river from mastoid to middle ear and out. The pus is continuously moving like a river. So the otoscope, look at me, if I see with the otoscope this patient ear right now, the light of the otoscope falling on the pus, that light spot will also keep moving. Why? Because the pus is moving like a river. When the pus moves, the otoscope light spot falling on the pus also moves. And that is called lighthouse sign. The seashore has a lighthouse. People from Chennai, Pondicherry, they'll be knowing this lighthouses. Lighthouse light keep twinkling like that, oscillating like that. As a light hilti rehti na, same please see. The light pus is also moving, the light is also moving because the pus is moving like a river. Okay. Now, what is reservoir sign? I told you, pus is over in quantity. All cells of mastoid are making pus, so profuse ear discharge. If you take time to clear this, you are my intern, I tell you, please clear this ear discharge. Clean it. You cleaned the ear properly, 10 minutes time you took. By the time you brought the patient to my room to show, you were so happy. मैंने अच्छा साफ किया. By the time you came to my room, more pus came over there. Pus का साफ करते ही दोबारा भर जाना, रिजर्वायर साइन. ऐसे लगता है मिडल ईयर के पीछे मैस्टोइड के अंदर एक रिजर्वायर बन गया पस का, जो लगातार सप्लाई कर रहा है. In English, there is a moment you clean the pus, more pus comes. It appears as if there is a reservoir of pus in the mastoid. Okay, fine. We'll do that. Wait. We'll do everything. Investigation. X-ray mastoid, Schuller's rule. Yes, you are right, Buddha. Pus is coming in pulsatile manner. Okay. This is a Schuller view. Anybody, what was the name of view for sinuses yesterday? Waters view, Buddha. So you have two views for ENT. For sinus, you order water view. As a doctor should know. For ear, you order Schuller's view. Treatment is surgery called cortical mastoidectomy. Let us clear the mastoid cortex. Please see. Let us clear the mastoid cortex. Can you see? Doctor has cleared all the mastoid cortex cells. He has removed all the mastoid cortex cells. Cortical mastoidectomy. Let us clear the mastoid cortex with the surgery. This is also called as Schwartz operation. Schwartz operation. How we do it? Schwartz operation. SCHWART. Schwartz operation. Schwartz operation. If you have this question running in your mind कि ये भाई ये प्रोग्राम कब खत्म होने वाला है और कब जाके हम लोग छूट पाएंगे इस पूरे से, मतलब लगभग 7:35 to 7:40 के बीच में विल फिनिश द क्लास. 5 मिनट मस्ती मारेंगे, 7:45 तक यू विल बी डन. दैट्स द प्लान, है ना. कई लोगों को नहीं तो फिर वो कीड़ा काटता रहता है कि कब सर ये ऐसा नहीं पूरी किताब पढ़ाएंगे आज. नहीं, इतना क्रूर नहीं हूं मैं. श्वार्ट्ज ऑपरेशन थोड़ा स्ट्रिक्ट हूं, बट लेकिन तुम्हारे भले के लिए कुछ पढ़ लो. पता नहीं ये श्वार्ट्ज ऑपरेशन क्वेश्चन आया था, पता है. श्वार्ट्ज ऑपरेशन इज और चारों मैच करने थे. कॉर्टिकल मैस्टेक्टमी. ओके, तो कैसे करते बेटा? आई एम सो सॉरी. क्या करूं भाई, आधी दूरी नॉलेज. कंट्री एम्बेसडर नहीं बनाना तुम्हें ना, तुम्हें अच्छे डॉक्टर बनाना है. इधर देखो, हाउ वी डू इट. एनीबडी, व्हाट इज द नेम ऑफ दिस रिट्रैक्टर? What is the name of this retractor? Mollison self-retaining mastoid retractor. Remember, can you see retractor there? Mollison self-retaining mastoid retractor. Chalo. Now, it's a cutting bar. We use it Use it like that. Okay, very good. Cortical mastodectomy. Mastoid cortex ki safai. How we do that? Think like a surgeon, beta. How we do that, beta? Like a drill. With a cutting drill. We drill all the cells one by one. We clear all the mastoid cortex of all the ear cells, beta. All the ear cells are there. Anybody tell me, if you have to clear all the mastoid cortex cell, which cell would you find first of all? Anybody? Yes, mastoid will be empty, beta. No problem with that. Anybody? What is the first cell would you find out? You have to clear all the mastoid cortex cell one by one. Which is the first cell would you find out? As a surgeon, think like a surgeon. First cell to be located during mastoid surgery is anybody? Is what? Is what, beta? Antrum. Very good, beta. Because antrum is constant and largest cell. Most largest cell. Okay. Now how to find the antrum? Next page, beta. Next page. How to find the antrum, beta? The surgeon's landmark, right, beta? Surgeon's landmark for antrum is McEwen triangle or suprameatal triangle. What is suprameatal? Above EAC. Above the EAC, beta. Supra matlab above, meatal matlab exonotric in suprameatal triangle. Now, please see. This is a triangle, beta. And we know this is exonotric canal. Okay. This triangle is called, McEwen's triangle or suprameatal. What is suprameatal, beta? Above the EAC. It is landmark for mastoid antrum. Okay, landmark for mastoid antrum. Landmark for mastoid antrum. That is classic. I just love it. So landmark for mastoid antrum is McEwen triangle or suprameatal triangle. If you drill in this area, you'll find the antrum. But out of thousands of cases, in one case, even if you drill in this area, you don't find the antrum. Those people have an embryological problem called corner septum. Now, corner septum is seen in some people during mastoid surgery. It's embryological error, anatomical variation. It is due to persistence of petrosquamous suture. It is due to persistence of petrosquamous suture. Okay. It lead to difficulty in finding the antrum for surgery. Okay. So some people have corner septum. It's embryological error. The main question of NEET PG is, it is due to persistence of which suture? Petrosquamous suture. This can be asked in embryology, anatomy, ENT, surgery also. Okay, fine. Now, if you don't treat mastoiditis, please see, this is mastoid, beta. It is full of pus. If you don't do the surgery, the pus will rupture the mastoid and will come out and will make the abscess. This is the commonest abscess. Please see. Next, untreated mastoiditis can lead to abscess formation at 3 sites. Number 1, most common is mastoid abscess, which is post-auricular. This is most common, beta. Post-auricular mastoid abscess. Mastoid abscess. Number 2, beta. Look at me. This is your mastoid, beta. M for mastoid. And I'm sure you know there's a big muscle attached. Anybody, what is the name of this muscle? Everybody, tell me, what is the name of this muscle? This muscle is what, beta? Sternocleidomastoid. And what is the name of this muscle, beta? The digastric posterior belly, beta. You know digastric muscle? So if the pus comes along this sternocleidomastoid, this is Bizold abscess. If pus comes along this digastric, it is Sitley's abscess. Okay, but fine. Along sternocleidomastoid is Bizold abscess. Along digastric is Sitley's abscess. If one word you don't want to forget about this question is Bizold abscess. This is your NEET PG question. We're gonna find. So Bizold is important. I hope you understand now. If the pus comes down along this muscle is Bizold. Sternocleidomastoid. Along digastric, posterior belly, it's Sitley's abscess. Chalo. Let me summarize the main point of mastoiditis for you. Everybody. Now please see. Everybody hear me now. Dimag khol ke suno, saath saath. Everybody hear me. Chalo. Summary of mastoiditis. It's a complication of ASOM or CSOM. Patient will be having pain behind pinna and discharge of the ear will be now profuse, but no headache, no spiky fever is there. The first sign of mastoiditis is ironing of mastoid surface, which means the surface is smooth, red and shiny. Number 2, tenderness is positive. Number 3, pus fills immediately again after cleaning. It is called a reservoir sign. The pus keeps moving like a river. It gives the lighthouse sign. The name of X-ray view is Schuller's view. The name of surgery is cortical mastoidectomy, also called Schwartz operation. For any mastoid surgery, the first cell to locate is antrum because it is most constant and largest cell. The surgical landmark for antrum is McEwen triangle or suprameatal triangle. But in some people, we are unable to find the antrum because they have got corner septum, which is a variation. It's a remnant of petrosquamous suture, but it is found in some people only. If you don't treat mastoiditis, the abscess can form. Most common abscess is mastoid abscess, which is post-auricular. Number 2, along sternocleidomastoid is called Bizold abscess, and along digastric called Sitley's abscess. Okay. Yes. And now, the last topic. This is what we'll finish here, beta. We'll finish, everybody. This is a ready-made MCQ for you. So get attentive, beta. This is the last topic. 4 disease, erythrocytis or Grady-Negro syndrome. Erythrocytis or Grady. Again, see, the mastoiditis is a 4-page topic, but summary is 1 minute 13 seconds. And you know, bus that will cover the majority of the things about mastoiditis. Now, Grady is equal to Grady-Negro syndrome. It is infection of Petrus apex hair cells. It's a complication of ASM or CSOM. Anybody, Petrus apex has relation with which 2 nerves? Which 2 nerves? Petrus apex has relation with which 2 nerves? 5 and 6. Very good. Now guys, show the pus here. Show the pus here. And show the infection going from here to here. Okay. Now, show the abscess over here. Abscess petrous apex on CT scan. Abscess petrous apex on CT scan. Okay. Now, petrositis or Gradino syndrome. The wonderful thing about this question is, which is your exam question, the mnemonic is very easy. GERD. Gastroesophageal reflux disease. Same here. GERD. GERD. G for Gradino syndrome. E for ear discharge. R for retroorbital pain due to fifth nerve involvement. D for diplopia due to sixth nerve involvement. Once again, beta. G for Gradino syndrome. E for ear discharge. R for retroorbital pain due to fifth nerve involvement. And D for diplopia due to sixth nerve involvement. Let's revise once again. It's important question. Develop an eye of the examiner, beta. Look at this, beta. Ready-made question. Petrositis, his other name is Gradino syndrome. Petrous apex gets infected. And we know there are two nerves over there, fifth and sixth. That's why the syndrome is very interesting. The name of syndrome is Gradino syndrome. G for Gradino. E for ear discharge. R for retroorbital pain due to fifth nerve involvement. D for diplopia due to sixth nerve involvement. And why it's happening? The CT scan shows what? Abscess at petrous apex. Okay, abscess petrous apex. Now, everybody, let me record the 3 triads of ENT, and all 3 are MCI question of FMG paper. Beta. Now, hear me carefully. Revise in your mind. Beta. The 3 triads of ENT. Number 1, Gradino syndrome seen in petrositis. The mnemonic is GERD. G for Gradino syndrome. E for ear discharge. R for retroorbital pain due to fifth nerve involvement. And D for diplopia due to sixth nerve involvement. Number 2, Trotter's triad seen in nasopharyngeal carcinoma, NPC. Its mnemonic is also NPC. N for neuralgia in temporoparietal area due to fifth nerve involvement. P for palatal paralysis due to 10th nerve involvement. And C for conductive hearing loss due to glue ear, all unilateral. The third triad is Samter's triad of allergy. Number 1 is ethmoidal polyp, which is the allergic polyp. Number 2, bronchial asthma, which is intrinsic asthma. Number 3, allergy to anacids, particularly aspirin. So these 3 were write down the 3 triads of ENT. There's 3 triads, 3 MCQs of your important question in 47 seconds. Beta. है ना? जब भी टाइम मिला कार में कुछ चीजें रिवाइज होती रहेंगी बेटा. ऐसे ही तो पास होते हैं लोग, ऊपर से नहीं उतरते. तुम्हारे मेरे जैसे लोग ही पास होते हैं बेटा. ऐसे ही पास होंगे हम. याद रखना बेटा. ऊपर वाले चाह, इट्स इवनिंग टाइम, लेट्स प्रे, मे वी पास, मे आवर फ्रेंड्स आल्सो पास, मे माय हार्ड वर्क बी ब्लेस्ड. मैं जितना भी काम कर पाया हूं मैं करता रहूंगा. पता नहीं अच्छा है, बुरा है, पूरा है, अधूरा है, मुझे नहीं पता. प्लीज ब्लेस माय हार्ड वर्क. प्लीज ब्लेस द हार्ड वर्क माय फ्रेंड्स आल्सो बेटा. क्रिएट जनरल वेलबींग फीलिंग रादर देन ओवर कॉन्फिडेंस कि पास होके दिखाएंगे. पूरी मेहनत करते हैं, ऊपर वाला देखते हैं क्या करता है ना बेटा. फाइन. नाउ गाइस, that's the end of today's session. Tomorrow we have, like, I was hoping to go a little bit 2 more topics, but कोई बात नहीं, कल देखते हैं क्या होता है. We'll see. Now, as promised, how will I get to know that you are dancing? How many of you are ready to dance? Literally dance and stand up and dance. ऐसे नहीं कि मतलब बैठे हुए देख रहे हैं बैठ के. बात कैसे पता लगेगा? कोई ऐसा बंदा है जो छोटे मोटे अपने वीडियो डाल सकता हो? इसमें एक बटन होता है ना वीडियो वाला, देखते कितने लोग डाल सकते हैं. रेडी? गाना हो जाए. गाने का नहीं भाई, गला देखो. मैं इमरान हाशमी कौन सा गाना होता है भाई? मुझे बताना. आवाज आ रही है?
ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਜਿੱਥੇ ਚਰਚਾ ਸੀ ਕਿਤੇ ਯਾਰਾਂ ਵਾਲੀ ਟਾਣੀ ਦਾ ਜਿੱਥੇ ਖਾਬ ਸਜਾਇਆ ਮੈਂ ਸੀ ਮੇਰੀ ਰਾਣੀ ਦਾ ਜਿੱਥੇ ਚਰਚਾ ਸੀ ਕਿਤੇ ਯਾਰਾਂ ਵਾਲੀ ਟਾਣੀ ਦਾ ਜਿੱਥੇ ਖਾਬ ਸਜਾਇਆ ਮੈਂ ਸੀ ਮੇਰੀ ਰਾਣੀ ਦਾ ਜਿੱਥੇ ਹੱਸੇ ਖੇਡੇ ਕਦੇ ਕਦੇ ਅਸੀਂ ਲੜਦੇ ਸੀ ਮੈਂ ਫਿਰ ਦੁਬਾਰਾ ਉਹੀ ਜ਼ਿੰਦਗੀ ਜੀਣੀ ਐ ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਹੋਸਟਲ ਵਾਲਾ ਕਮਰਾ ਦੇ ਦਿਓ ਜੀ ਮੇਰਾ ਯਾਰਾਂ ਨਾਲ ਉੱਥੇ ਦਾਰੂ ਪੀਣੀ ਐ ਮੈਨੂੰ ਇੱਕ ਦਿਨ ਦੇ ਲਈ ਹੋਸਟਲ ਵਾਲਾ ਕਮਰਾ ਦੇ ਦਿਓ ਜੀ ਮੇਰਾ ਯਾਰਾਂ ਨਾਲ ਉੱਥੇ ਦਾਰੂ ਪੀਣੀ ਐ 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 ਤੂੰ ਹੋਸਟਲ ਵਾਲੀ ਛੱਤ ਤੇ ਆਵੇਂ ਵਾਲ ਸੁਕਾਉਣ ਕੁੜੇ ਤੇਰੇ ਆਲੀ ਆ ਗਈ ਕਹਿ ਕੇ ਮੈਨੂੰ ਯਾਰ ਬੁਲਾਉਣ ਕੁੜੇ ਇਹ ਕੰਡਾ ਕੱਢੀ ਦਾ ਸਪੀਕਰਾਂ ਤੇ ਬੋਲ ਕੇ ਲੈ ਕੇ ਜੁੱਤੀ ਥੱਲੇ ਜ਼ਿੰਦਗੀ ਦੇ ਬੋਝ ਨੂੰ ਯਾਰ ਲੁੱਟਦੇ ਨੇ ਮੌਜਾਂ ਦਿਲ ਖੋਲ ਕੇ ਲਾ ਕੇ ਤਿੰਨ ਪੈਗ ਬੱਲੀਏ ਪੈਂਦੇ ਪੰਗੜੇ ਗੱਡੀ ਦੀ ਡਿੱਗੀ ਖੋਲ ਕੇ ਨੀ ਲਾ ਕੇ ਤਿੰਨ ਪੈਗ ਬੱਲੀਏ ਪੈਂਦੇ ਪੰਗੜੇ ਗੱਡੀ ਦੀ ਡਿੱਗੀ ਖੋਲ ਕੇ ਰਹਿਣ ਸੀਟ ਥੱਲੇ ਨੱਚਦੀਆਂ ਬੋਤਲਾਂ ਚਾਰ ਰੱਖੀ ਦੇ ਗਲਾਸ ਵਿੱਚ ਕੱਚ ਦੇ ਆੜੀ ਪੱਕਿਆਂ ਦੇ ਨਾਲ ਰੂਦਾਰੀਆਂ ਰੰਗ ਬੰਨ ਤੇ ਰਿਕਾਰਡ ਦੇਸੀ ਟੱਚ ਦੇ ਮਜ਼ਾ ਵੱਖਰਾ ਹੀ ਛੱਡ ਗਈ ਮਸ਼ੂਕ ਦਾ ਆਉਂਦਾ ਯਾਰਾਂ ਨਾਲ ਪੀਤੀ ਜੀ ਦੁੱਖ ਬੋਲ ਕੇ ਨੀ ਲਾ ਕੇ ਤਿੰਨ ਪੈਗ ਬੱਲੀਏ ਪੈਂਦੇ ਪੰਗੜੇ ਗੱਡੀ ਦੀ ਡਿੱਗੀ ਖੋਲ ਕੇ ਨੀ ਲਾ ਕੇ ਤਿੰਨ ਪੈਗ ਬੱਲੀਏ ਪੈਂਦੇ ਪੰਗੜੇ ਗੱਡੀ ਦੀ ਡਿੱਗੀ ਖੋਲ ਕੇ
So guys, thank you very much.
ਪੈਗ ਬੱਲੀਏ
Thank you very much. Thank you very much. God bless you. And we'll be meeting again. Thank you very much. May I have your pictures with this kind of, like some anything which you want to share, which you learned, and you would like to share with the, your friends and, your colleagues or your someone, anything which is meaningful, which is actually useful, practical, which you think you would like to share with other people. Share your picture, if you are okay with that, with your name, with some message written on the picture. Don't write it separately. Edit the picture and click a positive picture like that. I know it's a little heavy time for all of us, but, if we work together, we can make it happen together. I know every exam, this is not the last exam, a lot of exams are going to happen after this also. But when people work together, when people work for general well-being of each other, we generally end up really, succeeding together. And the beauty of the FMG exam is we can all succeed together. So let's make a, like some environment which can pull up a lot of FMGs across the country. This is the first exam, will be highest number of FMGs will be appearing, I guess, because a lot of new students came. And unfortunately, last time, a lot of students could not really clarify. That's very painful for us. But let's create a little bit positivity all around. I know it's tough time. I know we have to really have struggle how to study amongst the classes, timing is schedule, everything. But you know what? The whole thing about life is, in spite of all these problems, which we find one by one, we can still really keep our morale high. So the idea is keep the morale high, be a fighter, and keep doing well. So we'll meet again tomorrow morning at 9 o'clock and take the journey of year understanding further. Thank you very much. Good night. Sleep well. Take care. Revise well before you sleep. Thank you very much.